WHO, PAHO, we have the pride to be able to welcome you to this event, academic event, to the seminar Experiences in Voluntary Donation of Services and Organization of Blood Services. Here, organized as part of the activities of celebration for the World Day, the International Day for Blood Donor. This year, it's the 20th anniversary of this very important date with 20 years celebrating generosity. Thank you very much, blood donors. And in Peru is hosting this region for the region of the Americas. This opportunity, we appreciate everyone here with us today. Dr. Juan Antonio Almeida Alcántara, General Director of the General Direction of Donations, Transplants, and Blood Bank of the Ministry of Health in Peru, in representation of the Ministry of Health, and the Executive Director of the organization Health the Regional Advisor of Health Services and Transplants of the Pan American Health Organization.
Asimismo, quisiera darle la
At the
bienvenida
same
a
time,
todos
I would
los
also like to welcome all of the
participantes
participants that are here in person with us in the auditorium of the Andean Community of Nations, as well as those that are connected virtually
de las Américas y de otras partes del mundo.
from different countries. We truly thank the time that you're giving us to be part of this hybrid event where we'll be sharing different experiences that look to promote and provide sustainability to the voluntary donation of blood to be able to get health for everyone. At this time, we invite Dr. Mauricio Beltrán Duran from the PAHO organization, or for them to be able to provide the welcoming words. Thank you very much, Adriana.
Dr. Juan Almeida,
Dr. Juan Almeida, General Director for Donations, Transplant, and Blood Banks of the Ministry of Health, Dr. María del Carmen Dávila, Executive Director of the Hipólito Unanue Cooperation System, Dr. Jose Fuentes Rivera, Executive Director of the Blood Direction of the Ministry of Health. A welcome to each and every one of you on behalf of Dr. Bermija, representative of PAHO in Peru, and as me as a regional advisor for health services and also transplants. Also, in reference to this first time, I would like to greet the panelists that are here with us, and in reference to being able to do this virtually in a regional end, and obviously to all of the participants. As it was said, Peru
Recording in progress.
A algunos países que se postulen a esta celebración con el fin de incentivar y promover la donación de sangre. En este contexto, y cumpliendo 20 años de la promulgación por la Asamblea Mundial de la Salud de la resolución que reconoce este día como el Día Mundial del Donante de Sangre en honor a Carl Steiner, el científico que descubrió los grupos sanguíneos, esta celebración busca agradecer, motivar, instar a todas las organizaciones a promover y a trabajar en pro de la donación voluntaria de sangre. 20 años celebrando la generosidad. Muchas gracias, donantes de sangre. En este contexto de esta celebración, la OPS, en conjunto con el Ministerio de Salud del Perú y el Organismo Regional Andino, han organizado una serie de actividades para conmemorar este día en el Perú y en todo el mundo, a fin de reconocer y dar gracias a las millones de personas de donantes voluntarios de sangre. Dar a conocer los logros y desafíos en la donación de sangre, en los programas y en los sistemas de nuestra región. Poner de relieve la necesidad de la sangre, la necesidad permanente de donaciones periódicas y no remuneradas para lograr un acceso universal. y promover una cultura que fomente la donación periódica. En este marco de la celebración, desarrollamos este seminario regional sobre experiencias en donación voluntaria y organización de servicios de sangre, con la participación de 14 panelistas de diferentes países de nuestra
from
región.
different countries of our region and of outside of our region in order to be able to have different ends, different focuses, different organizations for this promotion of a donation, different ways of being able to get to society.
Les agradecemos participar.
Welcome to each and every one of you. Thank you very much for your participation.
Muchas gracias, doctor
Thank you
Beltrán.
very much,
Ahora, a
Dr.
continuación,
Beltran. We now
pase y
give
damos
you the
nuestra
floor, and we of
bienvenida y
course
le damos la
invite
voz
Dr.
para las palabras por parte
for
de
the opening words on behalf of your entity. Thank you.
Buenos días.
Yes, good
Doctor
morning
Juan
to
Antonio
everyone.
Almeida
Dr.
Alcántara,
Juan Antonio
es
Almeida
director de la
Alcántara,
Dirección General de
General
Donaciones,
Director of the
Trasplantes y
General
Sangre
Entity
del
of
Estado de
Donations,
Salud Pública,
Transplants, and World
ante el
Bank of the Ministry of Health
vicepresidente
of
Pro de
and
Salud, doctor César
Blood
Vázquez.
Bank
Es un
of the
gusto
Ministry of Health of Peru, Dr.
conocerlo
Cesar
y poder
Vasquez. Juan
encontrarnos.
Antonio, again, it is a
Somos
pleasure to meet
ya
here with
algunos
you.
cocodrilos
We
y siempre
are
tenemos
quite old in this
que
path, and of course, it is always nice to be able to
con
meet with
ustedes.
people that are completely committed with this. Also, Dr. Marisa Beltran, Regional Advisor of Blood Services of PAHO, that since day one, we've been able, through Dr. Miriam Alta, we've been quite closely working in reference to this end, which is the donation of
Bienvenido. Y a todos
voluntary
los
donation of blood to all of the attendees and everyone here, which become to the world, to the blood banks, and all of the institutions that are related with the voluntary ends of blood donation. Greetings to all of the professionals, to the public that is connected throughout our diverse platforms. We are here working of Zoom, YouTube, and Facebook. And this is able to get this end in reference to our webinar number 200. We lost the count, 226. And for us, it is a pleasure to be able to have this regional seminar in reference to that one that is able to have the Donors Day, and also we are able to establish this part. For us, it is a pleasure, and we already know this, and in reference to this and together, us to be able to work together, to be able to give the welcome to the scientific event dedicated to the experiences and voluntary reference of blood in the International Day of Blood Donors. This, promoted by the Ministry of Health in Peru, together with OPS, and here this definitely reflects our commitment to be able to reinforce and that promotes certain practices that save lives. The voluntary donation of blood is an act of solidarity. And here, this is fundamental for the construction of resilient health systems. This is an expression that is tangible in reference to being able to establish individuals and in reference to this end. Here, I remember when we would be able to establish this as premature ends, and we will definitely give our centimeters of blood for them. Here, we are able to see that I'm not able to accept donations now, but here I'm not only talking about experiences and knowledge, but also to be able to reinforce this end in reference to cause, and in a specific manner to be able to give our thanks to all of the donors, voluntary donors that are able to contribute in reference to this end, and to be able to see these amounts on a day-to-day basis. Leadership is set in reference to being able to solve issues, provide feedback, and acknowledge. Here, something that is very important that we're also seeing here in the Ministry of Health and
Nuevo
also
con el lema
in
de
reference
María
to the world with
Álvarez
this
es
bank
que
is
reconocer
to
es
be
muy
able to
importante
recognize the
y luego
fact that this
merece
is all
también
very
el aplauso que
important,
merece.
and
Quiero
donors is
reiterar
definitely in
mi
reference to this
agradecimiento a
end.
todos los
Here we would like
donantes
to thank
con
all
los
of
que
the
nuestro
donors
trabajo permite salvar
who
nuestras
are
vidas y
able to
ayudar a la
establish
humanidad.
thousands of lives on an annual
Asimismo,
basis.
reconozco
And
la labor
also, I
incansable de los
recognize
profesionales de la
the
salud de
work that is
nuestros
done by the health
ministerios
professionals
y
of our
aliados
ministries
estratégicos,
and allies,
reconociendo su labor
strategic
fundamental
allies,
en
in
este
reference to
espacio.
being able to provide this.
Invito a cada uno
I
de
invite
ustedes
each
a
one of you
participar activamente en las
to be
discusiones,
able to have an
a
active
proponer
participation in
ideas
discussions,
y a
to be able to
construir
exchange
alianzas
ideas,
con
and to
quienes
create
compartamos nuestro
allies
objetivo
in reference to
común.
being able to work here in our
Garantizar
shared
que
objective, which is
cada
to be able to
paciente que
guarantee
requiera una
that each
transfusión de
patient that
sangre
requires any
pueda
kind of
acceder
a
a
blood
ella
transfusion is
de
able
manera
to have access
oportuna y
to
segura.
this.
Con la
And
convicción de que este evento será un
in a
hito
way
en el
that this event will
fortalecimiento
be a
de
milestone in
acuerdos
the
globales de
reinforcing of the
reconocimiento de origen
voluntary
andina,
donation in the
deseamos
Andean
contar
area. We would
que
like
será
to
de mucho éxito.
hope that you are going to
Una
have a
vez más,
fruitful end.
María
And once
Álvarez
again,
y bienvenidas
you are
a todas
all
las personas
welcome,
que nos
everyone here
acompañan a través
today
de
that
las
is with us
redes
here
sociales
in
en
reference
vivo,
to the
así como quienes se
health
encuentran
network, in reference to
participando
being
por medio
able
de la
to
transmisión de
provide
Zoom
this
y a
end in
todos los
Zoom, and
presentes
also to
en
be
esta
able to
sala de la
see this
comunidad
part
andina,
in
que siempre
reference
presta
to this
y
end,
siempre hace posible que
and to
tengamos
be able to have
eventos del nivel que
events of
vamos a
this
tener.
level that we
Sé
are
que nos
going to
espera
have due
a
to
las
your
donantes una
generosity
persona
by sharing us
poderosa
with this in
de
reference to
colombianos.
this end.
Y como siempre decimos
And
en la
as we all
Organización Mundial de la
know,
Salud,
in the
convenios
Health and
bilaterales
DNA
con
organization,
Bolivia,
Hipólito
Chile,
Unanue, Bolivia,
Colombia,
Chile, Colombia,
Ecuador,
and
Perú y
Ecuador,
Venezuela. Juntos
Peru or
somos más
Venezuela,
fuertes y
together we are
juntos llegamos
stronger,
más
and
lejos.
together
Gracias.
we are able to get further away. Thank you.
Muchas gracias, doctora María del Carmen. Y finalmente, para esta sección
Hello,
protocolar,
and finally for this protocolar section, we are inviting Dr. Juan Antonio Almeida Alcanza in reference to this part of MINSA.
Buenos días.
Hello, good morning. In reference to being able to see this part in the Regional Advisor of Transplants and Blood Donation of the PAHO.
Mucho tiempo trabajando juntos en estos
We've been
temas.
working throughout many years in these topics, trying to always continue in reference to not only Peru, but in the region.
Participantes a nivel de redes,
Participants from the networks and also in reference to being able to establish this part.
En este momento le está llegando de un viaje oficial que este mío fue
Here
al
we are
país.
in reference to this part.
Mañana sí va a acompañar en la ceremonia central, pero hoy día no quería dejar de saludar a todos.
And we wanted to be able to establish all of the participants and greet all of the participants. This seminar of these strategies that are seen here, we are able to see in this end, and we consider that there are some things that are very important for the development of this end.
Ha habido algunos avances.
There has been some progress. In the year 2020, throughout the pandemic, we had only a little bit over 200,000 blood donations in the country. Last year, we were able to get to 480,000 blood donations approximately. Before the pandemic, the percentage would be around 9%. Currently, we are in 25%, and it continues to grow. 28 years ago, the country did not have any uh, bank assurance. How can we assure these banks? Currently, we have over 60% of the banks of the country that have sanitary authorization. We are definitely working in the development and improving the quality of the blood that we have in our country. And that is why for us, when we had the possibility of having this day, the World Day of Blood Donation, the possibility of having this, we were able to see this in our presentation. And we, of course, thank that PAHO has chosen us as the host country. Without anything further to say, I would just like to begin with the opening of this seminar, as we had seen this parts here, in reference to being able to find 20 years of generosity in reference to being able to collaborate with patients. It's been 20 years that we are developing this, and there's nothing further to say than to be able to thank each and every one of the blood donors, which are these anonymous heroes that we have everywhere, that approach hospitals, that throughout the pandemic, they were still donating, that they allowed the country to not have any lack of blood. I think that what is most important thing is to be able to thank all of the donors, and what we are doing throughout these days is not only going to be helping them, but also to be able to help all of our patients in the country. Thank you very much.
Muchas gracias, doctora Almeida.
Thank you
A
very
las tres
much.
autoridades les vamos
To
a
the
invitar,
three
por favor, a
authorities, we are
regresar
going
para poder
to ask them to be
la
able to stand up
fotografía.
so we
Los
can
folders los pueden dejar en el
take the
asiento.
part.
Le
And
orienta a
here we
Janet,
are
por
able to
favor.
orient here in Danielle,
Ahí
please.
está.
Very good.
Primero la cámara de Janet,
First,
por favor, para ir
Janet,
en orden.
so we can go in order.
Luego a la cámara de luz, por favor.
Then
Ahí.
to Luz's camera, please.
Y finalmente la
And
cámara
finally, the one of the Ministry of Health that is here in the bottom.
para el respectivo registro fotográfico.
Thank you for those registers. Thank you.
Listo. Muchísimas gracias a las autoridades.
Thank you to everyone. And if we can please all meet in the auditorium again. And while we give some indications to be able to begin with this section, I'm going to ask for my colleagues to be able to help me by mobilizing the backing and the
para poder continuar.
chairs so we can continue.
Bien, antes de
Very
dar
good.
inicio al programa,
Before
le recordamos
we
encarecidamente
begin
a los
here,
ponentes que
we
nos
would like to
acompañan el
ask
día
the
de
people that
hoy,
are here with us
que también están
today,
conectados
that are
virtualmente,
all connected
puedan presentarse los
virtually,
20
if you
minutos
can
de exposición
please have
acordados
the
y
20
estaremos
minutes set,
dándoles aviso cuando
and
nos
we
queden
will
5
be
minutos
letting you
o
know when we
luego
have
1 minuto.
5 minutes left and then 1 minute left.
Le recordamos al público
Okay, we would like
conectado
to
en Zoom que pueden
remind the
realizar
audience
sus
connected by
consultas y
Zoom that you
comentarios
can
durante la
have all of your
presentación
comments set throughout the
para
presentations
consolidarlas y
in order to be able
resolverlas
to
al final de
consolidate them,
esta
and we will be
primera sesión
approaching
de
them
la
at the
mañana.
end of this first session in the morning.
Del otro lado. Bien, en este momento ya vamos a iniciar
Very
el
good. At this
programa.
time, we are going to
Voy
now
a
begin with the
pedirle a mis
program. I'm going
colegas,
to please ask my
a
colleagues,
Ana
Anna
quizás ahí
Menjivar, if
para
you are there,
comentarnos si
so
tienes
you can
preparada
comment if you have already shared
la presentación, la
the
primera presentación.
the first presentation.
Sí, confirmo.
I confirm, yes.
Ok, entonces
Okay,
un
very
segundito que
good.
está prendiendo por acá el...
1
Listo.
second here.
Entonces vamos a
Okay, very
iniciar dando
good.
paso
We are
al
going
doctor
to
Mauricio Beltrán
begin.
Durán.
Mauricio
Es
Beltrán
biólogo
Duran,
y
he is a
magíster en
microbiologist
biología,
and Colombian
magíster en salud pública de
epidemiologist,
la Universidad de los
Magister in
Andes y
Public Health of the
actualmente, como ya
University of
tenían
the Andes,
presentado,
and currently,
es
as we have already
asesor regional de
presented,
sangre y
he is a regional
trasplantes de
advisor of blood and
APEX
transplants for
OMS.
PAHO
Él presentará el tema
and
Donación
WHO.
Voluntaria de
He will
Sangre,
present
20
the
años de
part in the
celebración del
20
Día
years of
Mundial de
celebration of the World
Donación.
Day of Blood
Adelante, Mauricio.
Donors. Go ahead, Mauricio, you have the floor. Thank you. Thank you very much, Adriana. I'm going to ask the colleagues that are here if they could please start passing the presentation. Thank you. Very good. Well, it is important to mention that blood transfusion is a definitely integrating part as essential and essential medication blood of all of the health systems throughout all of the world to be able to save lives in many cases and improve lives in many patients. And also the supply, the availability, the supply, the suitable supply is the essential component for us to be able to have access to therapy. And the obviously a safe supply very much depends on the voluntary donation of blood. With these understandings, in the year 2005, the World Assembly adopted a resolution that recognizes this date to be able to establish the work of a donor, the function of donors. And these objectives are these ones that you have right here. And that had already been mentioned, of course, at the beginning of this presentation, which in general, throughout all of these 20 years, we've been able to keep the essence, to be able to highlight the function of donors, health systems, recognize the work of society, some people that can donate, and everyone that can donate. There are some people that can donate, others that cannot, and that can be used as promoters, facilitators, communicators, like those people that have the message of the need of blood. Next one, please. And at this time, what has happened? Here we're able to see this part in reference to, thank you very much, blood donors, 20 years, celebrating generosity. We've been changing. We've only brought some of the logos that we've been showing. We've been changing from some ends in reference to some figures that would highlight blood as something that was more symbolic and less closer to people. Here, we've been able to establish this part to be able to show where this comes from in reference to this culture. Next one, please. And this is what has happened for this approximately 20 years. 170 millions of blood units were donated in these 20 years. Approximately 9 million of units in our region only on a yearly basis, which means that we have a very important number of people that at their majority in a voluntary manner have made these donations. Why do we bring this number? In reference to being able to see people that are considered as heroes, that help, that are there. This is basically a very important. Many people in our region, Latin America and the Caribbean. Next one, please. And I wanted to bring only some so we can deliver the message to everyone, of course, to be able to put faces to those 170 million of people today. Well, they're not exactly 170 million people. It's less. The estimates that we currently have are according to the number of 90 to 100 million donors. You know, some ideally what we look is for them to be able to repeat donations. That is a process that we are currently still developing. But these almost 100 million of donors have faces, and these represent many of them in that work, even in pandemic, as it has already been mentioned. Here we have the different messages that we've been given to being able to create awareness in reference to this. Next one, please. And also, we would like to thank all of the people that work and we are in the system, in the health system, from promoters, community promoters, people that collect, people that are in the banks, people that bring the units, doctors that finally are the ones that order, nurses that monitor, and those that start evaluating patients that receive this blood. All of this complexity of the health system that involves thousands of people for the mobilization, and it has involved thousands of people for the mobilization of these 170 million units of blood. Next one. As you've seen, 9 million on an annual basis, 1,700 banks in the region. It's quite complex in reference to the system in the region. And in reference to who are our receptors, where this is finally set, which are the thousands of patients, the millions of patients each year. We have data in reference to our system improving between 3.5 and 5 million people in the region that are benefited of these around 9 million on an annual basis. You see the numbers are very much important in reference to the donors that voluntarily give their information, also the number of people that this blood is destinated to. Only thinking about here the last 20 years, which of course we have many more years in reference to the health services, and we know they have been working more in reference to this session. Next one, please. There has been important progress. We are around almost 50%, 400 something percent in reference to voluntary and in the region. You see here in reference to the different sub-regions of Latin America and the Caribbean. We have the percentage here. And here we have the data that we are able to set and that we are available to have all of this reported in the countries. Next one, please. And this one here, this graph that we are able to see, and it shows what is the rate per 1,000 people. Here, with blood bank, we have an availability in blood, which is basically, it's the most approximate one that we have from this part, the number of units per 1,000 and this is seen in this context. This is our regional average rate. Here, 40 units for countries of high income. For those of medium high income, it's 13, and for countries of medium or low income, it's of 7. This is for a message that we are considering. We've been progressing without a doubt. Next one, please. We've had good progress in risk control. Basically, from the different alternatives that we have to be able to control the infectious agents in the regions for infectious agents, HIV, syphilis, hepatitis B, hepatitis C. Basically, when talking about serology that is implemented, we have many centers with this implementation in these assets and also with these, and so there has been quite good progress. And I believe we have here these systems that have had more progress in this end, as some people would mention, due to HIV, due to the investigation in all of these systems of transfusion in reference to the systems, all of these were changing. Next one. And this is a part of the progress. We are able to see that this has definitely continued to be able to see the zero reactivity. We are able to see this in better practices. We start creating one in reference to the voluntary end. Growing reactivity has been lowering in some of these markers. Here, we are able to establish this apart with the reactivity of having blood donations. And we don't have this part because we have much information that is quite complex, but it's a good approximation of how this has been working in the region in this case. Next one, please. Something that we were talking about, the promotion, donation, and a part that is going to be a part of the seminar in reference to processing. We come from a system where throughout the past years, each hospital is able to solve the needs of blood for patients that they had there. The health systems were transformed and they started to be able to organize networks in the service skills. First, in levels, the patients are able to see different ends of scale of services. And at that same time, also a health pension was actually being able to be seen here in services and blood banks in the world have been changing throughout a time. And we have the creation of the scale of services. Each hospital does not solve their own need, but it generates institutions, blood banks that could be used in the majority of countries. And where we are able to exclusively dedicate to promoting and controlling, processing, and generating distribution networks to be able to take the blood to the hospital institutions. This is a mechanism in a scale manner that is much more cost effective. It's much more efficient for there to be a conversation. And we are able to see here that we have the different institutions of world services that are able to receive the transfusion. Here, we are able to see the migration of this capacity of promoting, collecting, and processing in countries. The number is by country in reference to the largest two sub-regions, Latin America, the Caribbean, that are able to show how in more than 1,000 units, we have 9 countries, and between 5,000 and 6,000 units, we have 8 countries, and more countries are in process of being developed. Not all of them, of course, need to be able to get to this capacity, that we have some specific situations in the specific sub-regions and are able to come to 20,000 units that they possibly don't need to have some analysis for these sub-regions. And of course, here for the analysis of the efficiency of the system. And that is why the second part of this scenario, a regional scenario, has to do with the organization and efficiency of blood services. Next one. And we've talked about progress. Now, there are some challenges, of course, that we do have. Challenges in reference to the policy and resolutions, these approaches to be able to take these two main ones. So number one, the fact that we are able to see to prevent and control, manage risks, but a second one that should be very much linked, which is the main objective, access, of course, that is safe in reference to this end. It would seem to be the same thing in reference to being able to see what is promoted. This comes from the distance, from the point of view of the structure of the system in reference to different strategies, starting from the organization of services.
Y creo que la pandemia además nos dejó
here in reference to being able to see
sacudir el
to be
sistema,
able to work with the system and to be able to the services in reference to consider resources are being infinite, not infinite, and therefore we need to be able to work in how much the system works in reference to being able to see the association, to see how much this is going. Very good. And then thinking in reference to the same part in reference to accesses, and that's where we start to identify the actors in reference to these strategies. Of course, to be able to have access to therapy, it's enough and it's self-sufficient, really, to be able to have these hemo components and to be able to have a global package, plasma plaquettes, to be able to protect the water in reference to the blood, to be able to have a national resource. These are all of the policies and the regulations and how they work. To donors, to be able to protect the donors from the exploitation and prohibit economic benefits in reference to be able to protect health and safety in reference to being able to protect in reference to any kind of infection. And obviously, to be able to see the system, knowing how much this process actually costs, to be able to assure this in the end, that a patient doesn't have to pay and it would have to go place after place, or a family member looking for who is able to donate or who can give them the blood, or even to be able to purchase what they're able to donate so that this service can be provided. That is one of the challenges that we have.
¿Cuánto cuesta incluso la vigilancia? las autorizaciones, ir a supervisar. ¿Cuánto cuesta en un modelo centralizado o en un modelo
How
atomizado?
much it costs.
Esos son costos que uno no
These
los
are
ve en el
costs
sistema
that
y
one
que podrían ser
doesn't
costos
see in the
These
system,
are
and these could
costs
be
that we can
costs that
see,
if
organizamos
we
that are
organize
organized,
them,
and
we can
in reference
use
to
in
being able to see the
promoting and
promotion and
even
also in
in
other
other parts
parts
of the
of the
health
health
system.
system.
Next.
Y entonces empieza uno a ver este esquema que es un poco lo mismo, pero los voy a llevar a la
We
siguiente.
have the
¿Dónde
scheme,
está el sistema nacional?
and we can see where the national system is.
La siguiente.
Next.
Y esto es un poco lo que se ha
And
ido
this is
bosquejando en
what
este nuevo sistema.
has been seen in this new system. So one starts to identify stakeholders. So
A medida que los sistemas se van
in the
escalando,
measure
se
that
van
systems
identificando en redes de
scale
prestación, dos
and
redes
we
importantes de
identify
prestación. Una red de
networks,
servicios
one
de sangre que se
network
dedica a
of blood
promover,
services
colectar, procesar y distribuir.
dedicated to promoting, collecting, and
Y
distributing,
una red que se
and a
dedica
network that is
a
dedicated
almacenar,
to
compatibilizar,
storing, creating
hacer uso racional, hacer
compatibilities, making
auditorías,
rational
hacer
use,
consultas, evaluar
auditing,
los pacientes, seguir los
consultations, assessing,
pacientes.
evaluating, and following
Hasta hace
patients.
unos años
And a few years ago,
es lo mismo.
it used to be the same. The same
Resolvía
hospital would
todos los
resolve
problemas.
all
Buscaba
of the
los
problems.
donantes,
They would
hacía
look
la
for the
promoción,
donors, they would promote,
colectaba, procesaba,
they would
almacenaba,
collect,
compatibilizaba, y
process,
entregaba al paciente. Y
store,
esto
and
ha ido
then give to the
cambiando.
patient. And this
Se
has
escalan los servicios, se
changed.
escalan los
We've
servicios de salud.
scaled the
Muy bien.
services, the different health services, so that
Entonces,
has changed
tenemos dos
eventually.
redes
So we have two networks,
centrales en la prestación del servicio.
two
Y
networks for the
tenemos
provision of the service, and we
dos
have
instancias, dos
two
actores
instances or
en
two
ese sistema,
stakeholders in that system.
que algunos países lo llaman
Some countries call
Sistema
this
Nacional de Sangre, Monitoreo del
the
Sistema Nacional de
National
Sangre, en América
blood
Latina le
system,
llamamos
or
Programa
in Latin
Nacional de
America,
Sangre,
we call
ambos
the
obviamente
national
vinculados a
blood
los
programs.
ministerios de
All of
salud
these are
en
connected to the
todos los
ministries of health in all the
porque es el
cases,
responsable del seguimiento de
because
las
they're
políticas
responsible
públicas.
of following public
Y obviamente
policies. And
las políticas
obviously,
de sangre son políticas públicas.
blood
Es el
policies are public
responsable de
policies,
coordinar con
and they're
los actores,
responsible
de
of
fijar los
coordinating with the
objetivos, de hacer el
different
seguimiento,
stakeholders,
pero también es
defining
el
objectives,
responsable
doing
de ver
follow-up, and also
cuánto le cuesta al
responsible for
sistema
seeing how much
esto que nosotros estamos.
it
Y
is
por el otro
costing the
lado
system. And on the other hand,
está
well, we
las
have
estructuras, están las estructuras que se han
the
ido creando para
structures, the
prevenir,
structures that have been created
vigilar
to
y controlar
prevent,
estos riesgos
surveil,
y tienen
and
que ver
control the
con
risks.
las
And these are
autoridades
related
regulatorias o
to
con el papel regulatorio que
regulatory
tienen los ministerios de
authorities
salud.
or the
Sabemos que
regulatory
la
roles
región,
that ministries of health
buena
have.
parte del
We
sistema
know
de
that
sangre
a good
aún
part of blood systems in the
mantienen
region
dentro del
are still maintained within the
el
ministry,
componente regulatorio o en algunos
the
casos,
regulatory
como
component, and in some
países un poco
cases,
más grandes,
in
han
the
ido
bigger countries, these have
delegándolo
been
en
delegated
otra instancia, obviamente,
to other
estatal,
instances, state
bien sea las
instances.
agencias de
This
control de
can be
medicamentos
different
o
medication
otra
control
instancia
agencies
para
or
ese
other
componente regulatorio.
instances that are in
Y
charge of
obviamente,
regulation.
alguien que se
And
dedique a hacer
obviously, someone
la vigilancia
will be dedicated
sanitaria,
to do
el
health
cumplimiento de las normas,
surveillance
de ver que todo
and
este proceso, como
regulatory
estamos hablando de
compliance,
un
making
proceso
sure
que
that
es
this whole process,
relativamente
that is
complejo desde el punto de
relatively
vista técnico y que
complicated
tiene
from
una
a
serie de
technical
pasos,
point of view and that has a series of steps,
esa verificación sanitaria desde la
the health
autorización a la
verification
verificación es
from
lo que tienen
authorization to
países.
verification
Ahora,
is what they have in many
ese
countries.
carácter de autoridad
Now, that
regulatoria puede estar
regulatory
dentro, en la
authority
mayoría de
character
los países del
in
ministerio
most
o
countries can be
delegado
within the
en las
ministry
diferentes
or
comunidades
delegated
autónomas.
under some
Esto
instances
obviamente
that
va a
I already
depender de la
mentioned, and this will
complejidad del
obviously
país, la
depend on the
capacidad,
complexity of the
el
country, its
desarrollo que tiene cada
capacity,
país en este
the
sentido.
development of the country
Y
too.
un segundo esquema de
And the
evaluación de
second
riesgos
scheme
es
for risk
la
assessment
hemovigilancia, que es la
is
vigilancia epidemiológica
hemosurveillance,
aplicada
and
a
this
los
is
eventos
the
que sucedan con
epidemiological
los
surveillance
donantes,
applied
los
to events with
pacientes,
donors,
incluso
patients,
con el
and even
procesamiento, distribución y demás
processing,
eventos de la sangre.
distribution, and other processes related to the blood.
Eso es un poco lo
This
que
is
marca, obviamente no es tan tácito.
what,
Cuando ustedes vean
well,
los
it's not as
bancos, pues
tacit,
obviamente somos los primeros
but the
controladores
banks
de
are the
riesgos, por supuesto que
first
sí.
ones to control the risks, of course,
Con la
yes, of
práctica
course,
adecuada, con la implementación
with
de los
adequate
estándares de
practices
calidad, con los procesos que hacen desde un donante
implementing
voluntario
standards and
bien
having
seleccionado, bien
processes,
una encuesta bien realizada,
having good
sin tamizaje
surveys,
adecuado, pues son los primeros
doing
en prevenir
adequate
los riesgos, sin duda.
filtering. We, of course,
Pero
are the first ones in
le compete
preventing
al Estado
risks,
monitorearlos
undoubtedly, but the
en este
state will
contexto.
monitor this type of activity.
La siguiente, por favor.
Next, please.
Recientemente, la semana pasada,
Recently,
salió el
last
boletín
week, we saw a bulletin, and I invite you to look at this data. And Blood Supply is a journal that picks up the information that the blood programs in the country send each year. And one would say, okay, 2020, yes, but we're talking about collecting, and this is another challenge that we have in the region, that is collecting information. But not just collecting the information, but also processing the information, and even more importantly, analyzing it. And even more important than that, after analyzing it, making decisions with that information. This is something that since 1990 something, 95, the Pan American Health Organization has been incentivizing the member states to collect, analyze, and obviously, ideally, make decisions based on this information. Next. And I think it's the last one. Undoubtedly, we have, as I mentioned at the beginning, a committed population. We have significant numbers of people there to donate that are committed. So we have had advances in that aspect. We have also some challenges that are also big. Of course, we have to continue working on them, especially the imbalance of blood by economic level would have a different availability and access. I think this is something that we have to address through the services and programs. It is clear that the numbers, the low-income countries have half the access that the high-income countries have, and that is something that we have to work on. Efficiency, of course, we have technical processes that are associated to surveilling risks and monitoring them, and reviewing policies and regulations meant to strengthen governance of the systems. And next, thank you very much. Very kind.
Bueno, muchas gracias
Good
al doctor
morning.
Mauricio Beltrán por
Thank
esta
you very much,
presentación.
Dr. Mauricio Beltrán, for this
A
presentation.
continuación,
Next,
vamos a tener
we are
a
going
la
to
doctora
have
Silvina
Dr.
Cooperman,
Silvina
médica
Cooperman,
argentina, especialista en
Argentinian
pediatría, directora del
doctor,
Banco de Sangre del
pediatrician,
Hospital
and
Garrahan
director
y
of the blood bank
vicepresidenta del
of the
Grupo
Garrahan
Cooperativo
Hospital,
Iberoamericano
and
de
also vice
Medicina
president of the
Transfusional
Ibero-American
para el periodo
Group for
2022
Transfusion Medicine for
2024.
period 2024-2022-2024,
Para ver si es que está
to
escuchándonos.
see
Doctora Silvina,
if
¿está
Dra. Silvina, are you
conectada?
connected?
Hola, buenos días,
Hello.
buenas tardes.
Good morning, good afternoon. I'm
gracias por
here.
la
Thank you very
presentación.
much for the
Perfecto.
introduction.
La doctora va a
Perfect.
presentar
The
el tema
doctor is going
promotores
to talk
comunitarios,
about
Latinoamérica
community
Unida dona sangre
promoters,
y su aporte a la donación
United
voluntaria de sangre.
Latin America donates blood and supports
Muchas
donations.
gracias. Voy a
Thank you
proceder a
very much.
compartir la
I'm going to now
presentación.
share the presentation.
Ustedes me dirán si
And please
se
let
ve
me know if
correctamente.
you can see it correctly.
Sí, se mira correctamente.
Yes, we see it correctly.
Perfecto. Bueno, en
Perfect.
primer lugar quiero agradecer
Well, first of all,
la
I would like to
invitación. Es un
thank
honor para mí
the
participar
organizers for their
este
invitation.
día,
It's an
esta
honor to participate in this
celebración
day
del Día
and
Mundial de
celebration
Donantes
for
de
the Global
Sangre.
Day of blood
Felicitar
donors.
a
I'd
los
like to
hermanos y hermanas
congratulate
de
our
Perú por
brothers and
ser
sisters
la
in
sede
Peru for
este
being
año.
the
Agradezco al Ministerio de Salud, a la
host
Organización
this year. I'd
Panamericana
like
de
to
Salud y al
thank the Ministry
Organismo
of
Mundial de
Health,
Salud
the
por
Pan
la
American Health
invitación
Organization,
al
for
GESIAN
the
para
invitation to
compartir con
HISIAN
ustedes
to share
nuestra
with you
iniciativa de
our
Latinoamérica
initiative
Unida
that
Dona
we
Sangre.
call Latin
Partimos de
America
una
Together Donates Blood.
preocupación,
And we
de
started
la
with a concern,
preocupación
the
del
concern
Estado,
that the
de
state
las donaciones
has
voluntarias en nuestra
related
región.
to
Como
voluntary
bien
donations in our
presentó el
region.
doctor Mauricio
As
Beltrán,
Dr.
recién,
Mauricio
estos datos
Beltran
son
just
recientes,
presented, these are
del
recent data
informe que también el
from
doctor hizo
the
referencia,
report
del
that the
suministro de
doctor
sangre para
also
transfusiones en los
referred
países de
to,
América
which is the
Latina y el
supply of
Caribe.
blood for blood
Y
transfusions in
como
Latin
mencionó
America
el
and the
doctor,
Caribbean. And as the
apenas
doctor
tenemos
says,
la mitad de
we
nuestros
just have
donantes con
half
motivación
of our
voluntaria para venir a
donors
donar,
with
el
a
resto son
voluntary
donantes de reposición y aún la tasa de donación por
disposition,
mil habitantes
and the
dista de
rate
aquellos
of
países que
donation per 1,000 inhabitants is different from the countries that have experience with voluntary donation, and these can go between 25 and 30 donations per 1,000 inhabitants. This concern, this need to continue improving the system is what drove us to propose this reposition a model that requires patients to look for people in their network to donate. Maybe they need a chemotherapy or a transfusion treatment. And it is a system that is based on mainly the fact that we don't have sufficient blood. It is a system that waits for the patient to bring their donor to satisfy the needs that the patient has. It is a system the patient is waiting for the blood and not the blood being there available for the patient. And obviously, as Dr. Beltran showed, the motivation to replace makes that blood safety is lesser with an increase of transmitting some diseases through transfusion, and these units, well, all of this leads the system to be very ineffective, as the doctor mentioned before. So all of these concerns that are the concerns that we who work in blood services have, we working with voluntary donors and also community promoters, led us to design an activity that allows us to go from training to implementation, something that allows us to apply and to have an ecosystem to share experiences and knowledges so that we can end with a blood collection drive. One of the first premises in United Latin America Donates Blood is integrating the system. We have the Pan American Health Organization, we have the national health programs, we have blood services, we also have scientific societies, community promoters, and blood donors. We have to bring them all into an adequate context so that we can change the donation culture, so that we can change the work culture within the blood services, so that we can have a model for blood donation that is 100% voluntary. United Latin America Donates Blood is based on 4 premises. The first one is the recognition of the role of the community promoter as a stakeholder in the blood services or blood banks in anything related to the reach or the promotion of voluntary donation, organizing, educational actions, and also external blood drives. Premise number 2 is bringing the blood bank to the community. So making donation easier, bringing the blood banks from the hospitals to where the people are. This can be universities, schools, companies, municipalities, and other types of institutions, recreational institutions. So this makes it possible to donate. The third premise is the implementation and good practices for caring for donors. It's not just protecting the health of the person that in an altruistic way is doing something for others and exposing their health in some way, but also it's a strategy that allows for loyalties, for this creation of loyalties. The fourth premise is about professional communication strategies so that we can have a good dissemination and promotion of donation programs. United Latin America Donates Blood has had 3 versions so far. We have the annual planning. In general, we began with meetings in August of each year. I think there is a mic.
Gracias.
Thank you.
Creo que están pasando bien las diapositivas.
I think that you are able to see the slides, right? Can you confirm?
Sí, todo perfecto.
Yes, it's all good.
Gracias, Ana.
Thank you,
Entonces,
Anna.
retomo contándoles
So I'll
que
go
nosotros
back to
tenemos
tell you
una
that we
planificación
have
anual que
an
tiene que
annual
ver con
planning
estas
that is related
reuniones de
to
capacitación
the
puesta a punto de
training
todos los
meetings
conocimientos necesarios
for
para
all the
poder
necessary knowledge to
mantener
be
el
able to
sistema de donación
maintain
voluntaria
a
en el que
voluntary donation
participan,
system where we have the
como mencioné
participation,
anteriormente,
as I
profesionales de los
mentioned
bancos de sangre
previously,
en las
blood
mismas
professionals in
reuniones
the same
que
meetings
tienen los
that
donantes voluntarios, los
where you
promotores
have
y
the
los organizadores de
donors,
pruebas
the
externas. Entonces,
organizers,
en
and the
los
blood
junios
drive
empezamos a
professionals.
diseñar
So we
cómo va
started
a
to
ser el
design
mensaje de
and
cada
see what
año.
the message was
Solicitamos el
going to be
apoyo
like for
a
each
la
year. We
Organización
asked it for
Panamericana de la
support
Salud
from the
y
Pan
luego
American Health
comenzamos
Organization.
a
And then
convocar a
we
las
started
duplas.
to
¿Y a qué
uh,
llamamos duplas? A
call
los
the
bancos de
duplas. What
sangre,
do we call
servicios de
duplas?
sangre
The
que
blood service or
tiene y
blood
se
bank that
inscribe como
has
un
and is
promotor
registered
comunitario de la
with a
donación de sangre.
community
Tenemos
promoter
las
for
reuniones
blood
de
donation.
capacitación
We
y de
have training
compartir
meetings,
experiencias
we
y
share
luego cada
experiences, and
diciembre,
then
en
each
general es el
December,
segundo jueves
generally the
de
second
diciembre de cada
Thursday
año,
of
y lo
December of each
organizamos
year,
estratégicamente porque
and
es
we
un
organize it
momento
strategically
crítico
because
para
this is
todos
a
los servicios de
critical
sangre en los
morning for
cuales
all
después
blood
vienen
services.
feriados o días
After that,
festivos
there are usually
y el
holidays,
inventario puede
and
estar
the
descendiendo.
inventory can go down.
Tenemos tres etapas
We
y esa
have
es la
three
etapa
stages:
precolecta, la
the
etapa de colecta
pre-collection
y la etapa
stage, the collection stage, and the
post-campaña, tanto
post-collection,
los servicios de
post-campaign
sangre,
stage,
centros regionales de hemoterapia, hemocentro, como dije recién,
and
se
bringing
inscriben
the
con promotores
people
comunitarios
register
a
with
través de
the
la
community
página de
promoters through a
Fundación
web page.
Presión. Una de las
One of the
actividades principales
main
que nos
activities
convocan,
that
como expresé, es la
bring us
capacitación para
together is
acción,
training
capacitación
for
para la
action, training
transformación,
for
poner en
transformation,
acción todos los aprendizajes compartidos que tenemos
applying
durante el
all
año.
the
Tenemos
learned lessons
5
for the
reuniones
year,
anuales de
and we have 5
capacitación
training
y
meetings
de
a year, and
coordinación.
coordination,
Son los sábados a la
and
mañana, son
these are
momentos
Saturdays
de
morning,
mucho
and they
aprendizaje, de mucha
are
reflexión
moments to learn
compartida
and
de
have a shared
todos en el
reflection
ecosistema de la
uh,
donación de sangre, están
for
escuchando
of
el
the
mismo mensaje.
ecosystem,
En
and
general
everyone hearing the
comenzamos con
same
una
message.
encuesta
And
preguntando
generally, we start with a survey
al
asking
equipo de
the
qué
team
les gustaría o qué nos
what
gustaría aprender este
they would
año.
like to
Y estos
learn
son los
about this
temas que
year. And
surgen
these are the topics that
permanentemente,
usually
son los
come
temas
up.
que abordamos con
These are the topics
expertos
that we
y con
address with
expertas que
experts
trabajan en servicios
that
de sangre,
work
que
on
trabajan
blood
como
services and that
consultores.
work as
Los
consultants.
mismos promotores
The
comunitarios y
same
donantes
community
también dan
promoters and donors
nuestras
also
capacitaciones. Y hablamos de
go
estrategias de
provide
convocatoria, de criterios de profundidad de
trainings.
datos,
We have
de
already
sistemas de
talked about
gestión
the
de
open
calidad en el
calls and
proceso
the
de
different
donación, cómo
quality
organizamos las
systems for
colectas
donation
externas,
systems,
todo el
how we
proceso de
organize the
vigilancia.
blood drives, the
Compartimos
hemo
experiencias
surveillance
exitosas para
processes. We
aprender de
share our
todos y
successful
para poder
experiences so
evitar
that we can
cometer
learn
errores
from
que
others
quizás
and so that we
cometeríamos
can
cuando
avoid
empezaban en este
mistakes that
camino.
others made maybe
Nos
when they started
animamos a
on this
contar
path.
con
And
problemas y
we also
resolverlos.
talk about
Hablamos de
problems
gestión
to
de
try to resolve
inventario
them.
y
We talk
inventario
about the
y
effective
tenemos
management of
al
inventory.
final
And at the end of
de estas reuniones
these
una
meetings,
masterclass
we
que
have
hicimos
a
nosotros de
master
respecto
class,
a cómo
and
vamos a
we do
comunicar
it.
ese día. ¿Por
We
qué?
talk about how we're going to
Porque
communicate
una
that day. Why?
de las
Because one of the
principales
main
actividades o
activities
objetivos que tenemos con
or
Latinoamérica
goals
Aliados
that
de
we
Sangre
have
es
through United Latin
siempre
America Donates
amplificar
Blood
nuestra
is
voz a
to
toda Latinoamérica, ser
amplify
una
our
caja
voice
de
to all of Latin
resonancia
America
para la
in
promoción de la
Latin America
donación. En
and to
eso
promote
tenemos que
donation.
estar muy
And for
alineados
this,
en
we have to be
cómo y
aligned in
qué
how
comunicamos.
and what we are
Entonces
communicating.
compartimos
So we
objetivamente
share
una parrilla de contenido en donde
a
sabemos
content where
mes
we
a mes,
know
momento
month
a
after
momento, qué
month and
tenemos que
moment after
compartir,
moment
con qué
what it is that
mensaje
we have to
compartir.
share with what
Y este
message.
es un ejemplo
And this
de
is an
nuestra parrilla
example
de
of
de
our
enero
grid
hasta que
of
llega la
contents.
semana previa y hasta el
And then
mismo
you have the
día de
prior
la
week and the
donación de
day
sangre
of
y
the
esta
blood
colecta
drive. And
multitudinaria. En la etapa precolecta
so
también
in the
colecta y la
pre
planificación de la colecta, esto está
collection
en la etapa que
stage,
estamos
we have the planning.
finalizando,
This
donde
is
cada
in the
banco de sangre, servicio de
GCI
sangre va cargando
AMT
los datos
page and
respecto a
or site.
en qué ciudad va a ser
And
la
this
colecta,
is
cuál
the data about
es
the
el
city
lugar
that the blood
de
drive is going to
dirección, en
happen
qué
to,
horario se va a
and
atender, quién es
the
el promotor
address, the
comunitario, cuál es el
schedule,
contacto
who the
y
community promoter is, the contact
para,
point.
digamos, como mensaje, como
And as a message, as a protocol, we insist that we prefer to have shifts so that we can predict the inventory, so that we can predict the number of people that we need to attend, and so that we can avoid delays, and so that this can be done with the least wait time possible. And when we have the day, here we have the flyers of the three experiences that we've had: the 16th of December of 2021, December 15th of 2022, and 14th of 2023. This is a moment for celebration. We all share what is happening in these sites. We generally have a lot of support from the national programs. There's press, there's a lot of participation in social media, and this means that the collection is not just effective for that day, but the following day, people who know this is happening are going to may have extra motivation to donate blood. When we have beautiful things, we organize teaching activities, the blood banks uh, celebrate. There's a lot of work in adapting the sites and in recognizing the donors through one message that day, and we do that throughout the continent. And then we have the post-collection stage where we survey the collection services, the community promoters. We also have a photo bank where you can find the videos and the pictures of the day. And we also provide participation certificates as a recognition of blood services and community promoters that are participating. When we see the numbers, this is what we saw in 2021. We had 17 countries participated, 84 cities, 143 institutions, and 151 collection sites. Why? Because there are some institutions that have more than one site on the day. And we worked with 13,287 donors. These are the countries that were represented. Ecuador didn't participate that year, they participated the next year. In 2022, we increased the number of institutions, yes, in 17 countries because Nicaragua did not participate that year, but Ecuador did. We had 84 cities, 239 institutions, 151 sites, and 13,000 plus donors. And we grew exponentially for 2023, and Colombia participated through with all its blood banks throughout the country. We had 16 countries because in this case we did not have neither Ecuador nor Cuba. No, in 92 cities, 271 institutions, 321 simultaneous collection sites, and 20,864 blood donors. And these are the years compared to one another. We have 2023, we grew, and we hope that we can continue growing for 2024. What are the lessons learned? We learned that it is important to have an integrated system with a central level with the different blood divisions, the different blood banks, health promoters, and donors all aligned with one single message and learning so that we can have continuous improvement. And we value the work in dupla or together. We have to have a community promoter as a counterpart and part of the team, joining the blood bank team, and that we need to continue training. And we learned that a good strategy is to not go with donors that come spontaneously, but those who have reservations or a shift, and that we need to make communications more professional. We should have professionals with experience and expertise in communication, conveying the importance of blood donations and the wonderful experience that it is to be together with one single message throughout the continent, understanding that this is the only experience that is sustainable in time. We also know that we have some weaknesses in the blood banks. We know that most blood banks have specific teams to promote blood donations, but we still have a lot of problems with reporting. We would like to know other data about the donations, but we're still not maybe sufficiently mature, or maybe we don't have the necessary tools to collect the experiences of the donors, and maybe we have to improve there. And something else that is still needs to be formalized, and that is the formal uh, thanks, and also hemosurveillance. So all of this led us last year to formally recognize within the cooperative group, we recognize the community promoters as members of GCIMT. So I'm going to end my presentation here. I feel gratitude towards all the people who joined this initiative, and of course, to our donors and community promoters on their day. So thank you very much.
Yo no estoy escuchando, no sé si está muteado el audio de la
I don't
sala.
know if the room's audio is muted, or if I don't
No,
really
no
know
se
if they're asking a
escucha.
question.
A los
Yes, it can't
ponentes
be
de
heard
sala,
in
por
the room.
favor, revisar
To the
el audio.
colleagues in the room, please check the audio.
Sí, efectivamente el audio de la sala está muteado.
Yes, indeed, the room seems to be muted.
Ya estoy dando aviso.
I will let them know.
Hablando que Perú el 14 de junio también tiene la donatona, que inicio de campaña de donación de carne. Estamos bastante alegres porque
We're very happy because
ha sido inundado de donantes. Están colectando sangre. El día de ayer, 14 universidades.
today and yesterday, the universities and the different sites in the country were doing blood drives. So that means that we don't just have to say it, but we also have to practice it. Now, in the case of Peru, one of the most important things is that we have gone through a difficult stage, as you know, with COVID. And during COVID, they practically closed down not just the hospitals, but also the homes. And you couldn't go by. So after the shop, so you couldn't even go by. And this was difficult because obviously the hospitals and people were afraid to go because they thought they were going to get sick. In Peru, that threat was an opportunity, and now we're going to tell you why it became an opportunity. But aside, we also have drawn a rule or like regulation, and it says that blood is a public asset that is very important, and I think that we are pointing that out. We have regulated the systems of sustainability. We've seen how this is going to be working through a centralized model and obviously looking for efficiencies. This is something we will be centralizing this in Lima, and Lima consumes 60% of the blood in Peru. And the intervention
las condiciones y la seguridad.
and that's going to improve conditions and security. In a minute, I would like to tell you about my experience. I have more than 30 years working in a blood bank, and Being right now in the blood bank program is a challenge because the comfort of sitting and waiting for donors demanding that they deposit blood because there's people crying because there's a lack of blood, and blood trafficking is a gap. If we were able to get 100% voluntary donations, we would be able to reduce the gap and we would solve the problem. But that is not what we want many times, and I think that creates some resistance. Recently, we went through a stage of authorizing the blood banks after 25 years, and there was a lot of resistance. Today, we're at 70% of authorizations, and we have even removed some authorizations when they're not meeting with the standards. Why? Because above all, we have to hold the person in life, the life. So under that criteria, we started to develop a new model for work. And the new working model is to leave that comfort of the blood banks and go towards the donors, where the donors are. This is a strategy that has been very useful, and I would like to show you the experiences that we have seen.
Therefore, what we need to do is to be able to work on a model and to be able to have this more academic. We cannot do things in an emotional manner because emotion, in reference to the adrenaline, and to be able to establish a plan that generates objectives, strategies and objectives.
Y obviamente IS.
And obviously here where we see this in this triangle, we have 3 points: the blood banks, the population, and the promoters. If we don't have promoters, then obviously we're not going to be able to work with the blood banks and the population, and these promoters need to be a part of the civil society. This needs to be understood that the responsibility of blood is not for the Ministry of Health. Blood is not in the hospitals, blood is in the population. And if the population doesn't donate, then there's not any blood. It's just as simple as that. But that next is what we still need to work on. We've been working on developing this over 1,000 promoters, advocates in the country, in order for them to be able to link the blood banks with the population. Next slide, please. And this strategy has passed from first formalizing the day in which the campaigns are beginning, which is the Donate 10. We have here an elderly person that is actually a parent, a father that has over 170 donations throughout his life. And it's quite spectacular. And here we need to be able to establish this. This is part of not only being able to carry out the activities to be able to promote the blood donation. Under this criteria, it's to be able to establish strategies and to be able to have a multidisciplinary approach. And these strategies in the pandemic, they were quite interesting to say the least. People were afraid of going to hospitals, and blood banks, well, are in hospitals, so the blood banks had no blood. What is to be done in these cases? Well, we first said what was in the regulation, which is the hematic structure. These are not campaigns that we carried out. No, there are permanent places where blood is collected. What did we do? We had a joint venture, a strategic alliance done with the private companies, in this case, Cencosud, and we would place different tents in the places where the malls were at, and here we will donate the blood, and the response was excellent. People started donating blood, and in this case, in a specific crisis, we had blood. And I remember that we had Uber drivers that would offer discounts to people that donated blood without us having asked them to do this. And I think that the solidarity that we saw is quite contagious, and that definitely generated that we would need to mobilize more groups of blood banks. Next one, please.
Y estos fueron los diversos
And these were the diverse locations in the country where there has been the collection of blood. And it's not only something that has to do with the fact that we need to donate blood, but we need to promote the donation of blood. We would say that there are three groups of under 18 years of old, 18 to 60 and over 60 years of age. The most strategic ones are the ones that are older than 60 because they can promote voluntary donation. Many times, some of them are retired already, and they would say, how can we help you? I have time. I have spare time. So they can be excellent promoters. So it's not only about us looking for blood donors, but it's about looking for promoters of blood donation. Those that are under 18 years of old are going to be the future blood donors. And it is, I truly appreciate, yesterday we had a meeting with the dean of the University of Engineering with 14 representatives of universities promoting blood donation throughout the country. So we have strategic allies that are going to help us in this recollection of blood. Next slide, please. So the idea was that our link, which are the promoters, are able to start working together with the donors and with the population and also with the blood banks. Next one. The objective is not to have more donors. No, I will say this. It's a different perspective, of course. The idea is to create loyalty. If I'm able to create loyalty, I can assure blood that I'm going to have more donors. If I need 400,000 bags of blood on an annual basis with 150, it's more than enough. So more than saying we need to have more voluntary donors. No, let's have more loyal blood donors. Therefore, here, this is oriented towards this. And here we've been able to see this in the year 2023. We've been able to get 100 or 100,039 units per by voluntary donors. I have an average in math, of course. It's sometimes complex, right? What is the average of a life? Well, let's say my grandfather is 100 years old and my baby is 1 year old and the average is 50, but that average doesn't work. But for statistics, that's the great issue because I can say I have 25% of voluntary donors. That's a lie. In the area of Iquitos, Loreto, in the area of San Martin, they get to 95, 98% of voluntary donors. So we are able to get the average, but it's not real data, right? So this information that we have here, we were able to get in 2023, 100,000 volunteers. If we were able to have them donate 4 times a year, I don't need to be asking for any units from the blood bank because I would have this great possibility. So we need to work on this concept of having this loyalty. Okay, next one, please. For us, the strategy that was successful for us in the year 2001, 2002 was to have promoters and tutors. And here, special appreciation to PAHO because they financially helped us in this course. It is a course that we were able to deliver in the whole country. And from what we've been doing in these past years, it's about having promoters that help us. Promoters that help us. A lady would tell me, Doctor, I am under 50 kilograms in weight. Can I donate blood? And I said yes. But first, but I mean, they need to have pediatrician bags and those criterias of weight and everything. But they are very enthusiastic when talking about promotion. And next one, please.
Llegando a la parte académica,
Okay, getting to the
¿por qué la gente
academic
dona
end of
sangre en
this, why
Perú?
don't people donate blood in Peru?
Esta es la última
This
publicación que
is the
existe a
last
nivel nacional
publication that we were able
sobre
to
los
have
factores
nationally in
sociodemográficos
reference to social
y
demographic
socioculturales que
factors
influyen en la
and social
donación de
cultural
sangre
factors that have an
desde el
influence in the
2022.
donations of the
Veamos esta
year
referencia.
2022.
Se ha
As you can
publicado
see, it's a
recientemente
recent information that
y
was
ahí
just
vemos
published
las
this year.
diferentes
And
causas
here we are
por
seeing the
las que la
different
gente no donita.
causes for which people
Nosotros
do
tuvimos un
not donate.
trabajo el
We
año
actually had joint work done in the year
2000 por qué la gente
2001
no donaba.
regarding
¿Y
why
cuál fue
people
la
won't
principal
donate.
causa
And
por qué
what
la
was the
gente
main
no
cause of why
donaba?
people
Porque
wouldn't
no
donate?
los
It
habían
was
invitado a
because
donar
they
sangre.
had not been
Esta
invited
es
to
una
donate
responsabilidad de
blood.
todos
So
nosotros.
it's a
Hay gente que
responsibility
quiere
of all
donar,
of us. There are people that want to
pero
donate,
perder el día
yes.
sábado en la tarde
And
después de
I was
trabajar
quite
por ir a donar
enthusiastic on a
es
Saturday, let's
bárbaro.
say after work, I will go to donate. But
Los
where do I
domingos
go? There's not any
y
banks.
viernes.
Sundays,
Entonces, ¿cómo
even worse.
promovemos la
So how do
donación
I
de sangre
promote
cuando
donation
no
of
tenemos
blood when
capacidad
we
para
don't have the
acceder a la sangre?
capacity to
¿No?
be able
Esa
to
es
help
una
donors?
contradicción.
That is
Entonces,
a
ahí vemos
major
una serie
contradiction. So
de
here
factores en
we
Perú.
have a series of factors in
Y este
Peru
esquema
in
lo
reference to
decía
considering this, as
Mauricio,
it had been
no
mentioned
es
by
un tema
Mauricio. It's not
de
about
investigar,
seeing this part of
sino hay que analizar,
investigating. We need to
tomar
analyze and we need to
medidas.
take corrective measures.
Entonces, todos estos conceptos son importantes.
All of these
La siguiente.
concepts are important. Next one, please.
Y esto es
And this is
las
these
unidades
are
que se han
the
realizado en
units
todo el
that have been
país y
developed
obviamente estamos ya dando sostenibilidad con
in
todas
reference to
las
being able
normas,
to
¿no?
give sustainability to all of these
El país,
standards.
en todas las regiones, hay colectas y
In the
campañas de
country,
donación de
there
sangre.
are regions
La
and
cosa es que hay que
campaigns,
hacerlo
and
sostenible.
these need to
La
be
siguiente.
sustainable. Next one, please.
Y este es Perú.
And this is Peru.
El año 97, 99 logramos
1997,
19%
1999, we were able to get 19%,
de donación voluntaria.
19.1% of
¿Por qué?
voluntary
Porque el
donation.
elemento importante
Why?
fue
Because the
impulsores y
important
promotores
element
en
was
todo el país.
promoters in the whole country.
Había mucho
There
entusiasmo.
was a lot of enthusiasm.
Luego, vean ustedes, empieza la caída
And
y
then we
luego
would
al
start
inicio de la
seeing this in
implementación de
reference to being able
estas
to see the
organizaciones no éticas,
implementation of this
llegamos a un
strategic.
25%.
And we would get
Pero
here
como
to a
le digo, no es
25%, but it's not
25%,
25% because it is an
entonces mucho
average.
más depende
It
de la
is
región,
much more
¿verdad?
depending
La
on
siguiente.
the regions.
Y estas son total de donaciones
And these are the
voluntarias que se
total
han
of
ido
voluntary
incrementando en
donations that have
Perú.
been increasing in Peru.
Y nuestro
And
pico más alto definitivamente
our
es junio,
highest peak is definitely
12 de julio
June,
y
June
diciembre, donde
14th,
terminamos
and
las actividades de
December, where we would
campaña.
finish the activities of
Siguiente.
campaigning. Next one, please.
Este es el país que
This
lo
is the
hemos
country.
dividido
We've
desde el
divided
punto de
it
vista de
from the
colecta de sangre,
perspective of the
¿no? La
collection of
zona
blood
de la
here
selva,
in
prácticamente
the
San
area,
Martín,
basically San
Iquitos,
Martin,
tienen donación
Iquitos
voluntaria.
have
Y
voluntary
a veces nos quejamos, en
donations.
Perú no se
And many
dona,
times, well,
aquí
in
se
Peru we don't
dona.
have
Lo
donations.
que pasa
That's
es
a
que Perú,
lie. There is donations. It's just that Peru is in
Perú es
Lima.
más que Lima.
Peru, it's more than just
Y vean
Lima.
ustedes a través de
And
los años,
you can see throughout
21,
the
22
different
y
years,
23, cómo han ido
2021 and 20
disminuyendo las zonas
through
rojas y
2023, how there has
voluntarios
been a
como
reduction
ustedes
in blood
han
areas in
visto
reference to collection
presentes. Pero
of blood. Some of them
tenemos cada día más
persist,
donantes
but they have
voluntarios, ¿no?
donors in
La
reference
siguiente.
to volunteer donors. Thank you.
Y acá algo que se tiene que trabajar y
And here,
ayer
what needs to be
pudieron
said, and
haber
yesterday it was
escuchado uno de los
actually great to
alumnos
be able to hear one of the students
explicaba el día de la
explaining, they were able to
que
actually
no
explain
solamente
that
es
it's
una
not only
responsabilidad
about having
el ir a estudiar a la
a
universidad,
responsibility of going
sino
to
también
study to
tenemos que
college, but
tener
it was about the
responsabilidad con la
fact that we need to
población
have responsibility with the
y empezar
population
a
as
dar.
well, and to be
Son
able
palabras de un
to
estudiante
start
de
giving.
una
These are
universidad
words from
que
a
tenemos
student
que
of a
tener la
university
necesidad de que
in reference
también
to
esa
seeing the
responsabilidad
need that this
incluye darse.
responsibility would actually include to
La siguiente.
donate blood. Next one, please.
Entonces, nuestro trabajo ya no debe
So
ser pues
our
buscar
work
nuevos
should no
donantes,
longer
sino
just be
empezar a
about
trabajar
looking
con
for new
cultura.
donors. It's about starting to work with
Tenemos
culture,
una ley en la cual se
right?
introduce
And to be able to see that we have a law that is introduced within the preschool activities regarding what a blood donation is. So we need to continue working on this end so that the population, which is quite solitary. In Peru, we had an explosion of a gas tank in the southern part of the country. 2,000 donors on a daily basis would go to San Borja to donate. But it's not that we're not solitary. There's something missing there. And I think that Silvina already explained to us that we need to link the population with this health system. Next one, please. And just to finish and not bore you that much, we wanted to say that Peru has always opened arms to everyone without any exception. It's not this concept, universal access to safe blood, and that what we are doing is definitely going to define the concepts of country of the blood. One is about production, then about transfer, which if there is not any financing, there is not any sustainability. What we do not want is to be able to do something very big and that then it disappears. So the ministry we are trying to work on here is in reference to packages, packages of costs. Peru has different institutions and YAFAs financing, and therefore there really would not be the need of having someone to pay for a bag. It's just this YAFAS, and that YAFAS means sustainability. We would have a hemo center for over 300,000 bags here in Lima. This is all financed, and that would probably change the model that we currently have as a decentralized model towards a centralized one. Thank you very much.
Muchas gracias.
Thank you very much, Dr. Fuentes, for the presentation. Now, continuing with the program, we are going to pass on to Dr. Aníbal Gaviria, Director of the Hemo Center of the Red Cross in Ecuador, who would talk about the experience of blood donation in this institution. To the colleagues here, in reference to the colleagues here, so we can have this projected on the screen, please.
Muy buenos días con todos.
Good morning to each and every one of you. First of all, I wanted to introduce myself. My name is Aníbal Gaviria, and I am currently the national manager of the Hemo Center of the Red Cross in Ecuador. And for us, as the Red Cross in Ecuador, it is a pleasure for us to be here with you today in Peru, developing this information and also talking about the experience in reference to the promotion of a blood donation. And that's why we have a delegation here. We have Dr. Roque Soria, that is the national president of the Red Cross in Ecuador, and also Juan Carlos Vizcarra, that is the general secretariat. And in reference to the National Hemo Center, what we would want at this time is in reference to being able to present what our strategy has been and what our strategies have been in Ecuador as the Red Cross of Ecuador. As you well know, the Red Cross is not part of the state. We are an NGO. We are an organization, an auxiliary organization of the powers of the state. However, here we've been carrying out this donation for many years, and right now this has allowed us to be able to have the processing of over 88% of the blood of the country in Ecuador, and also being able to establish these experiences. If you can please help me with the next one. Thank you. Previous, please, previous. One before that. Well, just for us, what is most important within the promotion of blood, it's to be able to work in four pillars. The first one of them is to be able to maintain this information to our blood donors and to be able to have the community informed in reference to the different institutions of the state, in reference to the different needs of a blood that there are in the country. And we definitely very strongly work first in being able to create culture in the blood donation. Here we have the part in which we are able to have an average of 21,000 donors for blood every month, with a percentage of 99% of our donors being voluntary donors, and we have an average of 55% of donors that are repetitive. And of course, we continue working under that same strategy, because what we would like to set, like we mentioned in the previous scenarios, what we are aiming to do is to be able to create loyalty, to create the culture of donation, starting from very early stages in which people are able to create from this a lifestyle in reference to the donation, the normal donation, and also with these donors. This is done by maintaining those that are informed and creating awareness to our donors. Next one, please.
Para nosotros, un poco, digamos que tenemos.
For us, that we have within this loyalty, we have two topics. The first one is that for us, a loyal donor is a person that is aware, that has awareness and motivation to be able to donate blood in a repetitive manner. And right now, our objective is to be able to increase repetitive donors with the objective of increasing blood safety and security in Ecuador. Next one, please.
Para eso, ¿qué es lo que nosotros hacemos? Primero, como
For us, what is it that we do? First, as an institution, yes, not only as a blood bank, but as the Red Cross, we have a strategic plan, a 5-year plan, where we have everything that has to do only one chapter in reference to blood. And here in this strategic plan hasn't only built in reference to the key staff, but also about the administrative staff and the government's part of the Ecuadorian Red Cross. And here we are able to define our objectives in reference to how much we would want each one of these provinces to grow, or what are the needs in reference to each of the provinces. And we are seeing this in reference to these indicators and some goals that need to be met. But first, what we need to see is that these plans, we are able to work with an annual operation plan with a budget, including specifically for this work of health promotion. Next one, please.
nosotros dentro de ese plan, pues
And
buscamos
within this plan, we are also looking for strategic alliances to be able to help us create the culture of voluntary donation. Here, I'm only going to put two examples. One of them is that we work with projects with different embassies. One of them is for the Embassy of Japan, which throughout the pandemic, it was a strategic ally. It allowed us to be able to look for mobile units to be able to have donation of bloods in homes, home after homes. In the pandemic, it was difficult because people were at their houses, and we needed to go towards each one of the households. And it's a little bit about the message that was left to us by the pandemic. We don't need to wait for donors. We need to go and give the facilities in reference to the network of Ecuador to our donors. And also we've carried out other projects, for example, with the International Red Cross Foundation. You probably know that Ecuador in the last year, it has had different situations. One of these has been the increase of violence, and that is why, well, we have presented funds, a project to be able to obtain emergency funds for disaster response, and these were the needs of blood that incorporated this in the country due to the increase of violence, due to the prison crisis. And what we have done is to not work alone, but to look for other institutions that are definitely able to help us to be able to get to the different communities. Next one, please. And something that is important is that, first of all, we've worked, and not only with Ecuador, of course. For example, we've worked with other strategic allies, such as the Red Crosses of other countries. Currently, we have a centralized model that for Ecuador has been very efficient. Ecuador is at around 15 million inhabitants. We have 21,000 donors on a monthly basis with the percentages that we've already seen. But we work with other national societies such as the Colombian Red Cross, the Red Cross of Honduras, the Red Cross of different countries with the objective of being able to have that feedback of having this seeing what is happening in other countries and other blood banks. We've also looked for other promoters that donate their buses. For example, Continental donated a large bus for this to be converted in a donation bus. And this would allow us to get to other provinces. Last week, Ecuador had 24 provinces, and we were able to get to these 23 out of 24 provinces and in reference to the Galapagos Islands with all of the difficulties of logistics that this brings with it. And we also work with the regulation entities or with the government. We have an agreement with the Ministry of Health, with the Social Security, and because the fundamental work of the Red Cross is to be able to process and to be able to have all of the logistics as well. For the delivery to different health entities. And we also had some events. Last year, we had the presentation of 30 blood banks of the whole Latin American area to be able to go to meet the Hemo Center. But here it was about us knowing the different strategies that all of the banks of the region have. And of course, for us to be able to continue improving the current model that we have as the Red Cross. Next one, please. Therefore, our objectives as the Red Cross of Ecuador are first to be able to promote the voluntary, altruist, repetitive, and non-paid donation of blood with the objective of obtaining safe blood components. And the second objective is for us to be able to obtain blood, let's say, in a sufficient amount to be able to cover the whole demand of hemo components that the country has. Next one, please. What has helped us? Well, first of all, it is the fact that we have a software at a national level in all of our points regarding what it is that we can review. And it allows us to be able to review at a second what is a stock and the demand of blood and that we have in a national level in more than 669 health centers where we are able to deliver hemo components. And we're also able to establish the goal for captation. Until the past years, with these strategies and objectives that we worked on, we had a blood bank that every month or every 2 months we would be on the news saying, look, we don't have blood, please, we need people donating, we need to cover the demands. And currently, well, we have a stock that allows us to be able to deliver all of the components, even pockets, when we have long holidays in Ecuador. In February and in November, there is a holiday that's a 2-day holiday, but plus the weekend, it's a 4-day holiday where there we have the increase of traffic accidents. And well, we have different strategies that allow us to be able to cover all of the needs of the country. Next one, please. Very good. Okay, so how are we able to do this within the planning? Well, first of all, we believe that at a national level, we have a mapping of companies or carrying out extramural activities. Here, we have in reference to this part to be able to have collections and having different institutions for example, colleges and small and large companies. And here we are able to promote all of the donations, voluntary donations of blood. Second, we have a monthly program regarding what are the extramural goals that each province has for them to be able to develop and plan their collections. Within each one of the provinces, well, what we are able to promote is that there are collections in an extramural and in the sports spaces and recreation spaces where there are people that have healthy habits. And we also are able to do this throughout. What had been done here in a difficulty is about being able to get the donors in a less frequent manner, such as AB negative, B negative, AB positive, and O negative. We have different strategies to be able to have calls done of less frequent groups. And what we also did first was to be able to reinforce the provinces to be able to collect at a national level. This is something that we already have in here. The goals are to be able to create a culture of voluntary donation in the rural areas and insular areas. So there we are going on out to the large areas, but also to be able to promote on this end and considering these strategies, which is about going to be able to look for donors and to not wait for them to come to the Red Cross in Ecuador. And also, we are given pre-donation advisory. It's not that we just park the vehicle and say human talent, no, let's look for them. No. For example, if we are going to have this done tomorrow, we have go to the promoters, we have the promoters speaking to all the people, we motivate them, and while the donation is able to have more, well, in all of these organizations, and obviously to all of our donors, we are able to present a carnet for a voluntary donor.
Dentro de las captaciones que tenemos en nuestros
In
puntos
the
fijos, lo que nosotros
capture that we
hemos
have in our
hecho
set
es ya
points,
también
what we
mejorar
have
nuestra
done is
infraestructura,
improve
darle
our
las
infrastructure
facilidades al
and
donante y
provide
que cuando ellos
the
lleguen, lleguen a un
facility to
lugar
the donors
primero
so
que
that
sea
when they
confortable,
come to a
esté
comfortable place
climatizado y
that
sobre todo
is
que sea un área segura
that
y
has
darle
climate
todas
control
las,
and it's a safe
digamos,
area
facilidades a nuestros donantes
where we can
para que
provide
su
all
donación
the
pues sea
benefits
lo
or
más
all the
agradable
advantages
cuando viene a
to the
cada una
donors
de
so that
nuestros espacios.
when they come to our
La siguiente,
space,
por favor.
it's the most pleasant experience possible. The next one,
La
please.
segunda es
The
que hemos
second
hecho
is
un
that we
ciclo
have
de
created
capacitación
a
continua y de
continuous training
formación a
cycle,
todo
and
nuestro
we are
personal en toda
educating
la red
all of our
territorial. Porque
personnel
antes lo que nos
throughout the
pasaba
network,
era,
because what
no,
we had before
contratemos
is that,
seleccionadores o
no, let's
promotores,
hire
ya busque
promoters,
usted y ya
and
un
but
poco
then you would
quedaba
go and look
al,
for them, but
a la
then it really
iniciativa y a los
depended
conocimientos
on
de
the
ese
initiative
profesional o a
and
su
the knowledge
experiencia
of that
y lo que nosotros
uh,
estamos haciendo aquí
professional.
es, bueno,
And what we're
realizar un
doing here
ciclo de
is that we're
capacitación
creating a
continua
cycle of
en toda la
continuous
red
training
territorial
throughout
y
the
ahorita
territorial
con
network. And
todas las
right now,
personas que nos
with all
captan
of
en
the
la red
people that
territorial,
catch us in the
estamos
territories, we
elaborando
are
un manual y una
elaborating
política de
a
atención a
manual
nuestros donantes. ¿Sí?
and
¿Para
a
qué?
policy
Para
to
que
care for our
empecemos a
donors. Why? So that we
institucionalizar
can
y
start to
empezamos a
formalize,
tener
so that we
unos
can
mismos
start to
criterios de
have
atención de nuestros donantes
equal
en toda la
care
red territorial.
criteria for
La siguiente,
our
por favor.
donors throughout the territory. Next.
¿Sí? ¿Qué es lo que buscamos nosotros
So
fuera
what
de las
are we
competencias
looking
técnicas
for
que debe
aside
tener
from
un
technical
donante, o
competences
perdón,
that
una
we
persona que
have
nos
to
está
have for
ayudando
a person that
o
is
nuestro
helping us
personal
in a
en la
blood
acción de
drive
la
or
donación?
the
Es que
personnel
debe cumplir,
in dedicated
aparte
to
de todas
donations?
las
Well, aside from
capacidades
all of
técnicas,
these
con
technical
4 cosas.
capabilities,
Primero,
they
que
have to have
tengan
four
empatía
things.
con
They
el
have to have
donante, ¿sí?
empathy,
Que
empathy
no
with the
seamos
donor.
como
We
muchas
shouldn't
veces en algunas
be many
instituciones
times
públicas,
in some
siéntese,
public
ponga la mano
institutions.
abajo de
You
su
sit
puño y va a
down,
quedar cada 5
squeeze your
30
fist, sit
segundos, daremos
down,
un
30
refrigerio, el que
seconds, go
sigue,
get your
sino
snack. Okay,
que
next.
sepa y le
No,
ayude,
we
que tenga
want them to have
empatía con el
empathy
donante y le
with the
explique,
donor.
le
We want them
agradezca
to
el gesto que está
explain.
haciendo,
We
que le
want them to
explique
thank the
cuántas vidas
donor.
está donando,
We
que
want them
le
to
diga
tell them the number of lives that they
cuánto
could be
puede
saving.
donar y que esta
We
persona
want them
que
to
está
explain how
sembrando
often they could
tenga una buena
donating and that
comunicación
this
con el
person
donante
has
y pues
good
que esa
communications with the
persona
donor and that
puede ser
person
el que haga que ese
can be
donante vuelva
the one that brings that donor back, or maybe that donor will never come back, and maybe they can say, no, the way they treated me, I'm never going back. So it was about educating our personnel in terms of empathy and communication, and it was extremely important. And also tolerance, because a lot of donors come in a very nice way, but there's some others that come and they have difficult characters. When there's a donor that experienced some pain, we teach them how to manage that donor so that the donor's experience, despite it not being satisfactory, there's an apology, and we try to have that donor come back to donate blood. And we also have the technical capacities. In the promotion strategies, we have added some other factors. One is that we send them a birthday message. The donor for us, not just the day for the donation, but also in the different dates. For example, the birthday message, we thank them and we say, we hope you have a great day on your birthday. Second, we have different open calls, especially for the rare blood groups or blood types. On the day that they come to donate, we send them an email in the afternoon thanking them for their gesture, saying thank you very much for coming to the Red Cross, thank you for your donation, and with your donation, we will be saving 3 to 4 lives. And I think the most important thing that we human beings have, those of us especially who work in health and in blood banks, is to be grateful to the gestures of our donors. We also send them reminders of donations or drives. We say every 4 or 6 months, you will get an email. It will say, okay, thank you for your donation 6 months ago, and you could donate again. And we create that culture of donation. And we also have satisfaction surveys. Next. Something else that is important is that we are grateful, and the 14th of June becomes the day that we thank our donors. We have Dr. Roquesora, National President, thanking this donor, this person who has had 124 donations, and from him we've been able to get 372 blood products that have allowed us to save innumerable lives. So if we donate twice a year, every year, we would need 60 years to achieve what this person has achieved. If we do it 3 times, we would need 40 years to achieve what Mr. Cristobal has achieved. Next. Another strategy that we have now is that we are changing. We're getting to the donors through mobile phones. We have developed a mobile app, and the donor will know about the benefits. They will know the donation spots. They will learn about myths. They will receive a donor ID, and they will have all the information available on their phone, because we want to make it easier for the donors so that they know where they have to go, because many times the donor wants to donate, but they don't know where they have to go, or they don't know how to get there. So with this is an app that we call Yes to Life. We create loyalty with the donors, and we provide all the facilities. And for the repeat donors, they can say, I went to the Red Cross, this is my donor badge, I have 10 or 25 donations, because sometimes you ask them and they don't even know how many times they've donated blood. Next. And we have all of the information available on the website so that people can know where they can find us. Next. We have social media strategies at a national level. We work with Instagram, Facebook, used to be Twitter, and we provide all of the information, and we tell them where we're going to hold the campaigns, and we tell them where we're going to go. Next. And this is what has led us This is what we've produced with the model. This was 2010 when we created the Hemo Center. We had about, 41,000 donors. And as you can see, during the pandemic, it went down. But you can see that last year we had 251,000 donors. So we are growing the number of donors. And this centralized model of having a hemo center has allowed us to, in the first 4 months of this year of 2024, we have had more donors than 2010 and 2011. So I think this is a model that is working and that is helping us get more blood donors. Next. And this model has brought this. Before, in 2010, we had 85% of voluntary donors and 15% of donors that were paid and received some sort of compensation. And you can see now 99% of the blood donations are voluntary, and the compensatory ones are about 0.5, which is pretty low. Next. We believe that as a Ecuadorian Red Cross, we want to reaffirm our commitment to life, and I wanted to show you 2 videos of how we promote, and with that, I'll finish my presentation. And can you help me with the first video, please?
Ana. Ana, me parece que tú tienes, ahí está justo. Ana, no escuchamos el audio del video.
We cannot hear the audio, so you have to share the audio when you're sharing the screen.
Fluye vida. Tu decisión de donar sangre de manera voluntaria
Your decision to donate blood voluntarily can save 3 or more lives for each donation. Blood types A, ORH negative, and AB are negative or positive are scarce. So you can be the hero that creates a difference in the life of someone fighting to survive. At any moment, you or a loved one could need a blood transfusion. Donate blood.
Con este tipo de videos buscamos
We use this type of video. These are short videos that include all of the information. Right now, the young people have a 20-second or 1-minute attention span. If you don't hook them in, then they're gonna scroll past you. So we want to have animated short videos where we're asking them, and we're also explaining the benefits of donation. And if we could see the last video.
Cruz Roja Ecuatoriana tiene como
The
uno de sus
Ecuadorian Red Cross has as one of its main goals to create incentives for the population in the country to be part of the group of voluntary blood donors. We have a lot of stories of life because of our donors. Today, I'm donating because of my child. He was diagnosed with cancer. The doctor Ceballos in the Red Cross detected hypoplagic anemia. Receiving this kind of news, this is a moment where you decide you have to understand what to do. When hematocrites go down, you have to get a blood transfusion. That can be every 2 months. Also, excessive bleeding, and then you have to have a platelet-rich blood so that they could survive chemotherapy. Statistically, with each donation, we save 3 to 4 lives. I've been doing blood donations for 8 years. I donate platelets. I've been donating for 20 years. I've been donated for about 40 years. The reason for the blood donation is because I want to help people. Through platelets, we obviously save lives, and more than anything, it helps save the lives of many people that need it. I donate 4 times a year because I want to save lives. As I said, there isn't any small donation because each drop counts. Even though it may seem something very simple, it's something very powerful that can be done to help others. The help that the Ecuadorian Red Cross has provided has been significant. Through the Red Cross, I've been able to live my life very pleasantly and continue with my daily activities. My son right now is a teenager. He's 12 now. So he's very grateful because blood donations have
En
allowed
el
him
Centro
to have
Nacional
a
de
new
la
life.
Cruz Roja Ecuatoriana
The
procesa el 78% de la sangre
Ecuadorian
de
Red
todo
Cross
el
Hemo
país.
Center
Cuenta con una
processes 80%
infraestructura
of
que
the
permite
country's
tener
blood,
áreas
and it has
acordes a los
infrastructure that
procedimientos que
allows
se
them to
ejecutan.
have areas depending on the procedures that they execute. I would tell the Ecuadorian population that they have to donate blood. There's children, there's adults that need our help. I feel that I'm doing something good because there are many people who need this. Being part of this cause that saves lives. There's many
Donar
people
sangre
that
es un
need it.
acto voluntario, solidario y
Donating
altruista,
blood is
donde tu mayor
voluntary and
recompensa es
altruistic, and your
salvar
greatest
vidas.
reward is that you're saving lives. Donate blood. Donate blood. Donate blood. Donate blood. You're saving lives.
Muchas gracias.
Thank you very much.
Bien, muchas gracias
Very
a
well.
todos. En este
We'd
momento
like to
vamos a
thank
tener
everyone.
un
Right now, we are
pequeño
going to
break
have
para
a
poder
short
recuperar también un
break
poquito
so
los
that we
minutos
can
de retraso que
recover
tenemos. Los
some
invitamos a la
delayed
parte
meetings.
de
We
afuera por donde
invite you to
ingresaron
the
para tener
outside where
este
you came
pequeño
in so that
receso.
we can have this break.
Volvemos en 10
We'll
minutos.
be back in 10 minutes.
Hola, no sé si hay alguien que me esté escuchando. ¿Hay alguien que me esté escuchando para probar el video?
of the program, we're going to present Dr. Jose Correa, a specialist in chemotherapy and technical director of the Hemo Center of Puerto Maldonado and regional director of the Transfusion Medicine Group for 2020 to 2024. He's going to talk to us the use of social media to promote voluntary donation of blood. Go ahead, Dr. Curbelo.
Buen día. Antes que nada, ¿me
Good
escuchan bien
morning.
ustedes?
Can you hear me?
Bárbaro. Bueno, gracias, ni que hablar por la
Thank you
invitación. Gracias al
for
Voluntary
inviting me.
por
I'd
por
like to
darme
thank Dr. Mauricio Beltran
oportunidad de
from
estar junto a todos ustedes. Agradecer
Pajo.
infinitamente la
I'd like to
invitación a
thank
los colegas de Perú, al doctor Juan
all the
Antonio
colleagues from
Almeida,
Peru,
a la
Dr. Juan Antonio Neira.
a la doctora Liliana
We have both
Molina.
mics open. Please close mics.
Hay alguien que tiene abierto el
There's
micrófono.
someone who has an open mic.
Hay varios micrófonos
We
abiertos.
have
Favor
many
cerrar.
open mics. Please, everyone,
En la otra
close
sala tiene micrófono
your,
abierto.
mute your mic.
Ahí sí.
Are we ready?
¿Podemos continuar?
So can we continue?
Por favor. Gracias.
Please go ahead. Thank you.
Bueno, como les decía, agradecer
As I was
infinitamente
saying,
al
I'd like to
Mauricio
thank
Beltrán, al
Dr.
doctor
Mauricio Ventral,
Almeida
Dr.
Fuentes, y a la
Almeida
doctora Liliana
Fuentes,
Enzo
and
Machado de Perú, que realmente han sido
Dr.
muy
Machado
generosos en
from
poder permitirme
Peru.
estar
They've been very
junto a ustedes,
generous,
así sea a través de Zoom, pero bueno, en definitiva
uh,
estar
and
pudiendo compartir esta
we are
linda
very happy to
jornada.
be able to share
Muchos de
this
ustedes ya nos
great
conocen,
day.
pero bueno, simplemente para
Many of you know
contextualizar
us, but
dónde
I always like to
estamos. Como
provide
siempre digo,
context
nosotros somos
about
la
where we're
punta de
at.
América.
We
Uruguay
are
es un país muy chiquito,
Uruguay
pero bueno,
is a
acá
tiny country, as we
estamos ya
can
casi
see
yéndonos
here,
del
and
mapa con
we
una
are
población de
almost
3
off the
millones
map with a
451
population
mil
of
habitantes, un
3,455,000
país en donde se diría, a pesar de ser lo chiquito que
3,450
somos, en 19
inhabitants, and despite
departamentos o
being
19
so small,
regiones o
we
provincias,
have
depende
19
cómo se llamen en
provinces,
distintos países
regions,
de
or departments,
Latinoamérica, la
depending
jurisdicción
what
interna de
you
nuestros países.
call
Pero
a
bueno, nosotros
internal
estamos ubicados en lo
subdivision,
que sería la
and we
región
are
este del
in what we
Uruguay,
call the east
con
of
estos
Uruguay,
lados celeste y
and
naranja,
it's in
específicamente
orange
nosotros
and
estamos en
light
los
blue, and
centros, la ciudad de
specifically the
Maldonado está
regional
ubicado bien
Maldonado
al
Center is
sureste
in the
del país,
southern tip of the
dentro de lo
country
que llamamos la región
in
este,
what we
y
call
es
the
donde está ubicado, que todos lo
eastern
conocen,
region,
por lo que es Punta
and
del Este, que es el
it's
balneario
known
turístico
because of
obviamente que tenemos
Punta
en
del
nuestro
Este, which
país.
is the
La
biggest
región este
tourist site
está
that we have in our
compartida
country.
por o integrada por
Our
5
region
departamentos
has
o
5
provincias, que es Cerro
departments or
Largo, 33, La
provinces,
Valleja,
and Cerro
Rocha y
Largo,
Maldonado, con una
Roche
población
Maldonado,
permanente de toda
with
la
a
región que ronda los
permanent population
425.000
in the region
habitantes,
of
y donde en temporada
155,000
estival,
inhabitants,
justamente
and
por
during
tener Punta del Este,
uh,
por tener ese balneario
tourist
que por
season or
suerte
high
atrae
season,
muchos
because of
turistas
Punta del
de
Este, that fortunately
diciembre a
attracts many
marzo,
tourists from
bueno,
December to
pasamos de una
March,
población
we go
estable de
from a stable
425.000
population of
habitantes a cerca de un
425,000
millón de
inhabitants
habitantes,
to about a
dependiendo
million
la época
inhabitants,
o las
depending
temporadas,
on
mejor
the
dicho, si es
time
buena
of the
temporada o
year
no. Pero
and
bueno,
whether it's a
eso
good
llevó
season or
a que
not.
obviamente
And this led
por
us
el tema
to,
sangre no menor
obviously,
había que afrontar
well,
todos
we had to
esos
face
habitantes, sean
everything,
estables o sean visitantes,
all
con la
the
población que se
inhabitants,
tenía hasta ese
permanent or
momento. Y bueno, y así es que nace el
transitional.
Hemocentro
Uh,
Regional de
so
Maldonado.
we
Es un
have
hemocentro
the Maldonado
que
Hemo Center.
nace allá en el
It is
2009.
born
Este
in
año estamos cumpliendo
2009,
justamente los
and
15
this
años
year
del
we
nacimiento del
are
hemocentro.
celebrating the
Antes del
15th
hemocentro
anniversary.
teníamos una
Before
realidad
the
que
Hemo
teníamos
Center,
unos
we had a
10.000
reality.
donantes
We
al
had
año,
about
y a
3,000
partir del
donors a
año
year,
21
and
arrancamos los
starting in
35, 37, 38.000
2021, we
donantes al
have
año
about
solo el hemocentro.
35,000
Y aquí viene un
donors
poco la
for the Hemo
presentación
Center
nuestra.
itself.
Digo, bueno, ¿cómo
And this
hicimos
is
para poder
where our presentation.
aumentar de
How did
3.000
we
donantes que
increase? How
teníamos al
did we go
año
from the
a
3,000 annual
35.000
donors to
donantes que tenemos ahora?
35,000 annual
Y
donors
bueno,
as we
uno
have
de
now?
esos,
And
una de esas formas fue
one of
justamente
the
poder
ways
tener
that
un
we did this
hemocentro,
was
es
to
el
have the
único que hoy hay en
Hemo
el
Center. This
Uruguay,
is the only
es
one
el
we have
único
in
donde
Uruguay.
justamente el
This is
verdadero
the
objetivo
only
del
one
mismo era organizar y
where the
racionalizar los
true
recursos que
goal
teníamos,
is to
tanto en donantes
organize and
como recursos
rationalize
humanos y
resources, both
tecnológicos,
human
aprovechamiento al
resources,
máximo de esos
people or donors,
y
and
que además
technology,
llevar adelante un
and
programa de
well, to
sensibilización,
have an
captación y difusión de
awareness and
donantes
recruitment program
adecuado
for
para lo que
donors that is
se necesitaba para un
adequate for
centro
what we
de este
need
tipo.
for this
Y
type
bueno,
of
el gran
center.
desafío que
The
teníamos
big
en
challenge that
la
we faced
captación de
in
donantes
recruitment
es
of
obviamente
donors
cómo
is
llegamos a esta
obviously
materia
how do we
prima, como
get
digo yo,
to
que es
the
el donante de sangre.
donor, the
Hasta el
blood donor
momento que estaba
itself.
el hemocentro, la
Before
forma
the Hemo
habitual que
Center,
teníamos
the
por siempre
habitual way
existió
that
entre los
we
bancos
would
de sangre que
do
existen en Uruguay, fuera del área
as
de donde trabaja el
other
hemocentro,
centers do outside of this area is the replenishment donor or the unknown donor, as we know them. We had the hemo center, so we had to develop and we had to work on challenges that would be different to what we already knew in terms of recruitment of donors. And this is where we created the differentiated model, at least in Uruguay, where we have worked and that today is recognized by the different chemotherapy services in Uruguay and outside. And it was to implement these strategies to be able to recruit donors and to create loyalties. And here we have an area that is born, the area of fractioning, immunohematology, and we had the area of communication. Since we opened, we have a communications area, and the first big objective of that communications area was to create a corporate image and a desirable brand, someone that would attract everyone, that could be defended by the community, and that could lead to ownership. When one looks at a logo of a Mercedes-Benz or Apple or Ferrari, I think nobody, well, everyone knows what it is and the quality that goes behind the brand, that logo that we see in its different shapes. So that's what we wanted to transfer to the Hemo Center, that brand, that identity, that logo. When people in the community saw it, they could feel that it was their own. And this is a big challenge that I think we have overcome, and it's a registered brand in Uruguay. It's that drop of water with the shape and the logo of the letters. It's got the size, the color of the writing. And I think that today Hemo Center can be, well, is a registered brand in Uruguay. And then we had to develop a communications channel so that we could bring all the information that we wanted to our donors, so that we could in some way, through the communications area, have a professional way to reach different media, reporters, TV channels, different audiovisual media that we have in the region. One of the big goals in terms of communications for the Hemo Center since we started was to have a strong presence in the media and, of course, social media. Today, in any area of life, in any sector, we do not exist if we're not in social media and if we don't manage it adequately. The big difference that we wanted to have our brand, and in the social media that we have, we didn't want one more social media that gets a like and that's just a number. We wanted that social media to be committed and that would have the adequate information that we wanted to communicate, the one that we wanted to give to the donor, so that we don't just communicate adequately, but we also create loyalty. And this is where we get the responsibility and trust in that, in those social networks or social media. And I insist, the search or the recruitment for the donor, the look for that, what I call raw materials, would not go against the quality of the communications that we wanted to have. And this is part of those communications that we are mentioning. The Regional Hemo Center of Maldonado is a transfusion medicine center that collects and redistributes blood resources. This is the first public service like this one in national territory. First, dedicated to the East, the role in the pandemic, obtaining donors and providing for the health centers, is able to attend all departments, driving cultural change in voluntary donation of blood through education. Currently, it's receiving new generations of donors that participated in the educational program of the institution in the country, promoting responsible driving for driver's license, capturing or recruiting new donors, and the main centers in Europe. It has become a breast milk center in the East. Under international quality standards, the Hemo Center has been certified in all its areas. These certifications are applied to both mobile units that are unique in Uruguay. The Regional Hemo Center of Maldonado is a public service that belongs to all of us.
Y bueno, dentro de la creación de esa
And well,
marca
within the creation of that brand that we were mentioning, what we're saying here in the slide is that today society is exposed to images and messages, and what they promote is success, comfort, happiness, and there isn't a place for other situations. So in that interaction of that success for people, the individuals, the donors to feel part of that success, part of that this structure, we have the concept that we created in this brand and then the strategy to bring the adequate information with the adequate content. And the communications area has been to implement different contexts to get to all our donors in the different places that they're at, and we have specific materials for each public or each one of the groups that we want to reach. And this is where we created a study that we thought was very good to see where we would focus our resources that we had in the communications and dissemination area. And this is where we see the data that 72% of the Uruguay population has cell phones, 83% of the Uruguayan homes have access to internet, 74% of internet users have it in their cell phones and use it, 90% of the people with cell phones are between the ages of 18 and 50, and 89% of users of social media uses social media through their cell phones. So what does all of this mean? Obviously, with all this data and numbers, we would not do disseminations in, for example, a public TV channel that is seen by very few people, or at least the people that we're trying to get to don't see it, the people from 18 to 50. So trying to have these resources reach effectively and adequately reach the audiences that we are trying to reach, where we're trying to send our message. And one of the objectives is, of course, the use of social media, and the educational program that many of you know is one of the programs that we have as the correct use of social media tools. We didn't rediscover the wheel. This is what we all use: Facebook, Twitter, Instagram, YouTube, internet, WhatsApp, SMSs. We use all of these tools that we have available. The thing is, how do we really reach, how do we really use those tools? And I insist what I just say this, to have content that is content that we are trying to send to the donor, to provide information and to have a back and forth, not just send information and have the donor not be able to give us their impressions or communications with the Hemo Center. And we've created a back and forth in social media that is important. And I'm convinced that this is what creates loyalty in the donor, because we're having transparency in our information. We're prioritizing the quality of the information that we're providing, the type of information that we're providing. We
confianza que
create the trust that the donor is looking for when they
mensajes, y si no
have
nadie le
certain
responde
messages. And
y bueno, y eso
if
pasa
you
a
don't have a
quedar ahí
feedback,
en una nube
it
donde
just
se va perdiendo
becomes
también
a cloud where
comunicación de ida y vuelta que
communications
tenemos que tener con el
are
donante.
lost. We have to have back and forth communications with the donors. And I insist the educational program is a pillar, because we use social media to promote it and to promote these activities that we have with the different schools that come to visit our center. And obviously, with all of the donors. Here, this is just to show you one of the many messages, and we have a return. Here we have a person saying, I'd like to thank the people for the care that I receive when I go in to donate blood. It's excellent. They make you feel very well where you donate. The cafeteria and the doctors, I'm very grateful for helping me. Losing my cell phone because I was distracted, but they helped me at all times and helped me finding. And thank you very much. I'll be back soon. And we say thank you very much, Joel. It's important for our donors to feel comfortable. We try to do this, and above all, thank you for being a donor. So Obviously, there are one or two people that are dedicated to do this, to answering not just questions or concerns regarding donation, questions regarding the schedules or sites or where the IMO booth is going to be or UMA, but also for this back and forth that we just saw in these messages. And well, the strategy and the focus of the network is that it's to prioritize the institutional image so that it is used with the purpose that we want to provide quality to the message and that people can see that this is related to the brand that we were mentioning at the beginning, the brand of the Hemo Center. And we also have a scientific analysis of the use of our media here, as we show you in this graph, where we're collecting the data, the number of visitors, when or at what time or when during the week, the number of visitors, the number of followers, which media do we have more followers, Instagram, Twitter, Facebook, and all of this provides a lot of data so that we can be effective in the message that we're communicating and who we're trying to reach, and not just have a generic message thinking it'll reach someone, but we don't know who. So in this professionalization of the communications area, we have that data so that we can guide the communications that we want to have with our donors. And in this way, we have a strategic outcome so that the desired loyalty of our donors is really a reality, not a chimera. We can't continue talking about a loyal donor, but sometimes we don't understand how we get to them. So I think that with this, we're showing, at least for us, this has brought results. This is the professional communications that are part of all of the work that the Hemo Center does, not just something specific for one day. Right now, Global Donor Day. Today, for example, in Uruguay, there isn't a single service that isn't talking about blood donations. And maybe next week you can go into all the blood banks to see if tomorrow or the next week people remember. And it's okay to have this once a year, once a month. What we say is that we do this communication work permanently. It's not good enough to have mass communications once a year and then no longer talk until the next year, because this is what loses the effectiveness and the real objective, and that is to have blood donors every day in big quantities and quality donors. So the best results that we have for everything that we have said and everything that the educational program that we weren't able to show because of time, but we wanted to at least show you the true spirit of everything that or the true outcomes really of what we're talking about.
El eterno desafío que enfrentan todos los bancos.
The eternal challenge that all blood banks face is recruiting new donors.
Un tema recurrente en cada encuentro científico y académico.
For each scientific and academic encounter. In the Hemo Center, we have learned that we have to act on our own.
Somos proactivos.
We are proactive.
No nos sentamos a esperar que
we are not sitting here waiting for opportunities to find us. We go out and look for them.
No nos conformamos con explorar lo ya conocido.
Not happy with exploring just what we know. We set routes for new horizons in that untiring search for people willing to share that generosity. Going beyond the needle, we are able to create new realities. We're not limited to dreaming about better worlds. We build better worlds. The educational program is not just a path. It's a path that we've created and paved with the testimonies of those who have been touched and transformed.
Un acto solidario y sencillo. Cuando vayas a donar, recuerda.
When you go donate, remember that you should have comfortable clothes, that's easy to bring your ID. The requirements to donate blood is you have to be between 18 and 60, you have to weigh more than 50, not having donated in the last 4 months for women and 3 months for men. You don't have to past. We recommend drinking a lot of drinks like mate, tea, coffee, sugar drinks, or even soda. Not having had a piercing or tattoo in the last year. The help that you can give is necessary. We help them. We hope to see you in June in our school. We're donating with you.
Digamos que en ese momento fue a los
At that time, at 9 years of age, I think this program sort of lights the spark of knowing what this is for, how it works, and how it goes from one person to another. That small blood bag. There are people that are not informed. For example, the parents many times are not informed, and through the children, through the teachers, through those days, this is when they start to realize the importance, because it's not the same to see a publicity, to have a child, your son or daughter, come home and say, "Mom, Dad, I'm learning about this and how important it is to donate." This is when the person really, when we reach the people through the children. Awareness through children allows us to influence family environments and groups. Those people who had never considered donating can feel motivated by the young people who, when they become adults, become donors because they participated in the educational program since they were little. It influenced, it very positively influenced, and in fact, I participated many times in the donation programs in school, and now I'm a donor because of that. I think it's very important to create awareness from school, that they know about the importance of donating blood, that it is important to donate blood, and that it shouldn't be considered something that has no value or importance when it does. Going just a little while and donating, you can save lives. I think this is valuable because today, just like myself, there are many children that from an early age are going to learn about it and then become donors. They can also tell their families to be donors because children learn, and when they're older, they practice it. The school taught me about this. In each school, the educational program is a universe to create awareness and empathy for others.
Este programa ya ha generado nuevas generaciones de
has
donantes y continúa formándolas.
raised new generations of donors and continues. And we were surprised that this has become a critical moment in a difficult time of the life of a teenager defining their path. The program is a catalyzer that helps them decide who they will become. The program also promotes values, for example, knowing what donation was related. It's not just donated blood, but everything that goes behind that. And this is where I became interested, and that's when I studied that. I did not know what transfusion medicine was until one time I saw what donation was about, etc., and I liked it. Regarding what I'm studying, which is transfusion medicine, I liked the attention from the point of view of the nurse or the professional providing support to the person that is donated. What I liked most about this program is
O sea, se
that
puede salvar como una vida, pero sí me dio
you
intriga
can
de
save a life
cómo se procedía paso por paso
without
y cómo
how you went
llegaba
step by step
desde
and
la
how
extracción de sangre hasta
it
la
went
otra persona.
from
O sea,
drawing
la
the
que la dio
blood
la
to the
sangre.
other
Todo lo que es el
person.
proceso, eso es lo que más me dio intriga.
This is what intrigued me most when we talked about that. I wasn't really clear until we got to the point where we had the donation, and when we had donations, I was a donor back then, and now I'm studying
La
because
vida
of
nos
that.
desafía a ser donantes, no solo de
Life
sangre,
challenges to donate
sino
not
también
just
de
blood, but
esperanza, sueños y
hope,
posibilidades.
dreams, and
En la
possibilities.
generosidad encontramos
Through
la clave para
generosity,
transformar
we
no solo
find the
nuestro
key
mundo,
to
sino
transform not
también el
just
de
our
aquellos que
world,
nos
but the
rodean.
world of those who surround
Más
us.
allá de cada punción,
Beyond
hay
each
historias de batallas ganadas contra la
puncture, there
indiferencia y
is
la desesperanza.
battles that we've won.
Nuestro programa
We
educativo
won against
es
despair
mucho más que una
and lack of
iniciativa.
hope. Our program
Es un
is more than an
catalizador que educa
initiative.
y
It is a
motiva a las nuevas
catalyzer that
generaciones.
educates and motivates
Estas
the new
generaciones
generations.
no
These
solo se
generations
convierten en donantes,
will not just become
sino también
donors
en
in the future,
promotores
but they
informados
also
y
will
comprometidos y
be
en futuros
promoters
técnicos que
and
llevan nuestra
future
causa
technicians
más
that
allá.
bring our
El programa
causes to other
educativo
places.
es nuestra
The
realidad
educational
diaria,
program is our
el
daily
pulso que nos
reality.
mantiene vivos
It is
y en
the
constante
pulse that
movimiento hacia
maintains
adelante.
life and constantly
Estamos aquí
moving
para
forward.
compartir,
We're
para
here to
crecer,
share,
para
to
transformar
grow,
y
to
para
transform,
motivarte a que
and
seas
to
parte de los
motivate
cambios.
you to be part of this change.
Bienvenidos al
Welcome
corazón de nuestra misión.
to the heart of our mission.
Y bueno, es un poco
And while
la
this is
realidad
just
de
a little
esto,
bit about the reality, the fact is that we are convinced that our new generation's changes of culture throughout this educational program, which has gone much beyond of what we were able to suppose 15 years ago. These children that you've seen are these same ones that did the spots when they were 10 years old. It's the same ones that were able to go to the schools. They worked in Office of the Prevention of Donations, and many of them are the ones that are still working here in the different and that has just been opened in the Hemo Center with a private university of Punta del Este, and they're going to be the future uh, techniques in 4 or 5 years, which definitely when these 4 or 5 are received, the ones that are being able to develop this, they're going to have a new video closing the whole cycle, where with them with 10 years currently, they are licensed members. So we simply want to share with the whole team. We want to thank you once again, WHO, all of the colleagues of Peru, and to wish that you all have a very good day. And hopefully, well, we'd have been here sharing with you, but due to work related issues, unfortunately, we were at least able to be here through Zoom to be in contact. I send you a big hug to all of you, and hopefully you were able to see the presentation as we wanted for it to be seen and for you to be able to see it live. Thank you very much, and a big round of applause and a big hug for you.
Muchas gracias, doctor Curvelo. Sí,
Thank you
pudimos
very
ver
much,
la
Dr. Curvelo. We
presentación.
were able to see the presentation
Vamos
perfectly.
a continuar con la agenda con la doctora
We
Luciana
will
Carlos,
continue with the agenda with the
médica
Dr.
del
Luciana
Hospital
Carlos.
de
She is doctor
Paraíba,
from the
especialista en hematología y
Medical Office of
hemoterapia,
Paraiba, a
y se
specialist in
especializó en el
chemotherapy,
adolescente y
master's
posee un
degree
MBA en
in the
gestión de salud.
teenagers and children, and she has a
Actualmente
health
es
management
directora del
MBA.
Hemocentro de
She is
Ceará
currently
en
director
Brasil
of the
y
Hemo
nos
Center of
presentará la
Ceará in
ponencia
Brazil, and she
Participación
would present
Pública
public
en la
participation in
Donación
the
de Sangre.
voluntary donation of
Doctora,
blood.
¿nos escucha?
Doctor, can you
Sí,
hear
te
us?
escucho bien. ¿Me
Yes,
escuchan
I can
mejor
hear you
también?
fine. Can you hear me
Me va a
okay?
pedir permisión para hablar en
I'm going
español.
to ask you for permission to speak
Ya
in
que
Spanish.
escuchan,
Is that
mi
okay?
presentación
Well,
está
this is my
compartida,
presentation.
está
My presentation
transmitida.
is shared. Is that okay?
Se ve
Yes,
perfectamente,
it's
doctora
perfectly. We
Carlos.
can see it
Le
fine.
recordamos que
And
habla
we
en
will now
portugués
like to
español.
remind you that you have
Más cómoda hablando en portugués,
interpretation. If you feel more comfortable speaking in Spanish, it is
Me
possible.
gustaría hablar en
Sorry, in
español.
Portuguese. No, I would like to speak
perfecto.
in Spanish. Okay,
Gracias.
perfect. Thank you.
Entonces, estoy hablando
Okay, so here I
de
am
aquí,
speaking from
del estado de
Brazil,
Ceará,
from the
que se
state of
queda en la región
Ceará,
nordeste
that is in
del
the
país.
northeastern region
Tiene
of the
más o menos
country,
como
and it
9
has
millones
around
de
9
habitantes,
million of people
184
in
ciudades.
population with
Nosotros
184
somos
cities.
el
We
servicio público
are
de
the
transfusión de
public
los
service
vasos.
of
Somos
transfusion of the state.
relacionados
We are
al
related
gobierno de
to
estado de
the
Ceará. Tenemos
government.
5 regiones
We have
de
4
hemoterapia
regions of
y uno de sus
chemotherapy
coordinadores.
and
Esas
one
regiones hacen la cobertura de toda
coordinating
la
hemocenter. All of
política de
these regions
transfusión a
carry out the
todos los
transfusion of blood
municipios
throughout
del
all of the
estado. Y
municipalities of the
hacemos
state.
la cobertura
And here we are able to
como
carry out the
los
coverage to
184
around
ciudades.
184
No solo
cities.
tenemos
We
6
not
centros
only
de
have
colección
we have
de
6
sangre
centers of collection
y
of
donde se puede hacer también
blood, but
colectas
we're also able to
extramural.
find
Y
extramural collections, and
3
three
centros de
and three
procesamiento de la
centers of
sangre.
processing for
Nosotros toda
blood.
la sangre
And here, in reference to all to see the blood that is collected within the state, that is heading towards these 3 centers of processing. And one center that is able to provide the qualifying in reference to all of these services. And then all of this blood that is collected and that is processed in different components that is definitely sent to the promoters and in reference to see how where patients are, and therefore we are able to open these to the 184 cities, to 100% of public services of health of the state, and 90.8% in reference to hospital beds. We also have a very good attention towards the hospitals that are not necessarily public hospitals. Therefore, we have the attention for assistance for 14,574 hospital beds. And the premise for us is to be able to have the national policy of blood in Brazil that gives the voluntary donation as the only way of obtaining blood for transfusions in our country and in our state in the same way. So therefore, we have programs that are actions that we are able to develop throughout the whole year in order for us to be able to have voluntary donations, to be able to have the attention provided to all of the patients in the state. I'm going to share some of these programs with you. The program in most my city, they are extramural collections that are made from 15 to 20 collections on a monthly basis, and they're responsible for 40% of the blood collection in Ceará. And then after this, we have the decentralization of the fixed points of collections in order for the donor to be able to always have within them a unit for them to be able to carry out the voluntary donation. So here we have some points that wants to be seen here in reference to the capital of the state. We also have some action in reference to being able to request institutions, organizations, companies that they're able to carry out processes of spaces, donations of spaces for us to be able to have collections in their own unit. These are 2 different ends that are able to have this in Fortaleza, but it is also an action that is in the whole state. And we pass this on to be in these points in reference to 2 or 3 months. So those that are going to participate are able to have visits done and to be able to eat something in the mall and for them to also be able to have a voluntary donation at that time. And we have also an action that is very much similar, which is the Caravan of Solidarity in the color, this part that is seen for the other fixed points, groups from 5 to 6 people that want to make a donation. So we are going to look for them and then we are going to leave them wherever they want to be after the donations. We have here as an action in reference to the service of the state. And then we are to share the appreciation with them. We also shared everything that has to do with what is seen here throughout the state with the public recognition for whatever is donated here in reference to what they can find, they can have shared in their network, social networks and countries, institutions. To see here specifically, we have a loyalty program that is going to give them stars to every donation that is made. Therefore, every 5 donations from the first and every 5 donations, you start earning 1 more star in the donation end. So with 20 donations, then we also have a donor of 5 stars, and after 25, we have a mega star, and then they are able to receive small votes that they can have or that they can use. And if they come here to the service with them, then we have a priority of understanding. This is very much interesting because they are very much liking to be able to provide that testimony regarding the number of donations that they are making throughout life. With the donor as well, we also have other actions that I'm going to share with you in reference to the appreciation when the donor comes but is not able to donate. It is also in a temporary action. Therefore, we've already sent a thank you, and it is important because this is very much frustrating in a certain aspect because they were not able to carry out the donation, and therefore we like to receive these thanks because they came to be able to have this done in a tentative manner, and then we donate a message after some days in which they presented the donation for this to be also being done in reference to the donors of these specific groups, which definitely have negative and not always. And also, we are able to send a birthday card. Here we have 63,000 messages every month for the donors that were able to present the information recently. And in that way, we are also able to have the donors. We have a group, a specialized group to be able to have the placing. We have around 2,100 throughout a month of the response of 27.5 positive responses in this year of the year 2024. Well, the donors for the first time have received a differentiated assistance with an identification for each and in reference to the service, all of the collaborators are able to see that it is a first-time donor. So everyone knows that that person needs some kind of special assistance. And we are also able to have an individual interview. The interview or selection of donors, it's a different interview with them to be able to explain to them everything as in reference to how everything passes, the donation, and what they can have afterwards for them to be calm in reference to what is going to happen throughout the donation. And for the donor of the future, we also have an action with the students. For the past 16 years, we have a contest of videos, costumes, and we have the participation this year of 624 schools, but so far 3,064 schools have participated in this contest with 76,132 participations in reference to pictures, faces, and videos. Therefore, it is very important for us because when the students are able to get to an age in which they can donate, they're going to be motivated to be able to do this. And based on this work, the selected work, we are able to carry out a calendar, which is about seeing where it's going to be distributed, to be able to have the distribution for the schools, the services of health, hemo centers, and also other centers in reference to this. And we have an action in reference to being able to see this, to be able to work here with the schools, the universities, in reference to being able to motivation of donation. This has been a new action, and we have quite good acceptance in reference to society. We also spoke to the people in a general manner in our electronic website with the space of the donor, not only for blood, but for packets as well. And we are carrying out this space in reference to this end of the calendars of collections, and therefore everyone can actually know where we are making the collections on a day-to-day basis in reference to the Instagram and also the website where we are able to work on a day-to-day basis regarding the points that we are developing the collections in. The donor has a portal where they are able to know the number of donations that has already been made by them throughout their whole life, the information of negative serology. We do not send any information of exams. The exams are negative. It's a blood classification declaration in reference to service in order for this to be used for work and the communication of adverse reactions that they are able to carry out after they leave the hemocenters. And we have a very strong action in the social networks with Facebook, Instagram, which are the most important ones of the country currently. But Facebook we've seen that it's definitely increasing the importance, and we have worked with Instagram. I believe it's the first Instagram of the Hemocenters of Brazil, in which around 96,800 followers. And in the results of this work, we see that there is an increasing number, considering the stability from the year 2011 and donations and also transfusion. But what we want to have is for all the transfusions of the state to be assisted. And we also do have 100 Part C in reference to donations in the year 2013. 21.2 of the candidates are not considered to be suitable towards a donation, and therefore the efforts are to be able to get more than 20% of the number of donors that we need. Everything, it's 330 donations per day. And from the year 2021, we have more spontaneous donors than those that are doing this again, which is always that's provoked by the families and friends. And here now, we don't actually have this situation in reference to this activity in the state, with 97% of the donors getting to the hemo centers in a way in which it is spontaneous and voluntary without separating a patient that needs a transfusion. So I don't want to get to the donation in reference to the reposition, and also other results which are working together on a monthly basis. And every month of the year, we are to have more than 90% of the donations that we had in the same month last year. Therefore, that was the result of the year 2023. And the index of donations, spontaneous donations, as we have already mentioned here. The index of new donators is also something that we definitely always want to work with, so that we do not have any decrease in the future in reference to donations. And also, we have around 50% of the donors that make at least 2 donations every year, with 49.5%. Another thing that we continue seeing is the index of donors that are called, that maybe see this, as we have already mentioned. We are able to continue establishing this, and since last year we had around 15% of a positive response to this, and therefore we were able to work in a better and regarding this activity. And we have 27.5% in the 6 first months of this year. And then the campaigns, the collections in reference to this are also considering the results, because we already have actions as a suitable result, which is around 80% of what was programmed. So we only start seeing here the expectation in reference to being able to establish the campaigns, the actions that necessarily are taken on to this result. And this is in reference to being able to have a stock that is suitable for the need of the 500 health services that are in our responsibility. We there have the part of the evolution of the monitoring of stock here, specifically speaking, but we also have the monitoring of plaquettes and plasms. And the issue that we have here is an overstock. So last year we had, as an average on a daily basis, 14.8 days of stability of stock. And definitely we've had some actions so that we would not have more blood than what we needed. And while this work, there definitely is a monitoring on a real-time basis. Therefore, this is a dashboard that we are accompanying here for collections here. Today at 11 in the morning here in Brazil, we had everything that were made in reference to collections, the 6 points of fixed collections of the state. And then what we have in reference to the collections that are done here in reference to what we're seeing this time, and the 3 parts of the processing, the quantity of blood that is going to be processed in reference to being able to set that this is going to be seen in the processing services. And here we're also having the monitoring of the stock of the blood per group, and also in reference to our we have A positive, A negative, and then we also have a need, we have a goal for our service, and this would be in reference to between 7 and 14 days. So we have over 14 days, and we have between 7 and 14 days. So here, based on this monitoring, we have all of the actions in reference to the correction, so that as of the following days, we would have some kind of disability for more or for less in reference to the amount that we have in stock. And here the amount that we have in hemo centers to be able to have for distribution tomorrow, and the amount that is already located in hospitals, for us to be able to know exactly what is happening. Here in reference to the new challenges, we have donors, specific donors. It's not easy to always have quantities, large quantities of blood in reference to say a negative, CDE negative for each of these ends, and in reference to being able to select these for those that are seen here, in reference to be careful with the overstock, and in reference to these donations, and in reference to this part. And we do want to invite all of you to get to know our city. And we've shown this campaign that we are currently working on in June, in reference to being able to always have donors and a stimulation to these voluntary donors, and which we know is not something easy, but we are pretty sure that it is possible to be able to help a complete state with millions of people only with volunteer donations, without actually working in no way for the past 20 years in a donation of a reposition. And so I would like to thank you very much. Thank you. I would say thank you to all of you for the opportunity of being able to speak and sharing our experience with you. And I will, of course, be willing to be able to respond to any question that you may have in the discussions after this session. Thank you.
Muchas gracias, doctora Luciana.
Thank you very
Para
much,
seguir
Dr.
con la
Luciana. Just so we can please continue with the last presentation of this
se llama
morning,
Experiencias
which
del
is
Estado de
called
Sonora
Experience of the
de la
State of
Organización en
Sonora
México. Está
in
a cargo del
blood
doctor
donation in
Edgar
Mexico. Here we
Velázquez,
have Dr.
médico
Edgar
cirujano de la
Velasquez,
Universidad Autónoma de Sinaloa
surgical
y
doctor of the
magíster en
University of
Instituciones
Sinaloa
de
and
Salud Estatal. Desde
magister
2015
in
es
institutional health
director
since the
del
year
Centro
2015.
Estatal
He's been
Sonora
director of the State Center of
de
Blood
Transfusión Sanguínea en Sonora.
Transfusion in
Doctor
Sonora.
Velázquez, ¿nos
Dr.
escucha?
Velasquez, can you hear
Buen
us?
día a todos.
Hi, good morning to everyone.
Perfecto, lo escuchamos.
Muchas gracias. ¿Nos
Perfect, we can
permiten
all hear
para
you. Thank you
poder
very much. Can we
hacer la
please
presentación?
make this presentation?
Sí, ya debería
¿Sí?
poder.
¿Sí les aparece?
Todavía no.
Debe intentar, doctor Velázquez, compartir su
You
pantalla.
can try to share your screen.
Aún no la estamos viendo.
Allí les aparece.
Here we have this here.
No, si quiere la proyectamos nosotros.
If you want, we can put it. We can share
Un
it.
momentito.
Okay, give me 1 minute, please.
Doctor Velázquez, ¿podemos
Dr.
intentar con el
Velasquez,
apoyo
can
de
we
Ana?
try with the support of Ana?
Sí.
Yes, of course.
Les voy a
I am
compartir. Un
going
momentito
to
nada más.
share. Just 1 minute, please.
Doctor Velázquez, para poder avanzar, vamos a...
Dr. Velasquez, for us to continue, we are going to proceed with the projection that we have.
Ahí le acabo de compartir.
We can start sharing.
Doctor Velázquez, ¿nos escucha?
Dr. Velasquez, can you hear us?
Bueno, muchas gracias por la oportunidad de
And
poder
thank you very much for the
compartir el día de hoy
opportunity of being able to
con
share
ustedes
this
la
with you
experiencia que
today, the
tenemos acá,
experience
bueno, en nuestro
that
país, en México, sobre todo
that
en
we
el
have in our
estado
country in
de
Mexico,
Sonora, como bien se
especially in the
comentó.
state of Sonora, as
Parte de
it
lo que
had been
se ha
mentioned,
visto
part
en
of
esta
what had been seen
jornada, ha
within
sido importante
this has
compartir
been
cada uno de
definitely
ustedes
important to be able to
las
share within each
estrategias
part of
que
this.
se han implementado y que nos han
In
dado
reference to what
la
has been
oportunidad de
implemented
tener
and
más
see the
tiempo para la
possibility of being
asistencia
able
de
to share this
registros
parts and
sanguíneos de manera
in this and
segura. De
in
esta
a
forma,
safe manner.
creemos que
And
es
here we
importante
believe
este tipo de
to be able
coberturas
to
no solamente
consider these
con
kind
el
of
fin en
collections
mantener esta
in reference to
disponibilidad,
being able to
sobre
share
todo
this
en materia de
availability of
salud, ¿no?
products, but
Si
also the
vamos
safety of
al
these
siguiente, por
matters.
favor.
If we go on to the following
Como
slide,
todos,
please.
trabajamos a
And
nivel
as
mundial
all,
con
we are working in
Organización
a
Mundial de la Salud.
donation and in
Entre ellas
the
se han establecido diversas estrategias
WHO has established different strategies in
en cada uno de
reference to
los
be this,
países y
to
propiamente
seeing this in each one of the
nosotros
countries, and we, in
trabajamos por
reference to
el
the
impulso
statuses,
de la educación, la sensibilización
in
en la
reference to
comunidad,
the awareness in the
trabajar en
community,
nuevas
to be
generaciones
able
para
to work in new
permitir que tengan
generations,
mayor
for there
participación
to be more of a
ciudadana y que de esta manera
participation,
tengamos
and in a way
donantes
for
dentro de
us
los
to be able
centros.
to have
Es
donors
así como en nuestro
within
país y a
to
través
this
del
and
Centro Nacional de
and
las
throughout the
Transfusiones se
National
ha
Center
trabajado
of
arduamente
Blood
y en los
Transfusion, we've been
estados
able to
y que
see
hoy
here in the
precisamente
statuses
ustedes
what we are
parte de estas
presenting to you
estrategias que
here
hemos llevado
in reference
al
to the
cabo ya de
strategies of what we are
9
able to have
años y que sin duda
here
han
throughout
consolidado
the
el asunto
the past
sobre
9 years and have
respuesta
consolidated the
total en
status in reference
sanación
to a natural
voluntaria y altruista.
coverage in this
Siguiente,
and
por favor.
next slide, please.
Dentro de esto, como vemos aquí a nivel Latinoamérica, aparece nuestro país, México.
Here we
Sonora
see our country,
es una
Mexico.
pequeña fracción
Sonora
de nuestro
is a
país
small
donde
fraction of
se
our
tiene
country
una superficie
where
territorial
we
de más
have
de 179
a
mil
surface of
kilómetros. Nuestro clima es un poco
179,000 kilometers. Our
extremoso,
climate
calor,
is extreme,
frío. Mantenemos
uh,
la sierra, la
cold,
costa,
warm. We have the
playas.
coast,
Y
the
bueno,
beaches,
a
and
nivel de nuestro estado
in terms
tenemos
of our
casi 3
state,
millones de
we have
habitantes.
3
En nuestro
million
país, en
inhabitants. In
México,
our country,
son
in
más de
Mexico, we have a
127
hundred
millones de habitantes.
and
Nosotros representamos tan solo
27
el
million inhabitants, and we
2,3% de la población
represent
a nivel
2.3%
nacional.
of the
Y
population
en
at a
esto
national level. And
conlleva para la capital en
this
Hermosillo, donde se
means for the
encuentra
capital in
el centro
Hermosillo,
estatal,
where we have the national
aproximadamente
center,
1 millón de
we
habitantes, ¿no?
have
En el
approximately a
estado.
million
Sin
inhabitants,
embargo, parte de las
where
estrategias que se han hecho a
part of
través
the
del centro
strategies that have
estatal
been made
han
through the
sido
state
la
center have
activación de
been
12 centros
the activation of 12
con donación
centers
permanente
with
para la
permanent
promoción de la
donation
educación en donación
to
voluntaria
promote
en 12 ciudades
education
en nuestro estado y es
voluntary
así como
donations.
mantenemos no únicamente en la
And
capital,
that
en
is how
Hermosillo,
we
sino en todo el
maintain, not just in
estado,
the capital in
manteniendo
Hermosillo,
igual
but in the whole
manera
state,
una
we
regionalización de
maintain
los servicios de
a
sangre que se coordinan
regionalization
a
of
través del
blood
centro
services
estatal para
coordinated
el
through
estudio
the State Center
serológico, las
for serological
captaciones y
studies for
distribución de
recruitment and
productos
for
y así
distribution
mantenemos una
of products.
cobertura
And
de
this is how
disponibilidad
we
tanto en
achieve
el sector público
coverage
como el
of
privado. Y de la misma
availability
manera en
in
cada una
both
de las
public and
ciudades
private
pues
sectors.
mantenemos
And
lo
for each
que es
city,
una estrategia de
we
difusión
maintain
y
a
trabajo
strategy of
para lo
dissemination
que
and
se
work
desarrollan en colectas
for
voluntarias, ¿no? La siguiente, por favor.
voluntary collection or
El desarrollo que se ha tenido dentro del centro estatal los últimos
the
años
development
nos ha
within
llevado a consolidar
the
un equipo.
State
Cuando se
Center has led
inicia
us
el
to form a
programa,
team.
únicamente se
When
contaba
the
con una
program
trabajadora
started, we
social
only had
y
one
bueno,
social
dentro de este
worker.
trabajo no se tenía
And
la
in this
cobertura y el
work, we didn't
impacto, ¿no?
have
Yo
the
fungía
coverage
de
or the
igual
impact.
forma, aparte de mis actividades directivas
Aside from
como
my
encargado de promoción, valoración de
director
donantes,
capacities, I had
etcétera.
to
Y
assess
dentro de
donors,
esto,
promote,
bueno, se
etc.
fue
So
consolidando el
within
equipo
this, we
multidisciplinario que
built a
actualmente en las colectas
multidisciplinary
se
team
mantienen
and currently
10 miembros, 4 trabajadoras
maintains
sociales
10
que
members,
sin
4 social
duda son la
workers
parte
that
del pilar
are
fundamental
the
para la educación y
fundamental pillar
promoción,
for
las
education
vinculaciones,
promotion
el
and
área técnica que son
liaisons.
químicos
We have
y
the
el área
technical
médica,
area,
¿no?
which is the
Este
chemists,
grupo
and
está
the
integrado
medical area.
actualmente y bueno,
And this
hemos
is
desarrollado
the
diversos
group that we have
departamentos
formed,
que
and
nos
we've
han
developed
ayudado
different
a
departments that have
fortalecer
helped
lo
us
que es
el trabajo en donación voluntaria.
strengthen the work in voluntary donation. We created the liaisons area through this.
Instituciones de gobierno y de
We
esa manera se da una
connect to
cobertura
government institutions. In this way, we are able to provide coverage within the universities as well. There is a call center to
se mantiene
all donors. We have the activation of education in the primary care level and external collection activities, and a strategic part that has been mentioned in this day, which is the use of social media that represent an opportunity for everyone. And then the educational part that we're going to mention right now, that is a fundamental pillar for change at a global level. Within this, we also have the pillars of working within different donations means. We know that not everyone can do external collection, but we're creating education, especially in health participants, creating accessible and comfortable means so that we can have greater population participation. In the universities, this is an area of opportunity for all of us to work. And this is the population that eventually houses the greater number of voluntary donors. And companies, of course, have grown, and we will see one of the strategies and the activations in the health systems. But we have to remember that during the pandemic, a lot of the donations were reduced, but we also had a lot of heroes from the health sector. So we have worked on those institutions as participants, as donors. So this is the team that does the work for the state of Sonora.
Bueno, dentro de esto hemos
Within this,
creado
we have created in our state so that each collection center can transform its center, so that these are not serious, but that they are comfortable, that are welcoming, and that use the word welcome, and not just listing the requirements to donate, just to have a warm environment so that they can
las ventajas de
give
la donación
explanations about the advantages of voluntary donation, how this can impact them or the community, and the benefits for their families. And we will see next. This is what we have done in the donation centers, and we have shared this with the whole state.
Dentro de esto hemos
Within
tratado de
this,
que
we've tried to have all donors that participate have
y se vean reconocidos a través
feel
de
recognized
los medios digitales, ¿no? Por
in the
fotografías
media
compartidas
through shared pictures.
hemos tratado de
We
cambiar
have
esa
tried
noción de
to
reposición
change
por
the
donación voluntaria en
replenishment
100%.
donation for
Y bueno,
voluntary
parte de lo que
donation.
hemos
And
analizado y
part
que
of
se
what
ha
we have
visto
analyzed,
es el
that we have
reconocimiento en todos
seen,
aquellos que
is
participan, ¿no?
to recognize
Gracias
all
por
of those who
compartir, te
participate. The
esperamos
thank you for
pronto.
sharing.
Son palabras
We hope to
cálidas
see
que
you
nos ayudan
soon.
a que
These
la
are
población
warm phrases
tenga
that
ese
help
ánimo
the
de regresar a
population
nosotros y no se vean únicamente
want
utilizados,
to
¿no?
come back to
La
us and not
siguiente.
just feel used. Next.
Bueno, un trabajo que se ha llevado también,
Work that we have
comentaba, en
done
pandemia han sido en las
during the
instituciones de
pandemic
salud.
has been with
Se ha
the
negado
health
de que los
institutions.
participantes en
The
salud
participants in
puedan ser
health
excluidos para una participación, pero lo vemos que no. Hay muchas
can
personas
be.
en ellos que
There are
pueden
many
cumplir el
people
requisito para donar,
that
hay
can
otros que
comply
no,
with
y es por
requirements
ello
for
que se
donation,
les
others
promueve
can't.
una
And that
valoración
is why
integral
we
y se
promote
determina si en
a
realidad están en
comprehensive
condiciones de
assessment to
participar
see
o
whether they
existe un
really
riesgo en
can
ellos.
participate
Entonces, ellos
or
han
whether
sido un
this
claro
represents
ejemplo
a
para la
risk to them.
sociedad
And this is
de
a clear
participar
example
y que de
of
esta manera
participation
se
for
sumen
society. And in this way,
otros
we
actores, sobre
get
todo lo que se hizo en
others to
pandemia,
join,
que los
especially
actores
what we did in the
principales y
pandemic, and
héroes
that was
fueron
that the
el
main
personal de salud.
heroes were
Entonces,
the
ha
health
sido un
professionals
trabajo arduo
themselves.
que se ha
So
estado dando en
this
las
has
unidades
been a lot of work
hospitalarias
that has
y hemos tenido
been
una
done
mayor
in the
participación
medical
en ellos,
colleges,
¿no?
and we've
La
had
siguiente.
greater participation in this manner. Next.
Las empresas es otra de las
The
estrategias que hemos
companies.
empleado.
Well,
Las
this is another
empresas
strategy that
actualmente
we're using.
buscan un
Companies right now
reconocimiento
are trying to
en
get
nuestro
a
país. Se
recognition in our
establece
country.
empresa
Our
socialmente
country
responsable
has
y es
this
ahí
figure
cuando
of socially
ellos hacen
responsible
ese
company,
reconocimiento bajo la
and so they get
participación.
that recognition through
Ventajas
the
en ellos
participation. The
principalmente es
advantages
ver
are
en qué condiciones se encuentra su
seeing
población,
the
determinar el
conditions of their
padrón de
population,
donantes en quienes
determine a
participan por
pattern
grupos
of donors
sanguíneos.
who
Si
participates
alguien
per
sale
blood
con algún
group.
problema
If
bajo la
someone
valoración
shows
médica,
a
que sea
problem in a
canalizado
medical
rápidamente
assessment, they
para
can
una
quickly
atención
be
y en
channeled
aquellos que
towards care.
presuntamente salen
And those
reactivos,
that
alguno de los
are reactive to any of the markers that they can begin timely treatment. So these are the benefits that we provide the companies. Now see, we see more companies joining. We have more than 72 companies in the state, and
participaciones en el año para donación.
There are repeated participations during the year, and this is how many of them participate with us and promote within their bulletins in the companies. And this, it's continuous participation. And within this, in our state, we have also promoted the voluntary donor ID badge. This is something that protects them if they require blood or their family. So this has been a, and this is how the companies participate. Next.
En las universidades,
In
sin duda,
the
yo creo que
universities, I think that many of us work in universities. Nonetheless, it is important to work on education, and this is something that we will speak about next. And this has been an area of opportunity for us, especially in the different schools that you find within a university. You will see greater participation, and there's an area of opportunity for us to continue educating these people who will become productive adults, and we want them to maintain citizen participation. We want them to go to the hospitals, and this is why we provide seminars and speeches within the health modules, and there is participation in terms of collection through the mobile units, or maybe we're given a space for this. Next.
Dentro de lo que teníamos anteriormente en universidades,
in terms of universities, we have about 26 universities in the state where everyone participates, and there is active participation mainly in each one of the hospital universities. And another one of these important strategies for all of us has been
la transformación de las redes
the
sociales.
transformation through social media. We have to remember the 90s, and this is when social media starts growing. Facebook was created in 2004. Between 2005 and 2010, we see new platforms that bring greater interactions and participations within communities, and YouTube, Twitter, amongst others. And in this way, we see a growth of social media for 2011 and the use of digital media such as smartphones. And then we also see the pandemic, where at the end of that starts at the end of 2019, and this becomes an opportunity, and we saw greater creation of content, and we saw what the population wanted to share. And it's important to say that through social media right now, we're educating, creating awareness, and clearing up myths and taboos related to this work. Next. Here we see, if we click one more time, part of this digital media that we use right now are short videos with impact, sharing the experiences of those who go to donate, and this is how we can reach other populations through this contact. We also send sensitive information through the different platforms in our country, and we use the official web pages and the House Secretariat, and we plan new campaigns. We clear up myths and taboos. We tell them where they can go donate, and through these videos that are friendly and accessible, we get the participation of children, especially so that they can lose this fear and we can achieve greater participation. So part of this strategy in social media is what has helped us grow, and the population feels recognized through their solidarity. I think many of us.
La siguiente.
Next, please.
Otra de las cosas importantes
Another one of the important things that we saw when we came back from the pandemic was installing temporary modules. They stimulate other centers to create education and orientation for the community about the importance of sharing and the different donation requirements, the sites where they can go donate, and we're educating the center so that they can later, after the
ellos
traveling
ya
modules.
tengan los módulos. Entonces, esto nos ha ayudado a
So this
crecer,
has
sobre todo
helped
en
us
unidades de
grow,
primaria y
especially
atención
in
médica, en
primary care
instituciones de
level units
gobierno,
and
en
government
centros
institutions,
estudiantiles
in
y bueno,
student centers,
próximamente
and
estaremos creciendo en lo que
soon
son
we will
centros
be growing
comerciales.
in
La
commercial
siguiente, por
centers.
favor.
Next, please.
Ha habido otras áreas de oportunidad dentro de estos módulos
There's
itinerantes,
been
sobre todo
other
en
opportunities
empresas
with these traveling
de
modules,
deporte como
especially
son de
for
béisbol, donde hemos creado también la sensibilización en
athletic
la
or sports
comunidad.
companies,
Se han llevado
especially
los módulos
baseball.
que sean
We've taken
amigables,
the
que sean accesibles a
modules that
todos
can be
ellos y de esta
friendly and
manera
accessible to
tenemos una
everyone,
mayor
and in this way we
participación.
can get
Ahorita
greater
estamos midiendo
participation.
esa
Right now, we're
sensibilización que ya
measuring
se da
that
dentro de
awareness
los
that is
módulos y quienes
happening
acuden a nosotros como
within the
voluntarios
modules
y
and
dónde
who
obtuvieron esa
comes
información
as
dentro de estos
volunteers
módulos
and where
itinerantes. Entonces,
they
creemos
got
que la
the
educación a través de
information,
los primeros
or where was
niveles
the
en estos
module when they
módulos
got
nos
the
va a traer
information.
mayor impacto
And this
y participación en
will
la
help us
comunidad.
have greater
La
impact
siguiente,
and
por favor.
community participation.
Parte de las estrategias que
Part of
llevamos a
the
cabo
strategies that we
son
carry
sin
out
duda las
are
colectas externas.
undoubtedly the
Y las
external
colectas externas no
drives, and the
únicamente se llevan
external
a cabo a
drives
través
are
de una
not
unidad
just
móvil,
done
como
through
vemos
a
aquí,
mobile unit
sino
that we
también
see
en
here,
espacios
but
abiertos que nos
also in
otorgan las
open spaces
empresas, las
that are granted to us
universidades
by
u
companies,
otras
universities,
instituciones.
or other
Y estos
institutions.
módulos
And these
abiertos
modules,
los
open
decoramos,
modules,
los hacemos
are
accesibles con un
decorated,
área
we
de
make them
registro,
accessible,
un área de
we
toma de
create a
muestra, un área de
registration
valoración
area,
y
a sample
evaluación
taking area,
vivencial,
uh,
un área de grado en aquellos que ya salen
and
apto y un área de refrigerio
an area
para
for snacks,
posteriormente tener un
and
área de
so that we
preparación de
can later
productos para que
had
sean
a product
trasladados a
preparation
los
area so
centros
that we
para
can
su
transfer this to
procesamiento.
the centers
Y
for
cuando tenemos la
processing.
oportunidad de
And
viajar
when
en
we
la
have
unidad
a
móvil,
chance to
bueno,
travel
esta
in the
unidad
mobile
móvil pues
unit, this
acerca a
mobile
la
unit
comunidad un medio accesible, llamativo y
becomes
demás. Dentro de
accessible
nuestro estado mantenemos la
and
unidad
more.
móvil
In
inclusiva,
our state,
donde cada ciudad
and in our
adopta
state,
esta
we have
unidad por
a
mínimo
your
15,
state
20 días
mobile,
y hacemos
and each
actividades diversas para detonar
city
las
will adopt
campañas
this
en sus
mobile
propias
unit
ciudades
for
y así
15 or
el
20
Estado
days, and we have
mantener esta
activities for those
permeabilidad de
days.
la
And
disponibilidad
that's how we
de
create
centros de donación.
availability for
El
donation
siguiente.
centers.
El call center ha sido
The
uno de
call
los medios
center has
que
been
nos han
one of
apoyado para
the
dar seguimiento a los donadores
things that
voluntarios
has helped
y
us
sobre
follow
todo
voluntary
tener este
donors,
medio accesible para la
especially
comunidad, para
having
la
this
orientación sobre
accessible
requisitos para
measure
donar,
for the
en dónde pueden
community,
acudir a
for
donar,
requirements
los
for donation,
horarios
where they
y
can
que
go
nosotros
donate,
demos seguimientos
the
a ellos. El
schedules,
siguiente.
and next.
Tenemos un soporte
We have
informativo para toda la comunidad y el seguimiento, sobre
information
todo ver
support and
cuál fue su
follow-up. We
experiencia
want to
en esa
see
donación y
what
cómo se
the
sintió.
experiences were
Y que
like
de
during
esa
the
manera, a
donation,
través de
how
esta
the person
continuidad
felt. And through this
telefónica y
continuity
acercamiento,
through phone,
mantengamos esa
we can
fidelización y que
maintain
ellos
loyalty,
continúen
and that they
participando en
can
la
continue
donación. Y
participating
de
in
esta manera
donations
también
or
hemos
drives.
creado un
And
vínculo más
this is
cercano con todos los
how we
donantes.
create a closer relationship with all
Otra de
the
las
donors.
estrategias
Another
educativas,
strategy
sin duda nosotros
for
creemos que la
education,
educación
we
va a ser
believe
la
that
base del cambio
education
en la
is
donación
the
voluntaria. El
foundation for
trabajar en las
change
nuevas
in
generaciones
voluntary
sin duda nos
donation,
va a
and
traer
working on the new
que las
generations
nuevas
will
generaciones al
mean that the
crecer
new generations, when
después
they
puedan
grow
tener una
up,
participación ciudadana. Ya
they will
estamos viendo ahorita
express
con
their
este
citizen
modelo que llevamos
participation.
5 años
And
en
in
nuestro
this model
estado
that
con
has
esta
5
educación
years in our
continua,
state
que
with continuous
personas que ya
education, we can
estuvieron
see
en
that people
secundaria y
that
preparatoria ya los
were
estamos viendo en la
in high
universidad como
school, we're
donantes.
seeing them
¿Dónde
as
nos
donors
dieron
in
cuando dimos
universities,
estas
and
pláticas?
they learned
Como
about
vemos
this
el
when
eslogan
we
aquí, son las
did
alas
this.
y un libro, la
And
educación en
this is
donación, la
the
parte
slogan
superior de
here.
color verde es la
In
donación de
green,
órganos y
we
tejidos
have
establecido en nuestro
the
estado
donation
y en nuestro
of
país.
organs
Y
and
bueno, al
tissue,
final
and
vemos por
in the end,
consiguiente
we
una
see
educación en donación y una sangre
an
segura. La
education
siguiente.
in donation and
Parte del
safe
material
blood.
educativo que utilizamos en
Part of the
primaria son dibujos
educational
coloreados
materials that we
y
use
animados
for
para los niños.
elementary
En la parte
school are
posterior ellos llevan un
coloring
mensaje a sus
pages
papás,
and
a quién se impactan con
games.
la donación,
And this
dónde
is
pueden
something that they
acudir a
can take to
donar,
their
cuántas
parents,
veces al
where
año
they
se
can go
puede donar
donate, how
y
many
se
times a
convierten
year
en
can you
héroes.
donate.
Entonces
And
invitamos a los niños para que
so we
ellos
invite
lleven a sus
children
papás y
to
sean los héroes.
take
En
their
secundarias
parents and
cambiamos
be
un
heroes.
poco la
In
información,
high
sobre
school, we
todo en
changed the information a little bit in terms of knowledge, especially, and the same for universities. Right now, we have digital material that we allow us to reach more than 250 school platforms, and we had 5 educational modules.
La función del organismo la
the function
estructura
of
de
the
los servicios de sangre
organization,
y
the
cómo se hace
structures
un
of
proceso de
blood
donación.
services
Entonces,
and
han sido
donation
cuatro etapas
processes.
muy
So
importantes,
these have
los
been
cuales
4
sin
important
duda creemos
stages,
que con esta
and we
educación
believe that
permanente
through permanent
seguiremos viendo
education,
mayor
we can
participación
continue
y sobre todo población
seeing greater
mayormente educada.
participation and
La
a
siguiente.
better educated population.
Parte de esto también en los
Part of this,
niveles medios hemos
at middle
trabajado
levels, we have
por llevar las
worked
ferias educacionales donde
on
se lleva la
bringing
unidad
educational
móvil
fairs where
y
we
se llevan
take
las
the
botargas, se
mobile
llenan
units,
bolsas de
we take
gelatina, de
bags,
sangre, para que vean los niños
blood bags, so that the
y
children
y
can
aprendan
see
cuál es el
and
efecto de
learn
la donación y sobre todo el trabajo
what
que
happens
desempeña
with
el personal de salud
during
y que
donation
ellos
and the
vayan
work that healthcare
teniendo
professionals
ya un
do, and so that
conocimiento y
they
sobre
can
todo que
gain
pierdan el
knowledge
temor a
and
la
that they can
participación en
lose
las unidades
fear of
hospitalarias.
participating
La
in
siguiente.
hospital units. Next.
Parte de lo que ha hecho nuestro
Part
país
of
ha
what our country
sido
has done
un
has
concurso
been
en el 2002,
a contest in
22,
2002
donde se estableció el concurso de
where
dibujo
they
infantil.
established
Sonora
the
fue el estado con
Sonora
mayor número de dibujos
Children's Group. This was
ingresados a
the
una
state with
plataforma a
the
nivel nacional
greatest number of
y Sonora
drawings
de igual manera
at a
fue
national level, and Sonora
el
was
estado con el
the
dibujo
state
ganador, lo
that
cual
had
creemos
the
que el trabajo educativo
winning
nos ha dado un
drawing.
resultado en
And
la
we believe, therefore,
participación
that
en las
educational work
escuelas de
has
primer
brought
nivel.
results.
Y bueno, hoy lo vemos reflejado donde
And today
Sonora
we
tuvo
see
ese
this
primer lugar a nivel
reflected
nacional en dibujo infantil, pero
in
sobre
the
todo
children's
que los
drawing.
niños tuvieron una participación
But
y
we
un
also see that
conocimiento sobre
children
la
had
donación de
knowledge
sangre.
and
La
participation
siguiente, por favor.
about or
Lo
engagement
que
with
hoy se
blood
está
donation.
trabajando
Next,
en este
what we're working
2024 y
on
se
in
festeja
2024,
a partir del día de mañana, como todos
and we
ustedes,
will
el Día
start
Mundial de
celebrating
Donantes de
tomorrow,
Sangre,
which is
se
the
lanzó una convocatoria, el
Global
primer concurso
Donors Day.
estatal de oratorio
We
infantil
will have
en
the
todos los
contest
planteles de
with
nuestro estado de Sonora,
child
donde
oratory in all
participaron
the
cientos
states
de
of
niños.
Sonora, where
Y
we had
bueno, tenemos la premiación para el
participation of
día
hundreds of children,
17.
and
Se
the
modifica nuestra celebración
prizes
acá
will
en
be,
nuestro país por
the winners
agenda
will be
de
picked
nuestras
on the
autoridades.
17th of,
Y bueno, vamos a
and
tener la premiación al
we will
primero y segundo y
have
tercer lugar.
the
Entonces
first,
seguimos
second, and third
creando una
places. So we're
educación que creemos que es la base del cambio
continuing with
de
the
la nación
education, which we
altruista
believe
en los
is
futuros
the basis
participantes,
for
¿no?
change
Entonces, esa es
towards
otra de las
altruistic
estrategias que tenemos.
donations.
La
And
siguiente,
this
por
is one
favor.
of the strategies that we
Y
have.
bueno, en
Next. And
síntesis,
well, to
creemos que
summarize,
mucho
we
del
believe
trabajo que
that
se lleva a
much of
cabo
the
en
work that
nuestras
is
unidades
done
hospitalarias
in our
va a
hospital
depender de la
units
iniciativa
will
propia,
depend on
no
the initiatives,
únicamente lo que
not
nos
just
puedan compartir otras
on what
personas,
can be
porque cada
shared
uno de
by other people,
nosotros en
because
nuestros
each one of
países,
us
en nuestros
in our
estados,
countries, in our
tenemos sin
states,
duda
has
una experiencia distinta. Sin
a
embargo,
different
tenemos
experience.
muchas áreas de
Nonetheless, we have
oportunidad
a lot
en
of areas of
compartir todo
opportunity
esto,
when we
de qué
share all of
cosas
this
podemos implementar en nuestros
about what
estados, en
we can
nuestros centros
implement in our
de
states and
donación y que
centers,
tengamos una mayor
and so that
participación.
we can have
Siempre
greater
recordar que
engagement. We
hoy
always have to
son
remember that
pacientes quienes lo
today
requieren y que
the
el día de
patients
mañana
are the ones who
pudiéramos
require
ser
this, but
alguien de
tomorrow
nosotros
it could
que
be one of
requiriera el
us
apoyo de una sangre. Es por eso
requiring
la importancia de
some
participar en donación
support
voluntaria y
in terms of
reconocer que
blood.
bajo los
And that's
estudios
why we have to
establecidos,
work on
sangre
voluntary
voluntaria
donations,
dice que
and we
disminuye
have to
riesgos
see
para
that in the
factores
studies,
como VIH,
voluntary
hepatitis
donations
B, C
reduce the risk of
sífilis y bueno,
factors
nos
such
da
as
un
syphilis,
mayor
HIV,
índice
and
en lo que
others,
es la
and
reactividad bajo los estudios serológicos. Es la
gives us greater
importancia de que
reactivity
se
in
ha hecho,
serological
al
studies, and
menos
that is
en
the
nuestro estado y en nuestro
importance
país,
of
compartido con
the
nuestras
studies that we've
autoridades.
had in
Esperemos que
our
parte de lo que hoy se
state
haya
and country, and we
presentado
hope that part
sirva
of what
para
we
otros
presented today
poder
can be
fortalecer sus
useful
sistemas
to
de
others
sangre.
to
Muchas
strengthen their
gracias sobre todo
blood
también
donation
a
systems.
quienes hoy
We would
nos han
also like
invitado a
to
participar
thank
en
you for
estas
inviting us
ponencias,
to
agradecer a los
participate in these
organizadores y
presentations.
bueno,
We'd like to
quedamos
thank the
atentos
organizers,
de cualquier duda que
and
se tenga
we're here
referente
to clear
a
up
nuestro
any
trabajo. Muchas gracias.
doubts referring to our work. Thank you very much.
Muchas gracias, doctor Velázquez.
Thank you, Dr.
Ahora
Velázquez.
pasamos a la
Now we will
breve
go
sección
with
de preguntas y
the
respuestas
short
que
Q&A
la va a
session
moderar el doctor
that will be
Beltrán.
moderated by Dr.
A
Beltran.
los ponentes que están en
To the
Zoom, por favor, les
speakers that are
pedimos
in
que
Zoom,
estén atentos
we
en
ask
caso
you
haya alguna
to pay
consulta
attention in case there's
para
a
ustedes y
question
si
for
es
you.
posible
And
puedan
if
activar la
possible,
cámara si es que nos dirigimos hacia ustedes.
if you can look at the camera if you're speaking.
Muchas gracias, Adriana. Bueno,
Thank you, Adriana.
estamos llegando o llegamos ya al final de
We are almost at the end of
presentaciones.
the
Vamos
presentations, we're gonna start. If there is any questions in the audience, if anyone has a question or comment, now is the time. Otherwise, well, I'll start with the comments and questions that I've received in the Q&A and chat. Anyone? Anyone? Okay, no. So no comments in the room. There are some comments that we have received regarding the celebration. I'd just like to remind you that this is the 20th year of the resolution of the Global Association of Donors. Obviously, there's been other celebrations, and PAJO started in 2004, and many countries had celebrations before that, but formally, through the recognition of the year, this is the 20th year of the resolution that was issued in 2005, promoted by the Global Assembly. The promotion of donation and voluntary donation includes many stakeholders and strategies, institutions in the health system that relate to the state, amongst states and other private and public stakeholders under the leaderships of the ministries of health with their guidelines to make all of these activities possible.
Vamos a empezar con las preguntas
We're going to start with the general questions, and I don't know if you can turn on your cameras. We are not able to see the cameras of, well, if you can turn on your cameras, the speakers, the panelists, please, and we can focus.
Si no, vamos.
Otherwise, we will.
Voy a hacer unas preguntas generales.
Well, I will ask some general questions for everyone, and we can go to you in the order of presentation. I see them here. I'd like to thank the speakers who, if you can turn on your camera. So I'm going to ask 2 or 3 general questions, and then I'm going to ask in the order of presentation. The first, are there encounters for promoters of donation in your countries? So, Dr. Silvina. Thank you very much, Dr. Mauricio Beltran. Thank you for the question. Argentina has a network of community promoters of blood donation. It's very well organized by NGOs and other organizations and persons that have the role of promoting voluntary donations in our hospital. Each end of year, we have an encounter with community promoters, and we also provide training for community promoters, as I expressed during my presentation under our overview or point of view. They are part of our procedures and they participate so that we can improve the quality of care.
Dr. Fuentes.
Dr. Fuentes.
Siempre algunos inconvenientes respecto
We always have certain inconveniences regarding what can we do to promote. The most important point is to go out of those blood banks. If we don't go out of the blood banks, obviously the problem that we will have is that we're going to continue with the donation for replenishment. And one of the things that we're always concerned about is when one asks the people, why don't you donate? It's because, well, many of them have a pretext. And the social responsibility is vital. 3 comes, banks have to leave their spaces of comfort and go to where the blood donor is. And the third one is educate, which is the most important element to sustain this.
Gracias, Dr. Fuentes. Se nos adelantó con las preguntas también. Muchas gracias. Dr. Gaviria.
Thank you very much, Dr. Gaviria. There are national encounters of donors. Thank you very much for the presentation, for the question. We as the Red Cross, we have a training program and we are able to have a quarter encounter with all of our territorial network. And also within this training plan, we have two objectives. One is in reference to the training of all of the promoters, and the other one is in reference to the preparation of documents and manuals and preparing a manual of assistance where we are able to look into formalize the attention of our donors in the whole territorial network.
Doctor Curbelo, entiendo que nos puso un
Dr.
mensaje por
Curbelo,
interno que no puede
thank you very much. I believe you said internally that you cannot be
la
here,
experiencia que
but
vimos, que es otro de los comentarios llegando a esta presentación, ustedes
in the
vieron además de lo
experience
que
that I said in reference to being able to set here what I was having to do in reference to being able to set this and all of the transit that there is in reference to the surprises that there were here, or to see how this was being done, of not only seeing adult people, but to also think about children. You saw the experience of the last two presentations, or the last three presentations,
la motivación incluso a las cátedras.
in reference to the motivations that we were able to establish this.
Doctora Luciana, hay encuentros de
Dr.
promotores de la
Luciana, here we are able to see this part in reference to the donation.
En nuestro estado, sí.
In this status, yes, we were able to see here that there was a annual encounter in a seminar that we have in reference to everything that is done by the state. But nationally speaking, we had actions that were very much important until the last government, and these actions were interrupted. And so far, we are still organizing again what had been seen nationally, but we, in every hemo center of the states, we have a group of collectors. Sorry, Juliana, can you just give us 1 minute, please? I apologize.
Bajaron el canal acá a la sala en francés.
Sorry, we were here in French here in the room. I apologize. 1 second, please.
Les pedimos que por favor nos bajen el canal en
If we can
español
please put
para
the
la sala.
channel in Spanish, not in French here for the room, please.
¿Ya?
Very good.
Sí, no, es el traductor. Es el traductor.
Yeah, sorry, we were hearing the translation
Adelante,
into
doctora
French.
Luciana, puede volver
Okay,
a
go ahead,
responder la
Dr.
pregunta,
Luciana. We
por
can go
favor.
ahead and respond to the question. What I was saying is that here we do have an annual action, but in Brazil, it's about 5 years in order for us to be able to have some kind of action and going back to be able to set the donations end. Thank you very much.
Doctor Velázquez,
Dr. Velasquez,
hay un encuentro estatal o nacional
there is a
de
state or national
promotores de la
encounter of promoters of donation.
Gracias, doctor. Sí, a nivel
Yes, thank you.
nacional en nuestro país, a través del
And
Centro
nationally in
Nacional
our
de
country,
Operación
throughout
Sanguínea,
the
se
national
comparten
ends of
los
this
resultados, ¿no?
part,
Parte
we're
de esta
able to see this
experiencia,
with
sobre
the
todo en las diversas áreas
experiences in reference
que
to the
conllevan la
different
formación de
areas
los bancos.
that lead
Y la
on to the
experiencia que
formation
tenemos en
of
nuestro
banks as an
estado, que
experience
acabamos
we
de
have in our end
concluir el
here
foro estatal
in
por
reference to what
nación
has been
voluntaria de
met of
sangre
the
hace
donation
2
and
meses. Y el objetivo
for
fue esto,
blood 2
intercambiar
months
las
ago. And the objective
experiencias
was
en
to
cada
be
una de
able to
las
exchange
ciudades
the
y poder
experiences in
brindar
each
las
one of the cities and to
estrategias
be
que
able to
ellos
provide
deberán de
strategies
implementar y
that they are
desarrollar.
to be
Y
able to
sobre todo
implement and
pensar
develop. And
en qué vamos
overall,
a
to be
utilizar con el
thinking
mínimo de
about the
recursos
fact that
para
we need
poder
to be
hacer
thinking with the
acciones
minimal
que
resource
nos impacten, ¿no? Sobre todo,
to be able to
sabemos que no
develop
todos los
actions.
centros
And we
tienen la
know that
capacidad
not
de
all of the
personal,
centers have the
pero hay
capacity of
áreas
having
donde se
staff,
pueden
but there
vincular
are
y forma
areas where
parte de
we are
las
able to have
estrategias
these
que se
linked, and these are
brindaron
part of the
en este
strategies
foro.
that were
Y
set
mucho del
in
trabajo que
this
se ha
forum.
presentado ha
And
sido
much
a
part
partir de
of
este
this
ámbito
has
de
definitely
los
been in
promotores
this
de salud.
first and in reference to the promoters of health.
Antes de continuar con la siguiente pregunta, recordarles a todos los participantes, tanto presenciales como virtuales, que a las 2 de la tarde, hora de Perú, continuamos online con la siguiente sesión de organización de servicios de sangre. Por favor, haremos una desconexión sola para el almuerzo después de una presentación que vamos a tener acá, que se puede ver también online, y continuaremos en la tarde para que se mantengan conectados. Hay una pregunta que la voy a hacer también general, es ¿cómo canalizan ustedes la solidaridad social y la solidaridad social empresarial en la promoción de la donación? Ahora voy a cambiar el orden. Voy a iniciar por el último participante, doctor Velázquez, y termino con la doctora Silvina. ¿Cómo canalizan la solidaridad social y la solidaridad social empresarial en la promoción de la donación?
Bueno, parte de las estrategias que se llevan a cabo, sobre todo en lo empresarial, es ver los beneficios e impacto que tienen ellos ante la sociedad, ¿no? Al compartir, al ser empresas socialmente responsables, ¿no? Y bueno, la participación y vinculación ante la sociedad es que bajo la participación de otros, impactamos a ellos, ¿no? Bajo sus necesidades. Y es así como se trabaja, ¿no? Arduamente, que gracias a las colectas externas podemos ayudar indudablemente a quienes no tienen, ¿no? Un donante o que son foráneos a una institución cuando se canalizan para una atención médica. Es así como vinculamos las dos partes, ¿no?
No se lo escucha el doctor Beltrán.
We
Sí,
cannot
hemos
hear Dr.
perdido el
Beltran.
audio.
Yes, we've lost the audio of the room.
Ahora sí, gracias.
Sí.
Now we
¿Cómo
can
se
hear you.
canaliza,
Thank you.
doctora Luciana, cómo se canaliza
How are we able
la
to
solidaridad,
channel the
la responsabilidad
solidarity
social y
and
la
in
responsabilidad
reference
social empresarial? ¿Cómo es esa
social
integración en
responsibility?
pro
How is that
de la sociedad
related
civil con
in
la
reference to civil
sociedad empresarial
society with
en
the
pro
business society
de la donación
in
voluntaria?
reference to the voluntary donation?
Programa que llamamos
Here we had a program in reference to the citizen organizations in reference to this, which is in reference to organization, institutions, and also government organs that make an agreement with us
que ellos dejen que trabajemos
in reference to being
entre
able
sus
to start
colaboradores
working within the
y
clients and collaborators and some
firman
ends.
un acuerdo y entonces
They
hacemos
sign an
por lo
agreement
menos
and we are
dos
able to make
colectas
at
por año
least two
en estas
collections
instituciones y ellos
in
reciben
reference to these institutions, and they are able to give us a screen in reference to being able to have this a social responsibility. This is a very important action that has about 25 years in which we've been having this program, and many institutions are, let's say, have been searched in reference to this participation, but the others that don't want to have this kind of knowledge as well, we also receive, and we're also able to have controllable actions with them. So right now we are always having some kind of associate uh, that is not going to earn anything in reference to this end, but it's very important to be able to see that we have these actions with the clients. Sometimes we are able to see the fact that there are rooms,
tiempo de sus colaboradores.
time from the collaborators. So this is a very important action. I believe this will definitely create potential in reference to everything that we do to be able to promote the voluntary promotion in the state.
Doctor Gaviria.
Thank you.
Para la Cruz Roja Ecuatoriana, creo que
For
la
the Red Cross in
integración
Ecuador, I
empresarial
think
es
that
fundamental.
the business end
Primero
is
lo tenemos
fundamental.
formalizado por muchos
First, we need to
convenios y
formalize these for
acuerdos
different
con las cámaras
agreements
de comercio de cada una
with
de las provincias
the
y
Chamber
un
of
poco
Commerce of each
lo que
one of the
nosotros
provinces. And what
buscamos
we are
con estos
aiming to do
convenios es
together with
primero
these parts
sensibilizar y formar a
is to
todo
create
el personal
awareness
de talento humano y
in reference to the
y
whole staff
trabajadores
and
sociales de
the
las diferentes
social workers
empresas
of the
y
different
que nos
companies,
ayudan a que
and
nosotros y
for us
todo
to
el
be able
personal
to see
podamos
that
capacitar,
we are able to
sensibilizar
train, create
previo a la
awareness
donación.
previous to the
Luego nosotros vamos
donation.
a hacer las
And then after this,
captaciones
we are
con
going to
todas
be
las
able to
empresas
collect this
y
from all
pues
of the
obviamente
companies.
les damos
And
una
after this, we are
asesoría
going
con
to
el
give an
proyecto
advisory in
del
reference
carnet
to
de
the
donación
delivery of the
voluntaria
carnet of
y ese
voluntary
vehículo
donations.
es el que nos ha
And this
podido
link is
llevar
the one that
a que
has been
tengamos
able to
un
take us to
crecimiento
be able
en
to
la
have a
donación
growth
y sobre
in the
todo el
donation and
crecimiento de
overall in the
donaciones
growth of
voluntarias y altruistas
voluntary
que
donors
recibimos de todo el
that
círculo empresarial a
we are
nivel
able to
nacional.
get from this whole service nationally speaking. Thank you very much.
Doctor Fuentes.
Dr. Fuentes,
Quisiera enfocar en
I would
tres
like to
cosas que
focus
hemos
on three
trabajado.
things that we've been
Primero, la
discussing.
experiencia con
First of
Cencosud.
all, the experience with
Pronto las líneas
Cencosud. As you've probably all
internacionales
seen in the supermarket
firmamos un
network,
convenio entre el
we were able
Ministerio de
to
Salud y el sector
sign an
privado
agreement between
y
the private sector.
proporcionaron
We were
los
able
espacios
to
justamente
have
para
these
esta
spaces
colecta
provided for this
que se llama
collection.
puesto de extracción hemática y actualmente
And
existe.
currently,
El
this is
otro
still
fue
is a
con
persisting. The other one was
gobiernos
with
locales.
the local government.
Tenemos un puesto de extracción hemática
We have a
en la
point of
municipalidad de Chorrillos,
extraction with the
hemos firmado un
municipality of
convenio
Chorrillos. We've
en
actually
Guaylas
signed
para
an
poder
agreement
visitarlo.
in Huaylas.
Y
Whenever
el
you
tercer
can
componente es
visit
que
it.
hoy
And the
día,
third
por ejemplo,
component that we, for
no se ha
example,
dado una
today,
resolución
there has been a
ministerial
resolution, a
o una
ministerial
iglesia
resolution given with
en lo que es
a
todo lo que es promoción y
church
colecta
in
de
reference to what
sangre.
has to do with
Entonces, no
promotion and
solamente en
collection
el sector
of
privado,
blood,
sino
not
también
only in the
queremos
private
utilizar
sector, but we can
los
also
gobiernos locales
use the
¿no?
local
y las
governments
iglesias,
and
etcétera.
the
Entonces,
churches, etc.
está
So
abierto prácticamente para todos, ¿no?
this is open for basically everyone.
Doctora Silvina.
Thank you very much, Dr.
Muchas
Silvina.
gracias. Para
Yes,
no
thank you very
repetirme,
much. Just to
muy
not
parecido a lo
repeat
que
myself, this is
decían mis
very much
colegas, a
important
través
in
de
reference to what the colleagues are
acuerdos
saying. These are
con
through
actores comunitarios,
agreements,
la
promoters.
responsabilidad social y
The
humanitaria
social
tenemos que aumentarla y
responsibility is
tenemos
definitely an
alianzas con estas
advantage. We're
empresas,
making
pero
alliances with
creo que
these
la
companies.
clave
But I
estuvo
think
en
that what is
haber
key
cambiado
was
la
about
cultura,
changing
no
the culture,
de las
not
empresas, sino
of
de
the
la donación
companies,
de
but of
sangre. Cuando
the blood
nosotros
bank.
pudimos
When
no hacer
we were
natural
able
y
to
pedirle a los
not making
pacientes
it natural
que
to
nos
ask patients
ayudaran a
to help
sostener un
us
inventario que
to
satisfaga las
sustain an
necesidades,
inventory that would
cuando el
satisfy
banco
their
de sangre hizo
needs
el clic, ¿no?
in
Salió
reference
del
to
status
being able
quo,
to see this in the status
la
quo
comunidad
and
respondió.
also in the
Entonces,
community will be
cuando hablamos
responding.
de
So
cambiar la
when we
cultura de la
speak about
donación,
changing the culture and the
cambiar la cultura
donation,
de la
I
atención.
think we also need to
Como
see this in reference to
consecuencia,
the
va a
attention. And as a
cambiar la cultura de
consequence,
la
we are
donación.
going to be the
Porque
change
las
in the
personas
culture
no
of
donan
attention
porque están
because here people
acostumbradas.
don't
Lo que les
donate because
enseñamos es
what
solo
we are
donan cuando
teaching them that
necesitan
they
o
only
tienen un
donate
familiar
when
que
they need a
necesita.
friend
Entonces
or
ahora
a
tenemos que
neighbor or a
enseñarles
family
a que les
member. We need to
aprendan
teach them
lo que
that they
les
also need to
enseñamos
be
en
able
un
to learn
momento
what we've taught them at one
y en
moment
ese
in
gran
time.
trabajo
And
es más
also this is the same
nuestro
work
que de
which
la
is more
sociedad.
hours than of the society.
Gracias, doctora Silvina. Voy a hacer
Very
una
good,
ronda
Dr.
por cada
Silvina.
uno.
Thank you
Igual
very much. I'll give a round for each one, and I will
una,
ask
según
the
tengo
two
acá
or one
lo
according to
posible
what I
de
have here that
cada
we've
uno de los
received
ponentes. Y ya que la
for
tengo
each one
ahí,
of the people. Now that I have it here
doctora Silvina.
in the microphone,
Sin
Dr.
duda alguna es una
Silvina,
gran experiencia
this
en
definitely is a great
Latinoamérica y hay una
experience for Latin
vinculación muy
America. There
interesante
is a very good
con los ministerios.
engagement
Esa es
done
una
with the
pregunta. ¿Cómo ha
ministries.
sido ese
That is one
relacionamiento con
question.
los
How has that
ministerios? Y la otra,
engagement been with the
¿cuáles son las
ministries? And the other
mejores
one is what
recomendaciones
are the
en
best
salud
recommendations of
las mejores recomendaciones en la
let's say the
donación.
best
Y una
recommendations
última
in
que son
donation, and the
técnicas
last
respecto
one,
a
which is very
ello,
much technical in
para
reference
que
to Dang. So
para toda la sala respecto a las recomendaciones
this
de
is not
ello
for
y
the whole
voy a
area
hacer
in reference
una
to the
propaganda
recommendations
y
of
asumo
Dang, and I
una
will just
discusión de los
finish the
criterios
publicity,
de
and I will put on the
elegibilidad que
discussion in
están
reference to the
próximos a
criteria of
hacerse
eligibility
de
that
su
are about
donación. Adelante
to
con
see
la
here in
respuesta, doctora
reference
Silvina.
to in this
Voy a
end.
empezar por la última. Cada país, como sabemos, tiene sus propias
In
recomendaciones, sus
reference to being
normas,
able to
sus
set this
recomendaciones,
part,
pero bueno, hay un
and to the
consenso
recommendations,
general
of
que
course, in
lo que
reference to being
resaltan es
able
el
to see
cambio
the
y por supuesto
potentials
la
that there are
clínica o
being,
evidencia de
and the
laboratorio
reference
de
to
nutrición
different
por el
suspicions
mundo
and
deben
to
ser
the
tomados en
Dang, this
cuenta
should all
para
be
poder
deferred
hacer
in
una
reference
evaluación
to
clínica completa
the 30
o
days after this
realizar el
clinical ends, and
diagnóstico.
also in reference to the
Los potenciales
diagnosis.
donantes que haya sido en
The
dengue, pero en no
potentials that there
trágico,
were in
debían ser
Dang
inferiores por
definitely
4
should be
veces
deferred in
respecto a cierto
reference to
filtro,
this
obviamente
part.
teniendo en cuenta la particularidad
Here, in reference to the
clínica y
particularity of
etiológica
the
de
clinic or
cada dengue.
symptoms of
Eso con
each donor.
respecto al dengue.
This is in
Con respecto a
reference
la
to
iniciativa
Dang. In
latinoamérica de
reference
donar
to the
sangre, la
initiative, it says in
recepción de
reference
los
to the
programas
donation of blood,
nacionalizados en
the
naciones
reception of
es
programs and national
excelente.
directions is
Acompañan a los
excellent.
productos de
It
sangre, acompañan
shares
a los
and
promotores
accompanies the
comunitarios,
services, it accompanies
está
the promoters in
filosofía
this philosophy
digamos, o política que es la más
or
efectiva para
policies
tener
that are the most
un programa
effective
de donación
in a
100% voluntario,
donation
que es la
program that is
integración
100%
de todos los
voluntary, which is
niveles.
the integration
Cuando
of all of the
sucede
levels. results. Changes happen from upward and also downward, and also seeing here the change that is done that is quite very much difficult. And the third question in reference to being able to see recommendations which are the ones that are seen here in reference to this part, to be able to get the donation to the community, to have this action of donating accessible, to being able to work with community and as part of the teams of blood services, to be able to work with the good practices and systems of quality that allow us to be able to systemize the continuous improvement and also to be able to have a good program of communication and diffusion. I think those are the four parts that are presented and that would be our recommendations on a macro level.
Doctor Fuentes, perdón.
Dr. Fuentes, very good. When you talk about the survey and the opinion of the user, there are questions. What does the survey mean and what is it when considering the opinion of the users? Well, here it is that when a person is asked if they require blood or not, or the family is going to donate, etc., they all adapt a position of defense. And while this is all very much related to what we've developed, considering that people are using medication or they're sick. I remember in the campaign that we had in a public dependency, and 30% of the officers would say that they had hepatitis. And at the end of the day, they are denying all of these elements. But I did want to take a look at these questions in reference to everything that had to do with investigation. We, as a program, we are developing, we've already finished the information in reference to social cultural aspects. Right now, we are about to publish an investigation in reference to the prevalence of COVID. And we've actually seen different kind of parts. For example, in the month of December, we already had COVID in Peru. And that is because blood banks here have an area we are able to identify from what times the virus has already been here. And finally, considering that these have already been seen.
Para empezar, el tema de cero
In
prevalencia
reference to being able to see this prevalence to dengue in the banks in Peru. Here, we are able to have previous information done to the program because all of the blood banks have the obligation of having an archive to 3 to 5 years, and that is useful to be able to confirm and see what things can be done. And I think that the program should not only be in reference to promotion, but it was about investigating this to be able to take measures, considering that in Peru, in reference to being able to establish this part in reference to the child syphilis, and this all gives us an idea of how in Peru we are able to control this system. I do believe, though, the part of investigation is one of the things that is very much important for us. And we do believe that this result of dengue is given us for the next 6 months and that it is published. Thank you. Thank you, Dr. Fuentes.
Doctor Gaviria, ¿cómo
Dr. Gaviria, how are you relating the Red Cross with the state, with the ministries, in reference to this part seen with the regulatory areas in reference to the providing of services? How is that relationship? Because it's engagement, because you're talking about, I don't know if it's 50 or 80% in reference to the needs here and the needs of blood in Ecuador.
Bueno, nosotros como Cruz Roja Ecuatoriana
We have the
actualmente
Red Cross in Ecuador. We are currently covering 78.6% of the demand of blood in the country, and it's a number of donors that we have. However, as it was stated at the beginning of our presentation, we are an institution, we are an NGO, we are a non-government institution, but we are auxiliaries of the powers of the state in the country. We are first and recognized by the Ministry of Health, and here all of the institutes and regulations in reference to be enabled to see this with the ministry, and we have an excellent relationship with the Ministry of Health, the public one. We recognize that it is the Ministry of Health in reference to being able to have this seen here, the institution that provides the regulation of the countries in health, and not only in this end, but also in control. We have an excellent relationship in reference to what has been said, but we also have a signed agreement where we are helping and in reference to being able to see all of these parts of processing and also about delivering at a level manner, both here the part seen in reference to over these and to be able to deliver all of these to the hospitals of the country. And the great majority, we as a Red Cross are the ones that deliver the blood. But here, this is a model that does not only belong to Ecuador. Here we are able to see this in reference to all of the blood. This is in the Red Cross of Colombia, of Honduras, Salvador, and not only in America, but also here in Australia. And how are we able to see here in both Japan and also the Red Cross of Korea. So here as the Red Cross, I think that we do recognize that the Ministry of Health is the one that regulates, it controls, and we of course provide support in this process, given that the objective of the Red Cross is to be able to save lives. Thank you very much for that. I think there was a question in the chat room as well for Dr. Curvelo regarding what this licensing in traditional medicine on this end. I think there was a confusion that children, and this was very much focused on this bachelor's degree. What it does, according to what was mentioned here in the chat room, is that there is some work that is done in reference to Fanny Maldonado, according to the education that children receive. And here there is a whole process of teaching and awareness. And at the end, many of these children, since there has been a lot of programs, they've finished going into the bachelor's degree. They don't start from this from the hemo centers, just that they've created such an awareness that is in reference to being able to see this part in reference to the fact that they've finished while studying this bachelor's degree of 4 years, of course, in the university. Dr. Luciana, you mentioned that the Hemo Center covers the needs of around 50,000 hospitals in 184 cities. How is it that we have this deployment of collection and distribution? You've mentioned this in a very general way that collections are seen in 5 centers and then only 1 center that screens. But how do we deploy the distribution of all of this? Every municipality, each city has their hemo center in the region, which is their reference point. And therefore, each hemo center knows or already has the responsibility in reference to the hospitals of these municipalities, of these cities. So what we do is we create a monitoring of this need so that everything is done in necessary to be able to obtain this and for the attention for each service. And we do know that the hospitals that need more of this are the ones that are focused on this end, which is
todos hacen colecta
in the largest city of the country, but all of them are able to collect and to be able to share information among themselves. So we do have a little bit more of a blood in Fortaleza. We can say if we have more, we can send it to other municipalities or for these other hemo centers. And in the contrary, we've been able to see this for the distribution of these centers that are in the region. And then we don't have any problems with distribution, but we also do have a logistic, a daily logistic of coming back and forth in different components with these services of more complexity.
Nosotros hacemos la distribución y el
We are able
planeamiento
to carry out the distribution and the planning of the distribution with an intelligence of monitoring. I think that was clear. So I understand, as it was mentioned, in the necessities in the inventory are managed from the hemo center. Correct. All of the hemo centers are managing the inventory, and this is in reference done to the planning of the distribution. And the hospitals look to be centers of reference. So we have 5 regions, and all of these centers are responsible for the cities that are in this region. And the hospital is going to look in the hemo center of their own region in reference to what is it that they need on a daily basis or throughout the week, depending on the complexity and the need of each hospital. And of course, in the hospitals, we also have these small units that we call of transregional offices, agencies. They have the capacity of storing and making compatibility tests in hospitals. We have a decentralization of the stock there as well for packets and everything that is needed. Some of them more complex than others to get, but the hospitals that are mostly using these are mainly located in large cities, so there shouldn't be much more difficulties in reference to this. Perfect. Thank you very much, Dr. Luciana. Dr. Velasquez, you talked about the experience of the promotion and the work with young people and here in reference to the contest and everything that is done. The question is and to how many schools have you gotten to and in coverage due to the state, what percentage this covers? How many are we placing within the state and how many schools would participate in this program? Sorry, I was getting confused. Yes, thank you very much, Doctor. Well, at a state level, there are over 2,300 educational parts and a basic level, and which is elementary school, high school, and we are able to cover 230 and in a presidential manner through educational talks. However, the new strategy that has already been seen and that is going to be briefly presented is the educational material that will be presented in digital modules and that is going to be for more access in reference to children that are basically seen now, and especially in reference for them to be able to have this permanent location. And we expect that after this, we would have a political policy in reference to being able to have a culture regarding the importance of the guiding donation of blood.
Entonces, actualmente esa es la cobertura que tenemos
And this
y
is the
creemos que
coverage
hemos avanzado
in
muy
reference
bien en este periodo
to,
que
I
ya son
believe that we've seen this in this
5 años
period
con este
that is
modelo.
about
Lo
5
que
years
vemos
with this
con eso ya
model,
estamos
and
viendo
that
estos
now,
frutos
while
de
we are
esa
seeing parts of
participación
these fruits in
en
reference to the
niños que ya
participation
son adolescentes
in the
y que
children that
inician
are
la
already
universidad y que
teenagers and
también
that are
tienen
in
la
college,
participación de
and that we have
evaluación. Y bueno, estos
participation.
concursos
And
educativos nos han
these
dado
contests
sin
have
duda
definitely
una
allowed us to
participación
be able to
tanto de
have more
ellos como en la
participation both in
comunidad
them
que son sus papás
as
también
or
y en
the
el director.
community in reference to teachers as well.
Gracias, doctor Velázquez.
Thank you very much,
Bueno,
Dr.
con esto
Velasquez.
cerramos la
Very good.
sesión de
With this, we will close
preguntas.
this Q&A
Solo nos
session.
queda
And
agradecer
we
a
just now
todos
have
los
to thank all of
ponentes.
you, all
Hubo
of the
participación
presenters. We've had
desde Uruguay,
participation from
Perú,
Uruguay,
Argentina,
Peru,
Brasil,
Argentina, Brazil,
México, por supuesto,
Mexico, of
en la jornada de la
course,
mañana.
in
Recuerden,
this
los
morning
matices
session.
son dos
Please do not
sesiones.
forget, we have two
Esta
sessions.
sesión
One
de la
this
mañana
morning,
que
this
inicia
session
ahora,
in
tenemos
the
un
morning
acto
that is finishing
cultural que
now.
también
We have a
invitamos a los que
cultural
están online, lo pueden ver.
act. Those that are online can also take a look at it.
Pero en la tarde, a las
But
2 de
in
la
the
tarde,
afternoon
Perú,
at 2 o'clock
continuamos la
Peru time,
sesión con
we will
la
return again
siguiente de
here with the
organización de
following
servicios. Por
session of
favor, le
organization
pedimos a
of
todos
services.
que se
Please,
mantengan
all of you
conectados
need to
y que
be
difundan el
online. Do
link
not
que
disconnect, and you
requieren
need to
para esta
share the
segunda
link if
sesión.
anyone requires
Agradecer
for
a todos
this
los
next
ponentes
session.
por su
We would like to
participación, por
thank
su
all of the
paciencia, su
presenters for their
tiempo
participation, their patience, their
y a todo
time,
el equipo
and the whole
aquí en la sala, a
team
los
here,
participantes de la
the
sala, a los participantes
participants
online
online here in the
y a
room,
los equipos de traductores y demás
and also the translators and everything in
que nos han
reference to
apoyado.
being able
¿Hay
to
un
see the
comentario en la
support they
sala?
provided. There's a comment in the room.
Buenos días.
Hi, good
Disculpe,
morning.
Max Temeflores
Sorry,
del Centro
Mark
de Hemodiálisis
Temeflores
Cardíaca
from
Internacional.
Hemotherapy and
Soy el embajador aquí en
Transfusional Blood
Loreto,
of
Iquitos,
Loreto
Perú.
in Iquitos in
Verdaderamente
Peru.
muy emocionado por toda
I
la
am very
estrategia que
much
estamos
excited
implementando
because
en
the
nuestras
strategies that I'm seeing are being
diferentes partes del
implemented in
mundo,
different parts of the
Centro,
world
América,
and
muy
of the
similares a
Americas
las
are
que
very
estamos
much
implementando.
similar
Por
to what we're
eso el hecho de que
implementing,
hayamos
and that
podido
is why the
incrementar, por ejemplo,
fact
la
that we've been
cantidad de
able to increase,
voluntarios
for example,
lo
in our
mencionaba el
voluntary
doctor
donors,
Fuentes,
just as
coincidimos en
Dr.
ese fin de cuentas,
Fuentes
los
has mentioned, I
estadios,
coincide with you saying that we
los
need to go out,
establecimientos, nuestros
that
bancos tienen que seguir
our banks
de
need to
salida y
be
tanto a los donantes. Pero
about
una
getting
cuestión clave que
donors.
podría ser
Something that I did want to mention to all donors is about asking about budget. One of the inconveniences that we have here to be able to develop the activities of promotion of the voluntary donation of blood and logically
de los hemocomponentes y hemoderivados es el presupuesto.
speaking, the
Acá particularmente
production
en Perú los bancos de sangre no tenemos un
and the
presupuesto
components in
asignado.
reference to the
Quería
budget.
saber
Here,
ellos
specifically
cómo lo hacen.
speaking, blood banks don't have an appointed budget, and I wanted to know how they did it. Okay, thank you very much. Just one round, just 30 seconds each presenter, please. We don't have any more time. Let's begin with Dr. Silvina, and then we will go around to all of very concrete, please. Yes, very specific. In 30 seconds, I will present the concept of the reallocation of resources. When we stop disregarding blood that has references in reference to reposition donors, so we are able to see 5 to 7% of the collected units. These are an example and a reference to being able to see these are donors that in one way or another are trained in one way or another in reference to being able to see this process from the beginning to an end. We have a unit of blood. This does not need to be deferred. So if you're able to see here how much this system costs, going beyond, of course, the risk in the patient, then we are able to see how much it costs to be able to have donors. We see that's not expensive. It's just about reallocating services, resources.
Vamos en orden.
Very good. In order,
Dr. Fuentes.
Dr. Fuentes.
En el decreto
Here
017
in the Supreme Decree 037, which is what you have there, it clearly establishes that, for example, hemocenters are support medical centers. And what is the requirement to be able to be an executing unit? What does this mean? We need to have a budget. But regarding what are we paying for? We are paying regarding procedures in reference to products. So the idea is that through this, we are able to work with the area of a service rendering in order to be able to make the unit be given by package, which means that we are not paying by screening. We work by a global package, plasma, etc. What does that mean? That it's going to have a unique cost. Now, what is the word sustainability? Sustainability makes reference to the fact that there should be profitability. If an entity is not profitable, it's not going to be sustainable. And the objective, our objective in the program is about making the facilities have profitability and have sustainability. And for this, the EPRES, which is what they use, these are all basically finance. And in Peru, we're able to call them IAFAs. So the financiers are going to be the IAFAs. The user doesn't have to pay anything at all. Because if I have an insurance, the insurance is going to have to pay for that package. Not talking about the global package, but the hemo component. And that is going to generate what? It's going to generate profitability, sustainability. We've talked a lot about hemocenters, but hemocenters need to have financial autonomy. And here, being able to see the part, and this is the work that we are carrying out. Thank you, Dr. Fuentes. Dr. Gaviria.
Bueno, esta pregunta viene como un
Well, this
complemento.
is basically a complement to the previous question. I think that we definitely have a very good relationship with the Ministry of Health. And this has taken us to what? To first having a budget, an annual clear budget that's been defined with the government, given that it has been prepared first according to the different needs in reference to the statistics that we have had as a Red Cross of seeing how many donors we need and how many products we need. But this does not only take us to be able to have a cost in reference together with the budget, but we also have a cost in reference to per product that has been consensuated and worked on with the government. So right now, we have the value of the cost in reference to what we have here in reference to how much the concentration of plaquettes plasma basically seen in reference to this. And this is definitely taken us to believe that the regional government of the Ministry of Health, as well as us as the Red Cross of Ecuador, have clarity in reference to the annual budget. We have clarity in reference to the cost for each one of the products based on the needs. And it is important to be able to define that this cost and this list is not given by the Red Cross of Ecuador, but it's given by the Ministry of Health, and it is of compliance both for the ministry as well for Elite. And what we are able to do this without this is basically this part of the ministry to be able to deliver the quantities that are being able to set here. And this is basically done in an efficient manner to be able to avoid the overstock and for us to be able to disregard any kind of a blood unit. And with all of this is that we are able to be efficient in reference to the budget and also in costs, and we are able to work together in reference for this end. Thank you very much.
Doctora Luciana.
Dr. Luciana.
En Brasil tenemos el Sistema Único de Salud, el SUS.
In Brazil, we have the health system in reference to being able to have a cost, a shared cost in reference to the government end. So we have the federal government and the state government and the municipality government. And
Tenemos el costeo fijo, que
we have here the fixed cost, which has to do in reference to being able to set this in the different structures, which is about the responsibility of the government for us to also be able to have the cost that we have the production that comes in reference to what we are able to produce, the quantity of donors that we're able to have in reference to the understanding of products that we are able to get here, and the procedures, medical procedures that we are able to produce. And finally, we also have the appearance of the differently operational costs, and we are able to see here the assistance to our services that are not public, hospitals that are not public, and therefore that is the way of being able to provide the budget in reference to the services. But always working together.
Gracias.
Dr.
Sí, creo
Velasquez,
que parte
thank
de
you.
lo que
Yes,
hemos
I think that
comentado
part
es
of what has
que
already been
pues se
commented on
trabaja en muchos
is what we are
países,
able to work in
nuestros
different
países en
countries. Our
RFR
country
existen
at a federated
presupuestos
level, we
asignados
have
para
a
los
budget that is
estados
appointed
y propiamente
for
en
the
nuestro
states.
estado pues
And
tenemos
our
ya un
state
análisis
itself, well, we already
de
have
los
an
recursos
analysis of the
que se
requirements
generan para el
and to
gasto
be able to
operativo por
generate
obtención de
this for
productos.
the obtaining
También
of
se mantienen lo
products.
que son los
We're also
corredores de
keeping everything in
aranceles
reference to
establecidos y
the
unificados
tariffs that are
para el prestado,
unified
sobre todo en las
for the
situaciones de
posting of
riesgo
the
para
rendering of
instituciones
services for
públicas y privadas,
public
¿no?
and private
Y bueno,
institutions.
parte quizá a
And
lo que se referían dentro
in reference to being
de la
able to see
pregunta
this
es
part in
si
reference
existe
to
un
this end to
presupuesto
see if there's
asignado
any
para la
kind of
promoción y difusión.
a
Son
budget
parte de las
assigned for
estrategias
this end as
que
part of the
generamos cada uno
strategies
de
that maybe
nosotros
we are
para
generating
poder
in each one of
salir
them to be able
externamente y
to
hacer esa
come out
difusión.
externally.
Y yo creo que es importante trabajar sobre un
And
programa.
we need to
Al
be able
presentar
to
un
work in a
programa y
program by
justificar el
presenting a
impacto
program
que
and
voy a tener
justifying
para
this
la carrocería,
information.
nos va a ayudar esto a
We are
generar
able
un
to
recurso.
generate this
Es importante
resource.
justificar el
And it
por
is
qué lo vamos a
important to
hacer, cómo
generate
lo
why
vamos a
we are doing
ejecutar
this, how we
y
are
cómo
going to have
estamos
an impact,
beneficiando
and how we are
con eso y cómo
benefited in
estamos
reference
marcando una red de
to what we
cobertura
are
a
setting
nivel estatal
for
y a
a
nivel
rate of
nacional. Y
coverage
esa es la importancia
nationally.
para
And
justificar un
this is important
recurso
to be
y que
able
de esta
to
manera
justify a
tengamos una
resource
forma de cómo seguir promoviendo la
to be able
donación,
to
sobre
promote
todo.
donation, especially on this.
Muchísimas gracias.
Thank you very
Gracias a los
much.
colegas de Loreto por esta pregunta. Con
In
esto,
reference
entonces,
to this, with this, now we will go ahead and again, I
cerramos esta
repeat, we will
sesión.
close this
Le
session.
cedo la palabra a mi colega Adriana.
I will now give the floor to my colleague Adriana.
Bueno, solamente para cerrar, tenemos la
Just to be able to
presentación
close, we have the
del equipo de promoción
presentation
del Banco de Sangre
of
del Hospital de
the
Vitarte
hospital of
con la
Vitarte
Tunantada. La
with
Tunantada es una fiesta de
Tunantada.
la Sierra
Tunantada
Peruana
is
representando a la región
basically in
Junín,
reference to
la
the
cual
region
se
of
baila con
Junin,
elegancia en
and here
conmemoración
we are
de la
seeing
de los
this in
patronos
elegance
de
with
San
this part
Sebastián
in
y San
reference
Sabio,
to
un
Saint
baile
Sebastian
de
and Saint
libertad.
Sebas.
Al
Here, this
equipo,
is a
por favor,
freedom
el audio.
dance. Now we have the audio, so you can take a look at this dance.
Qué triste el final de esta historia de amor. No entiendo el por qué terminó. Triste final para todos ustedes. De tu puño y letra, Keyer Mucha. Hoy con la exclusiva para todos ustedes. Un canto de esperanza. Gracias a Iwan. Y lo cantamos en casita. Qué poco tiempo duró nuestro amor, la ilusión de tenerte entre mis brazos. Dime cómo podré vivir sin ti. Me falta todo desde que tú te fuiste. Qué poco tiempo duró nuestro amor, la ilusión de tenerte entre mis brazos. Dime cómo podré vivir sin ti. Me falta todo desde que tú te fuiste. Entendí que tu amor no era para mí, que solo fue una ilusión de esta vida. Solo me queda llorar con los recuerdos y los sueños que fijaste en mi corazón. Entendí que tu amor no era para mí, que solo fue una ilusión de esta vida. Solo me queda llorar con los recuerdos y los sueños que dejaste en mi corazón. Triste final para todos ustedes. ¡Vamos ahí!
Este es un éxito, un exitazo. Gracias a Zapatillas I1, haz lo imposible. Ahora, en el canto vivencial, en la voz auténtica de Naida Gutiérrez.
Qué poco tiempo duró nuestro amor, la ilusión de tenerte entre mis brazos. Dime cómo podré vivir sin ti. Me falta todo desde que tú te fuiste. Solo me queda llorar con los recuerdos y los sueños que dejaste en mi corazón.
Qué poco tiempo, tan solo un instante, algo breve, duró nuestro amor, pero en la eternidad tus recuerdos siempre estarán presentes.
¡Vamos a bailar! Para la primera capital histórica del Perú, para Cauca con mucho cariño. Qué triste el final de nuestra historia de amor. No entiendo el por qué terminó. Maldito el destino que te apartó de mi corazón, dejándome sin tu amor. Qué triste el final de nuestra historia de amor. No entiendo el por qué terminó. Maldito el destino que te apartó de mi corazón, dejándome sin tu amor.
Como bailes el chutito, el doctorcito, el guaclín, el tunante, si se baila la tunantada.
¡Vamos a danzar con oro! ¡Raya mucha!
Gracias a Zapatillas Arwa.
Bien, ahora sí, muchas gracias. Terminamos la primera sesión. La sesión de la tarde se mantiene a las 2 porque el horario con los ponentes extranjeros no lo podemos alterar, pero tenemos las facilidades de que es virtual, así que igual esperamos que por favor se puedan conectar. Muchísimas gracias por su tiempo.
will start with the second session that is about organization of services. This will be moderated by Dr. Jose Fuentes, Director of the Division, National Division, Blood Division of Peru, and myself, Mauricio Ventral, Advisor for Blood Services for PAHO. So now we will go with Dr. Fuentes, and we are very grateful to all the speakers and participants for still being connected, and we will begin with this session. And Dr. Fuentes, if you could introduce the first speaker. Good afternoon, everyone, and hello. I'd like to say hello to everyone who's in the audience. I wanted to take advantage of this opportunity to introduce Dr. Carolina Leilandre. And she's going to talk to us today. Dr. Carolina Leilandre is Manager of International Projects and Blood Facilities in France, French blood facilities in the country of France. She is going to talk to us about organization of the French blood system, experiences in voluntary donations of blood. Go ahead, Dr. Carolina.
Muchísimas gracias, doctor. Muchísimas
Thank you very
gracias
much, Doctor, and I'd like to thank Dr. Beltran for the invitation to share French experiences regarding organization of our national blood service. I am joined by Mr. Jean-Pierre Lebody, who is the director for marketing in the blood facilities in France, and he's going to tell you about the most important part of this presentation. I'm just going to provide some data and some key numbers in our organization, and then we will go with Mr. Lebody. I'm going to share the presentation, and I apologize.
¿Ven mi pantalla?
Can you see my screen?
Solamente poner en modo
Yes, just if you could please have it on presentation mode before we begin. Thank you very much. Yes, okay. It's in presentation mode now. So we're gonna talk. No, we're sorry. We're sorry. We still don't have it in presentation mode. Oh, okay. Give me a few seconds more.
Presentación. Y aquí compartir pantalla. ¿Ahora?
Now?
Sí, muchísimas gracias.
Thank you very much. A pleasure. Okay, so this presentation will be given in two parts. The first one, the general organization of facilities with some key numbers, and then the second part, we will have marketing actions regarding donors in the French blood facilities. As a French blood facility, we are organized. We are the only operator for blood transfusions in France with a monopoly for everything related to transfusion, the relationship from with the donor to the supply. And we are in charge of extraction, preparation, and supply. And we are a public facility, a public service that is regulated by the Ministry of Health, and our facility was founded in 2000. And we almost have 25 years working with blood transfusions in France. We have a national office in the Paris region and 3 regional centers. 10 in metropolitan France and 3 in the overseas territories in South America, in the Caribbean, and the Indic Ocean. We have more than 1,600 collaborators, 9,600 collaborators at national level. Our values and our mission, first of all, ensure self-sufficiency of blood components, and with high levels of security, we organize and adapt our transfusion activities to evolutions in technology, medicine, science. And a very important or vital part for us is promoting blood donations in the framework of the respect of ethical principles, which it means it's anonymous, unpaid, and voluntary. We also guarantee the transmission of data to the National Hemosurveillance Network. We also develop research and teaching activities, and we also participate in the European and international cooperation scientifically and technically. Our national blood facilities, as in Latin America and in general, are in a central system in our health system. We have a relationship with the ministry that's in charge of health, with the European Union, and with the health facilities, and with the French lab that does fractioning of plasma, with patient associations, with research activities. So we are in this central place in the blood facilities in our country.
¿Cómo se organizan las actividades técnicas? Pues primeramente,
how do we organize technical activities? Well, first of all, when it comes to extraction, we have 104 donation centers at a national level, what we call maison boudon, or donor houses, that my colleague is going to tell you about later, and more than 30,000 mobile units around the country. We have 4 poles or labs for filtering in metropolitan France and 3 in the overseas territories. And regarding the processing and preparation of components, we have 16 labs in metropolitan France and 3 in the overseas territories. And we can see the organization of our activities. Some key numbers from last year in terms of collection or extraction of components. We had more than 1.5 million donors last year, more than 2.6 million donations, an increase of 17% of new donors. And another important data point for us is that almost 70% of new donors for plasma. That is an important activity for us currently. The distribution of the blood components, or in 2023, how they were distributed, more than 2 million red globe concentrates. We had the platelets, and we had the mix of platelets, therapeutic plasma, 210,000, and fractioning plasma that goes to the French technology labs, more than 827,000. We provide blood components. We have 141 distribution centers for blood components, 619 blood banks in hospitals and clinics, and 441 of them are vital urgency banks, and 1,500 hospitals and clinics, and 1 million treated patients. Regarding associated activities, we have immunohematology labs, histocompatibility labs. We had tissue and cellular therapy. We also have 20 therapy centers in the national territory. We also have advanced therapy medication platforms, and we have 6 sites of production of reagents in France. And this is very quickly the activities. And now we go with Jean-Pierre Lobody for his part of the presentation. And Jean-Pierre, we go with you.
Merci, Carolina.
Thank
Bonjour
you, Carolina, and hello,
Je suis très
everyone.
heureux de partager avec vous notre expérience en
We're
France
very happy to be able to share with you our experience in France about the use of marketing to develop to work on blood donation in the country.
Notre objectif pour développer le don de sang qui est basé sur un
Our
don
goal
bénévole et
in developing blood donation in France is based on benevolence and anonymous donation, and we want to address recruitment and loyalty in donors. How do we get new donors and then invite them to come donate blood? We want to improve the experiences of the donors. We want each donor to feel that it's easy to donate blood, and that they can do it with by trusting, and they can do it in a inviting environment, and we want them to feel gratified by donating
travailler
blood.
l'ensemble
In
des
the next
actions
slide, we can see
marketing
that
en
we
fonction des étapes du don du donneur, en fonction de son parcours donneur.
work
Donc, comment est-ce qu'il va
marketing
être
according to
sensibilisé
these
au don et
stages.
comment ensuite il
So
va pouvoir
how
venir
we're going to
donner.
create
Donc, il y a
awareness of donation,
trois
how
grandes étapes
they arrive
avant,
at a
pendant
donation
et
center. There's
après
three
la
stages.
collecte.
There's the
Et ensuite,
before, the
ces étapes
during, and
sont
the after.
décomposées en,
The
en 7
after the collection.
différentes
And
étapes qui
after these
permettent
stages,
aux donneurs de venir donner.
there's these
Sur la
break down
diapositive
into 7 different stages for a donor to come donate blood.
Pour les citoyens,
The
pour les
important
Français,
thing
c'est de
for
toujours
citizens.
reconnaître le don de sang. Et donc, nous avons mis en place une marque d'honneur. C'est une identité visuelle qui permet de toujours reconnaître le don de sang, quels que soient les supports de communication ou les supports marketing que nous utilisons. Donc, c'est très important, c'est-à-dire qu'on va le voir juste après sur la diapositive suivante. Tous les outils de communication vont utiliser toujours cette goutte rouge que nous utilisons et puis ce fond bleu qui permet de créer une identité qui est reconnaissable, quels que soient les supports de communication. Donc vous le voyez, nous utilisons des affiches, des tracts, des dépliants de communication qui vont nous servir à communiquer et à expliquer ce qu'est le don de sang. Sur la diapositive suivante, sensibiliser le public et l'inciter à venir donner, nous allons diffuser des publicités sur la télévision, sur la radio et aussi sur le digital, c'est-à-dire sur les sites
And
internet.
also on the digital campaigns, internet and social media. We remind everyone that these advertising will invite the person to come to our website in French, that is a single one, and that presents all of the information for the blood donor. In the next slide, we can see
Nous allons mettre en place
that
des
throughout the year, we will be having big communications campaigns that will allow the dissemination of publicity ads in TV, radio, and digitally in key moments during the year for different intervals in the year according to the schedule that we have. Next.
Nous utilisons également les réseaux sociaux, tous les réseaux sociaux.
We also use all social media platforms. We use Facebook, Twitter, Instagram, TikTok, LinkedIn, and other social media to communicate on blood donations and to recruit new donors. There is more or less 400,000 subscribers through our social media, and according to the social media, we will communicate in a differentiated way to adapt to the audience, sometimes with more humor or with more learning elements. According to the network that we use, we can also use short videos or images that would correspond to the traditions of the people that are using these social media. Each year, we have more or less 60,000 people joining us in our different channels, and we try to transform them into blood donors. Regarding the next slide, what we see here is that aside from the publicity and social media, we had the direct awareness. How do we address the audiences in companies, in schools, and in the city? We have to go and find this audience and talk to them about donations of blood and the need to donate blood. We have volunteer associations in France that work every day in raising awareness within the public, inviting them to come donate. And aside from these volunteer associations, we also have territory developers that create awareness within companies and schools to recruit new donors. And in the following slide, we
va
can,
être d'inciter le
our
public,
goal
les
is going to
citoyens,
be to
à se rendre sur le
invite
site internet
donors and the public, the citizens, to
don-le-sang.efs.santé.fr.
come
Donc,
to
un
visit the
seul site
website,
internet pour tout le pays où nous allons présenter le
which
don de
is
sang et expliquer comment est-ce que se déroule un don, qui peut donner, où est-ce que l'on peut donner, et
blooddonation.efs.santé.fr
surtout
in French.
proposer de
This is
prendre
a site
rendez-vous.
where you can
Parce qu'en France,
donate,
pour donner son
and
sang, il faut prendre
we
rendez-vous
also
au préalable. Donc, nous
ask
avons
them
un site
to
internet
schedule an
national
appointment because
et
we do have
également
to
une
have an
application
appointment to
mobile qui est
donate
dédiée
blood.
au
We
don de
have an
sang
international
et qui nous
site and we
permet
have a mobile
de
app that
diffuser
is
ces
dedicated
informations.
to blood donation that allows us to disseminate the
Diapositive
information.
Donc sur le site internet et l'application mobile, nous allons
In the
faire
internet
de la
site and
pédagogie et
in the
surtout
mobile app, we
proposer les
are going
créneaux et
to
les
teach,
plannings de
we're going to
rendez-vous afin
propose
que le donneur puisse prendre rendez-vous et faciliter et optimiser le temps
the
qu'il va passer
scheduling of
au don de sang,
appointment.
puisque
We
nous
teach them how to
nous
do
l'accueillerons
make
sur
the
un créneau
appointment
spécifique et un
so that they
horaire
can
spécifique.
optimize the time that they're going to dedicate to the donation of blood, because we will be receiving them in a specific time.
De la diapositive
Aside
suivante,
from,
pardon, s'il vous plaît.
oh, sorry, the next slide, please.
En plus de la prise de rendez-vous et de la pédagogie, nous
Aside
proposons des
from
questions pour que le donneur
the scheduling
puisse voir
of
s'il est en
the
capacité
appointment
de
and
donner.
also the teaching
Donc, les
elements,
questions
we
principales
also
sur
ask
son état
questions
de
to see
santé
whether the donor
qui vont
is
permettre de
able to
savoir
donate
si
and the capacity to
il va
donate.
être
We ask them
accepté ou non.
about their health,
Sur la
and this will
diapositive
allow us to know
suivante,
whether they would be acceptable or not as a donor. And then on the next slide,
travailler sur
we
l'aménagement
see
des
that
maisons du
we
don,
work
ces maisons du
on
don où nous accueillons les
the
donneurs.
atmosphere, the
L'objectif est
environment
que
of
le
the
donneur
donation
se
site
sente
where we're
dans un
welcoming the
environnement
donors. And the idea
confortable,
is for the donor to
agréable,
feel
ce qui
that they
fait qu'il
are
va
in a
être
kind,
apaisé,
comfortable environment,
il va se sentir
that they
bien et serein
feel
avant son don et moins stressé. Donc ça va
well
permettre
and
de
calm
mieux
before
fidéliser les donneurs par la
donating their
suite.
blood.
Donc vous voyez que
And this
plutôt
will allow
les
us to
aménagements des
have
maisons du don que nous
to create
connaissons avec
greater
l'expérience.
loyalty within the donors.
Sur la
And
diapositive
here
suivante,
you can see what we are starting
encore
to
d'autres
deploy in
photos.
France. Here you can see some other pictures.
L'espace de prélèvement, l'espace de collation, puisqu'après le don, on
With
propose
the spaces,
de quoi manger et se restaurer pour bien récupérer. Et puis, vous voyez la
collection
façade
spaces,
des
and
maisons du
then
don que l'on voit de
to
là-haut,
have
qui
them
permet d'être
eat
reconnu très facilement
something,
et
and
de
then
savoir que c'est ici qu'on donne son sang.
the front, the
À l'intérieur,
entry
sur la
that
diapositive
is
suivante,
easily recognizable. Lets the person know that
à
this is where they
l'intérieur
donate
des
blood.
maisons du don,
In the next slide, we can see that
mettons
in
à
the
disposition des
donation
témoignages des donneurs
houses or sites, we
pour que les donneurs puissent
have
s'identifier et puissent en parler autour d'eux
testimonials
et
so that
partager leur
the
expérience
donor
de
can
don
feel
et inciter
identified,
leurs
that can
donneurs donner.
feel part of this, and so that they can share their
Ensuite, sur la
experiences. And we
diapositive
also invite them
suivante,
to come
ce qui est
back to donate blood
important,
again.
c'est
And
aussi
then
de
on this next
remercier le
slide,
donneur
we
et
can
de lui
see that what
transmettre
is
des messages
important
au
is
moment
to
du don
thank
tout au long de
the
sur
donors
le lieu de
and
don ou
to
le lieu de collecte.
transmit
Donc,
messages
savoir que
on all
il
parts.
peut aller sur le site
The
internet, le
and the
remercier,
collection
transmettre
points,
éventuellement des
they
offres
can
d'emploi, parce que
be
parmi les
they'll be
donneurs, il
thanked.
peut y
In
avoir
the
des médecins, des infirmiers
internet
qui pourraient
side
ensuite
on the
venir
mobile
travailler pour le
app,
don de sang.
we also
Donc nous transmettons ces
have
messages sur le lieu de don. Sur la diapositive
we also
suivante,
transmit these messages for recruitment of professionals as well. And in the next slide,
utiliser les réseaux sociaux pour remercier les
we can
donneurs
see the
juste
use
après
of
le don.
social media
Donc, nous les
to
remercions
thank
et eux-mêmes aussi
people after
peuvent
their
venir
donation. We
témoigner de leur
thank them,
don
and
et inciter
they
leur
can
entourage,
come
inciter leur
and
communauté à
provide
venir
their
donner
testimonial of the
ou
donation so that they can
nous faire
invite
part
people around
de points
them in
d'amélioration
their
ou
group to
d'éventuelles
donate.
réclamations. Et donc,
They can
tout
tell us
message qui est diffusé
they
sur
can
les
tell
réseaux
us
sociaux,
about
nous
possible
prenons
points
le
for
temps
improvement or
d'y
complaints. All
répondre ou d'apporter
messages
une
in
réponse aux questions qui
social
sont posées.
media
Sur la
are
diapositive suivante,
answered, and or we answer questions. In the next
ce que nous
slide,
proposons également aux donneurs, c'est de
we see
créer son
that
compte personnel. Comme cela, il va pouvoir
the website, we propose that the donor create his own personal account so that they can have access to their own information online or through the mobile app. And they can also find how many donations they've made, and then we can also send messages according to the number of donations they made to encourage them to come back. They can also find their blood group, blood type, and their blood donation ID card. And this allows us to recognize them when they come back. And in the next slide, we see that each donor in France coming to donate blood is registered in our IT system and then our database. And this is the information that we use to later invite them back. And we use Microsoft CRM tools that allow us to send emails or text messages to the donors depending on their profile. And in the next slide, we use these tools to invite donors to come back to donate blood again, and we also invite them to donate plasma or platelets. We also thank them and we ask them to invite their relatives and friends, and also give them any counterindications. In 2023, we sent 22 million emails, 35 million SMS text messages, and we also call on the phone to create awareness in the donors. In the next slide, and then we decided to, according to the profile of the donor, we every month or every 2 months, we invite them to, or 2 or 3 years after the last donations, and we can get in touch with them with SMS, email, or using a phone call, depending on their preferences and according to what we have found as most efficient, depending on the profile of the donor. So we will
des courriers envoyés par la poste ou des courriers électroniques, des emails,
we send mail, email, SMS messages, or phone calls. And all of these allow us to talk to the donors.
Et toutes ces actions qui vont permettre d'encourager les donneurs à revenir donner, eh bien,
encourage donors to come back.
Analyser les données, analyser les statistiques.
We also measure the results of the different measures, analyzing the data and statistics of the outcomes to know how many donors come back when we send an email, when we call them on the phone. This allows us to improve marketing actions and then eventually adapt them according to the profile of the donor. We, in the same way, use geomarketing tools to know where the donors are located and whether there are whether there is more development potential. And this is how all these actions allow us to encourage donors to come back to donate in a regular basis, or also allows us to recruit new donors so that we can compensate the donors that are that can no longer donate. This is the last slide, and I'd like to thank you for your attention. This is the poster that we created specifically this year for the World Blood Donor Day. Thank you very much.
Et pour les besoins du don de sang en France. Merci.
Agradecemos mucho a los colegas del
We would like to thank the colleagues of the French blood facility establishment and Carolina and Jean-Pierre. Thank you very much for joining us and being here. We understand that it's more than 9 p.m. in France, so we're grateful to you for your time. We just have 2 questions that we would like you to answer. One for Jean-Pierre and one for Carolina. Regarding Jean-Pierre, the Blood French establishment is a national program, so meaning it includes all strategies in France. In case of promoting donation, what is the relationship with the blood banks and the states or the I don't remember if they're provinces, departments, or I don't remember the subdivision in France, but what is the relationship? You have the national program, the national strategy with everything that you told us. Very interesting and very important. Uh, but how do you relate with the blood bank services and the states or the state structures in France? Jean-Pierre?
D'accord. Alors, concernant les
Okay.
actions, il y a deux dimensions.
Regarding the actions, there's two dimensions. We have the national dimension, we have the ads on TV and radio, and that goes to all of France. We disseminate the same publicity and the same message throughout France, and as a complement and as local actions organized by facilities. But after this, in France, we have everyone using the same tools. We have a global database.
C'est qu'il y a une seule identité du don de sang.
What is very
Donc, la
important,
même
what I said at the beginning, is that there is one single
que ce soit au niveau national
blood
ou au niveau local.
entity. Everyone's using the same communications, be it in national or local levels, and that's important so that we can have good recognition, and that's a complementarity. And the relationship regarding the government authorities, it's more in terms of the authorization that allow us to organize,
Et puis, les
that
autorités
allow
vont
us to
également
have
beaucoup soutenir
mobile
le don de sang
blood
et nous
drives
aider à relayer
or
la
other
communication
mobile elements.
en cas de
The
besoin.
authorities, of course,
En
help us a
termes
lot,
d'action
and they
marketing,
help
nous sommes assez
send
autonomes.
communications when it's necessary. From a marketing point of view, we're pretty autonomous.
À l'établissement français.
The government delegates these actions to the French blood facility.
Muchísimas gracias, Jean-Pierre.
Thank you very much, Jean-Pierre. It's very clear and
Thank
interesting
you very
answer.
much. The presentation has been very
Carolina,
interesting.
¿Podrías volver a hacer memoria para todos del papel central que juega el
Paulina, could
establecimiento
you talk about the main role that the French has with that France has in reference to the services with the plants? Because what we are seeing is that the blood facilities in France are very much similar to what we have in the region. Can you maybe summarize again this relationship between the blood French facility, please? Of course, yes.
Listo, perfecto. Claro que sí, el establecimiento
Of course,
francés de
yes.
sangre
The blood French facility has a central role from the beginning, from the social and with all of these establishments. First of all, with our Ministry of Health, who is in charge of leading our processes and being able to see all of these directives, and also with the Ministry of Education, Economy, and Finances, and with the European Union, with the Natural Agency of Blood Products. They come, they inspect our processes, technical processes with those health facilities, because it is with them that we are able to create these links with their systems in reference to the associations of voluntary blood donors, like Jean-Pierre mentioned in his presentation. They have a very important role for us. Without these entities, it would be impossible to be able to connect water and blood in France. This is very important in reference to being able to have these French entities. We have a very important link, because we produce and we are able to see a plasma for others to be able to have these medications set in reference to the associations of the patient that are quite pending of our actions. and also the Agency of Biomedicine, which is the agency that occupies everything that has to do with what is related to the transplantations and the different institution of this end. And here we are focused in reference to these investigation teams and also in reference to the university system, in reference to this part of this and in reference to being able to see this, and we are able to see all of these parts that are governmental and that are associations of civil society and from the own learning process. Thank you very much. We thank you very much, Carolina from Dandre and Jean-Pierre Levalwin, for being us here with us today, for providing us the information. Greetings for Professor Terry, and we will now continue with our seminar. Thank you very much. Thank you very much, Dr. Fuentes. The following end. Good afternoon with everyone. We are now in the table. Now we have Brazil in reference to the sustainable part of the model in the health system. Here we are going to see this with Hendrik Kersemialeno. He's a doctor of the University of Sao Paulo. He has a master's degree in hydrotherapy and transfusional medicine in reference to being able to see with the National Blood Association of Brazil. And here, what we are going to be able to see here is the sustainable and in reference to this part of the health system. Go ahead, Dr. Helder.
Olá a todos, eu agradeço.
Hi, thank you to everyone. I truly appreciate the opportunity of being here with you again today. And I believe that a presentation that we are going to have is definitely going to give us a vision of the Ministry of Health in relation to the national blood policy. The activities of chemotherapy are developed by services. And in reference to being able to see what we have discussed at the province levels or other levels in these services, so we have activities in reference to being able to establish this to the users, so to be able to have assistance to the services as well. In reference to the incentives of promotion of health, which is a Ministry of Health, in reference to being able to regulate the service, and to being able to see this here, we're going to specifically discuss about the organization of chemotherapy in reference to access of blood within sustainable models of hemocenters in the health systems. And we're going to see the experience of Brazil, which is nothing recently, and it's been over 50 years. And we are going to be able to see we've seen to a model that seen here in reference to being able to gather good results here in Brazil. And just to be able to begin with in reference to the commitments of the state. Here we have some documents that have been made by the WHO in reference to this part, and here this sees the necessity of creating viability in reference to the availability of blood in reference to being able to see this parts that are definitely going to be able to be related with the assistance and network. Therefore, we are going to have a government framework. And this is a great conquer of the Brazilian model that has been established throughout the services of chemotherapy as offers of products and services throughout the whole population with a role of sanitary surveillance and services and also a line of financing. to be able to guarantee a program that is sustainable. These points have been recent, but they are part of the model, the blood model of Brazil here to 1960. And in the last century, Brazil had very serious issues in reference to the content of information and private services that would make in reference to being able to see donors and free end of hemo components based on the year 1960. This starts changing because it becomes a matter of social security. In 1950, our first law talks about the evaluation of the voluntary donor of blood in the period in which it is difficult to be able to have this donation of blood, and this has been created in reference to the National Day of the Blood Donor, and to be able to extend our campaigns and where these are promoted in reference to all of these public ends to the donors. And in this period, while we have these between 40 and 60, it is that we have these hemocenter models with this French and not only in the way of carrying out our professionals, medical professionals, but in the structure of services of chemotherapy. That could definitely have to do with the population. The first hemocenter that was created in Brazil has been done in reference to this part and has been funded in the year 1941, the same year in which we've had the first floods. And we have different floods as of 1941. In 1965, we've created a law to be able to create discipline in the activities of a chemotherapy, definitely having an entities of laws regulated towards the entity of a control of the Ministry of Health and executive organizations, operators of bloods with components, derivative components, and all of this in reference to based on a hemocenter model. At the end of the decade of the 60s, we've had support of WHO and PAHO, which have been a great effort in reference to being able to see the model of natural policy of Brazil, where Dr. Pierre Casal, in reference to consultant of WHO and PAHO, has created a report of some principles that we can definitely work on with Brazil, such as the decentralization of the chemotherapy, getting to a country with the continental dimensions, the demands of blood of the whole country, which are necessary to be seen here. And we have 2 points here, the elimination of the usefulness in reference to this being seen here in the commerce. And this can be purchased or sold, and we also have the creation of these chemotherapy in each one of the units of Brazilian territory and statuses provinces. There are 86 states plus the federal district. In each one of these, we should have one entity to be able to incentivize the organization of this. And in this decentralization, we would have chemotherapy in all of the states. In the year 1980 of the Ministry of Health, in reference to being able to establish what has been consolidated in reference to a model of assistance in chemotherapy in Brazil, creating different networks that are definitely helpful in the states. And for this, we are able to increase the coverage of assistance according to the hospitality reality of each state, using this public sector in reference to the understanding, incentivizing human resources, and having the national level as an objective, which is to be able to have blood 100% short throughout the whole process until the year 2003. And this gives us the decade of the 80s. We've had the National Conference of Health, which changed the attention model in reference to health, creating the unique system of health, universalizing the assistance in Brazil in reference to what was related to and evidence here in reference to these ends. And this universalization has brought changes in this part. In the Constitution, federal constitution with a unique service of health, we've had the prohibition of commercializing blood, and the donors are not able to include any kind of being able to have any kind of economy set, and this is reinforces the implementation of the national health system. We have a table, our main table here. The laws of the Constitution. We have another law which creates this Brazilian company and technological derivatives for these parts of chemotherapy. And also based on this end, we have our own national structure and our regulation of discipline within Brazil. Our law, our policy of blood is implemented within the system, and in reference to chemotherapy and the production centers that we've used as Emigras, in a reference to being able to guarantee the efficiency of blood in the country. And the different entities have a line and only guideline to be able to have the universal access to donations and the transfusion of blood, safety, quality of blood, and education and health. This is another table that we were able to see here in the structure. And this is in reference to being able to have this administrated by the Ministry of Health. And this is very much composed throughout services of chemotherapy in our world banks. They are being a part of the unique health system, and in reference to the services, this is also able to be said, and this is very much related to the Ministry of Finances to be able to the Ministry of Health to be able to establish within their networks. We have a whole cycle that we can see here in reference to the support of sanitary surveillance, health surveillance, and also the official laboratories of health that provide support to the whole national system of blood. And here, seen aside the national system of blood at a national level, which creates the regulation in reference to this technical end for this campaign of promotion and voluntary donation of blood. It's annual, and as we have been able to see now in this webinar, this very much aims to get to the awareness of donors, the concentration to be able to donate these, and this is seen in 2 times a year, one in June and one in the National Day of Donors, 25th of November. And this campaign is very much under the availability of states for them to be able to reproduce the materials and be able to disseminate this campaign throughout the whole year. There is a whole process of financing in reference to this part of activities which are developed throughout the support in reference to this structure of the networks of services and also products that we are going to be discussing later on. The secretariat in reference to each state of the federation, which has an own secretariat that organizes all of the network of services of chemotherapy. It can incentivize a regulation on the local end. It has the function of incentivizing donors, creating these units that are going to promote an assistance. And this is specialized and also the production of chemotherapy. We also hear this has a function of having the plasma that is seen for the whole country and to be able to establish these and using these different sectors to the Ministry of Health. Dr. Luciana has already presented this before in reference to the network established as a model. We have here other models, such as the state of Minas Gerais, one of the largest states of the country, and we also have the state of Paraná, Here we have a new center of reference in these units that we would call the order coordinator of the network, and this coordinator of the network will definitely organize here with the secretariat. It would organize all of the work in the status, establishing different points to be able to have the recollection of these points in other units that can definitely help the activities of the whole region, getting towards our parts of small cities in the interior of Brazil, allowing that all of this administration is very much related to this assistance that can appear only from the large cities and taken onto the micro regions of the states. Here we have some examples, some activities that are very much already known. These structures of services which follow the logic of the system. Public health, it's the duty of the state, the public health and management, and based on this, these are parameters that are defined and that definitely bring on all of the organization of the network. And here we have the criteria to be able to implement these services, depending of the number of people, the number of services, and the complexity of the hospital networks, and the number of beds in these networks. And here we have the number of municipalities that are going to be attended by this kind of services. And here in reference, so we have the center of reference, so we have the coordinating end. We have all of these established in reference to the networks that are going to be able to see these parts, different statuses. And here we have some nucleuses of hemotherapy or also units established here in reference to other states that tend to be able to have regional hemocenters that are going to have the same units for their support. In reference to the structuring of the different information, and we are able to have the hemocenters, regional hemocenters, and to be able to see the incentive in reference to being able to see the centralization of activities, and there is a process of decentralization in reference to the units that we have specialists and that are able to collaborate to the attention here that we have in reference to this units, in reference to the term of reference, and to be able to have these as hospitals in reference to patients that are seen for transfusions as well as for hematologic specialties. In reference to the fact that we have these hemocenters of reference, we have a very large technical capacity, and to be able to contribute to this part seen in reference to the activity set for hemotherapy. These ones here, the regional ends, are working with the macro and micro regions. And we have hospitals, costs, and also universities, health centers, others. We can also have a recollection of this. And based on this, we also have a group of agencies to be able to have the transfusion. And all of these points, all of these units are very much managed and administrated by specialists and unqualified staff that participate of the activities of these services. In this part, in reference to the statuses, Luciano also discussed this, there is a direct administration of these stages that can definitely incentivize a direct administration with public partners that are very much related to the Secretariat of State's direct administration, public locations, and also they could be hired through their participation together with their private services that they can be providing certain assistance as a chemotherapy complementing the unique health system. And this process has the participation of the state municipalities, creating structure in the units. And also there is staff that is trained to be able to work in the hemocenters from the Ministry of Health. The Ministry of Health is responsible for the payment of this staff. And We have 50 million procedures that are developed throughout the year, and these services have to need to have a payment, and the Ministry of Health need to be able to see in this part in reference to these ends, to be able to implement this part. And all of this is going to generate this 2,097 services in reference to being able to have 31 hemocenters coordinated for networks, and 5 of them that are regional, and the ones that are qualified by regions, and they are 95 hemocenters besides 1,600 units. We have a frequency that is of 3 million and 200,000 clots per year, which is around 1.6 donors for each 1,000 in population. And their transfusions are able to get to 3 million of units. And some technical projects that we have are the testing of nucleic acids that we have on a national end, and also to be able to have 6% in reference to the public service, in reference to being able to see the quality, to being able to see this with the laboratories, to the whole national network, in reference to being able to see all of this structure, in reference to PPN, in reference to being able to see this part. And thank you very much. I am here to ask any question. Thank you very much. Answer any question. Thank you very much.
Muchas gracias, doctor, por su
Thank you very
exposición.
much
Ha
for your
sido excelente.
presentation.
Y nada más que nos crea envidia de saber cuánto ha avanzado Brasil
Yeah,
en estos
we've
temas.
seen in a very envious manner how much the hospitals or how much the hemocenters in Brazil have grown. They're very much limited in comparison to Brazil as a country.
Creo que también debe
And
haber seguro
also, we have had some inconveniences in reference to this process. I don't know if we could mention this.
Doctor Helder está en mute, no le escuchamos.
Sorry, you're in mute. We can't hear you.
No le escuchamos, doctor.
We cannot hear you, Dr. Exterior. You're muted.
Temos algumas dificuldades a serem
We have some
trabalhadas
difficulties. We've had some difficulties throughout this whole process. And in the last 20 years, we've been working with the structure of information systems, which will definitely allow some kind of management towards the administration that is more dynamic and that is able to know the reality of what has been taught in a more instantaneous manner, to be able to provide support based on the Ministry of Health, and to be able to provide support to the states. And we are definitely able to see this, and we have this difficulty to be able to create support in reference to what has to do with assistance to the patients. But we have difficulties in reference to the implementations, to the whole production. We have some recent challenges also very much related to the production of hemoderivates. This is structured to be able to produce on a national basis all of the medication, and to being able to see this progress in the past years, but it's a great challenge to being able to see this in plasma, and to being able to see the development of non-commercialization and prohibition for remuneration to donors. This is something that we are working to be able to work on this, and definitely for the financing, as we mentioned, we have some plans, some projects in reference to being able to specialize this end in reference to this part. And in the technological end, this is all updated in these structures in reference to the whole structures in reference to being able to see. And this has been a challenge of resources for that. And another difficulty that we have, and that was commented on many times here, is the fact that we have a very strong program of collection of donors with the participation of representatives of the whole country to be able to discuss this in reference to the donors. And this program lost a structure with the participation. It was not built from a policy. We have a national policy of donation, of promotion of voluntary donations. And we've had access to this in reference to the statuses, and this is very much focused in reference to the fact that we've tried to overcome these difficulties through dialogue with the state, and our coordination of blood started to have a very strong dialogue with the states to be able to promote the improvements that we need, both in reference to qualification, financing, updating of our legislation, and also in reference to being able to this voluntary end. It has definitely been a challenge to be able to see this part here in reference to this dialogue, and in reference to being able to see this part that can definitely be very much healthy to be able to see these different policies being in Brazil.
Thank you very much, Dr. Teixeira de Melo. And always we are grateful for your experiences and sharing them with us. Thank you very much. Now we have the presentation of Dr. Carolina Molas, who is going to talk to us about the experience of centralizing blood services. Dr. Carolina Molas is a graduate doctor from the National University of Asunción. She has education in hematology and chemotherapy in the Clinical Hospital of the University of Sao Paulo, and since 2012 has been the director of the National Program for Chemotherapy in Paraguay. Go ahead, doctor. A very good afternoon. I would like to thank the organizers. I'd like to thank the Pan American Health Organization for inviting me to participate in this online webinar. I'd like to say hello to Peru, and I'd like to congratulate them for hosting this celebration very well. So I've had the opportunity to talk to you about the centralization experiences in blood services. In my country, in Paraguay, we are a Mediterranean country in the central South America, the heart of South America, with a surface of 406,000 square kilometers and a approximate population of 6.1 million inhabitants, according to the last census that was carried out in 2022. Our population density is 17.83 inhabitants per square kilometer, and 60% of our population lives in urban areas, and 28.6% of the population is under the age of 15. The country is divided into two big regions. The western and eastern regions, and these regions themselves are divided into 17 departments and one area that would be the capital city, Asunción. So to review some history, in 2000, we created the National Blood Program. It was created and it was a dependent of an operational entity, and that was the National Center for Blood Transfusions. Throughout the years, we realized that the daily operations and blood transfusions was creating difficulties. And so we started to write the regulations regarding blood. So in 2004, the national blood program becomes independent, or becomes an independent entity where we have doctors and biochemists that are specialists in the matter, and they start to write regulations and standards that will apply to the blood provision in the country. And this is one of the first regulations comes out in 2006, and in 2008 we have the blood law, and we also have the legal backing within one of the articles of this law. In 2008, we established working standards for blood services, and there they establish what influence areas for each one of the production centers for hemocomponents, and they also establish the categories of two blood services. Back then, one was the component of a transfusion medicine, and the influence areas were changed, and then there's a signing of agreements. In 2008, we had the provision of service to the private sector agreement signed for cost optimization, and in 2014, there's the agreement or the convention with the hemo derivatives lab. In 2020, we see the transfusion safety protocol, and 2022, we have the categorization of blood services that is modified. All of this is backed by ministerial resolutions. The current categorization of blood services has 4 points. One, the production center for hemocomponents. This is where they do promotion of voluntary donations. They select the donors, they collect the blood, they fraction, and this can be with a biological qualification or without. And we also have the donor houses. We have the transfusion medicine units that are located within each hospital. Some of them will receive donors or still receive donors. And I say still receive donors because we're slowly trying to have the donors no longer go to the hospitals for donations. And we have transfusion posts that are dedicated to primary health care. All of these services that I've mentioned are part of the national network of blood services that is backed by Article 16 of law of the blood law. In the country, we have 3 significant blood networks. We have the biggest one in terms of numbers is the one that belongs to the Public Health Ministry, and this has 2 production sectors with a biological qualification, 6 without, the IPS that also has a production center that has biological qualification, and one without that biological qualification. And then we have the production sector of the that belongs to the National Asunción University. We also have one in Asunción and one in the east of the country. And in the east of the country, in the departments of Alto Paraná and Cabanillo, no donor goes to donors no longer go to hospitals or production centers for hemo components. They just donate in the houses for donors, or they go to the collection points in the different sites that can be companies or universities. The transfusion medicine units are disseminated throughout the hospitals in the country, and the biggest one is the one that belongs to the Ministry of Public Health, and the transfusion posts are dedicated to primary health care and family health units that are expanded or broader, where you have births. There we have hemo components that are ready to be used from the groups O negative, O positive, and we also have frozen fresh plasma for AB or A. This network underwent certain changes in the last 10 years. And what are we based on to be able to implement those changes? Well, this was from the results that we got from the different processes that we were analyzing, or analyzing the available logistics for biological qualification, the logistics related to collection and reception of units, and then later distribution of hemo components. We had to evaluate the growth of the provision of the health service, the different services and the different points in the country, given that health has developed a lot outside of the capital. For now 10 years, we have 10 years ago or further, we had high complexity medicine in the capital, so we decentralized to those other parts of the country, and we did this by using equipment that wasn't being used that could be relocated. We were also helped by the cost recovery convention from the private sector, the agreement for the private sector. For us, centralization was a growth strategy that really increased our productivity. And we can say that this is because of this graph, we can see that effective donations at a country level, at least till 2019, the donations were between 80,000 to 90,000 units per year. In 2020, because of the pandemic, there was a drop, and you can see the rapid growth from 21,000, because in 2021, we went back to normal activities in the country, and between 21 and 22 and 22 and 23, we do start seeing significant growth in the number of donations per year. If we analyze the network that corresponds to the ministry that collects about 70% of all of the blood that is collected around the country, we can see the same with that drop in 2020 and with the level amounts for the years prior to the pandemic, and then the significant leap because of the pandemic effect and the increase between 21 and 22 and 22 and 23. Here, I also wanted to highlight the fact that starting in 2020, the whole network from the ministry has blood service management software implemented in the ministry's network, and this has improved collection efforts. So what happened to all that blood that was collected? What happened to the fractioning index? We did have a drop, if you can see in 2020 here. We have a phenomenon where there were very few blood collection points around the country, and they were very close to the fractioning center. So all the collected blood would always get there in a timely manner to be able to fraction it into the 3 hemo components. When we start to expand activities in the country, these graphs are going down. So this column is going down. This is also because the speed of growth of donors went over our fractioning capacity because we have not increased the collaborators or equipment. Now, if we look at the index of fractioning index in the ministry, just in the ministry's network, we can see that there is an increase with a small drop in the last 2 years. I was talking about modification of production sectors and coverage. We're gonna take this. This was the National Hospital. It would cover 5 departments. The departments of Cordillera, Central, and Paraguarina. And it would also cover Casapa and Guaira. Each column represents a year of work. In the first year 2018, where we had the 5 departments in the country working together, we collected all the blood and it went to the National Hospital, and the fractioning index was below 2.5, and this went down with time. So this is when we decided to change to have the National Hospital only work with 3 departments, and in 2021, 22, and 23, the National Hospital improves its production in terms of fractioning, and the last year having the largest number, which is 2.67. So there we enabled another fractioning center, which is Villarrica, and this starts working and it's provided with the necessary logistics equipment, and you can see how it's growing, and in 2023 it closes with 2.5. Our increase in productivity also was pushed forward by the export plan. In 2014, we signed the Cordova Agreement, and we had our first export in 2015 for 200 exported units, exporting in growing up to 49,000 units. In 2023, we also closed with this number of kilos, and of course, medications of albumin and immunoglobulin. We can see that there's a little less than 500 vials, and in 2023 we've received 1,338 vials and 5.9 times more, and 108 vials at the beginning for immunoglobulin, and last year 13,000. This is a picture that shows us the first plasma export, and we were very happy here with the lab truck for hemo derivatives, and this shows us how we store plasma before packaging it for export. And here it's packaged in its first bag, and this timeline shows us that in 2015, the National Center for Blood Services, which was the first export center, grew to have 2 production centers in 2016, 3, and in 2017, we have exports from the 4 production centers, all of these with a biological qualification. These are the 4 that have biological qualification at a country level. And in 2021, we buy the Ciudad del Este production center. This is in the eastern part of the country, and this becomes the first center without biological qualification that is able to export plasma. So we can say that centralization for macro processes and decentralization of service provision, meaning the availability and accessibility of hemocomponents in each one of the transfusion medicine units around the country for therapeutic use, has reduced costs or expenses, has reduced mistakes and waste and everything related to the blood cycle. And we can see this in the percentage of discarded units. In 2024, we were discarding, 2014, we were discarding 17.4 units out of the effective donations that we got in the country, and we closed with 8.1 in 2023. I had said that starting in 2021, we implemented 100% blood service for blood services from the Ministry of the Health, and also the IPS network also has detection software. The National University also has detection software. We're working on interoperability of those three softwares so that they can talk amongst themselves. And I think this is going to favor us, especially in the percentage of waste for each unit. Doctor, you have 2 minutes left. The percentage of discarded units has also been maintained below 2.68, and at the beginning it was 3.55. And we can say that the centralization of processes is a method that implies grouping and optimizing operations, centralization of all of these processes, distribution, production, collection, and fractioning changed with time. So we reorganize them and make it clear that biological qualification has always come from 4 production centers. And in 2022, only 2 of them do the NAP tests for the whole country. This centralization leads to increase in access, efficiency, growth, and performance, reducing costs, waste, and mistakes. This is a picture that shows the building, this commemorative building celebrating the World Blood Day. And we have the House for Donors and the Itapúa Governance Building. Thank you very much, Dr. Carolina. I don't know if we could ask a question related to economic growth. Is centralization profitable in Paraguay? Yes, it has been profitable. We have the National Blood Program as the organization that controls all expenses or all investments that country makes connected to obtaining and distributing. And given that that is centralized, of course, costs are reduced and the quality is homogeneous throughout the country. I mean, especially for the reagents and ingredients. Therefore, the hemo components that are distributed throughout the country have a homogeneous quality for the whole country.
Okay, doctora, muy agradecido por su
Okay, doctor,
exposición.
thank you very much for your presentation.
Siempre lo tendremos en
And
cuenta aquí en
we will
Perú. Muchas
always
gracias.
consider that here in Peru. Thank you.
Continuando con las
So now we'll
exposiciones,
continue with the presentation.
tenemos
And now we
las
have
experiencias de servicio de sangre del
the
Caribe.
blood service experience of the Red Cross in Ecuador and process centralization. This will be given by Dr. Roque Soria, Executive President of the Red Cross in Ecuador, and Dr. Aníbal Gaviria, Director of the Red Cross Hemo Center. Go ahead, Doctor. Good afternoon to everyone. A cordial hello from Ecuador. I'd like to congratulate you for this great event that you're organizing. I'd also like to thank you for the invitation that you have sent us. And we'd also like to thank the Pan American Health Organization. And I will ask you to kindly share my presentation. And while you're sharing that presentation, we will provide some country context and the National Society in Ecuador. It is fundamental to understand the dynamics in the country that is not just represented. We also talk about the interrelationship, and we have to remember that Ecuador has a population of 15 million inhabitants. We also have to remember that we are part of the 191 countries of the Red Cross and Crescent, which is one of the biggest organizations in the world. In Ecuador, since the last 114 years, we have been operating. We have 160 years of operations in Ecuador. Our strength, and this is a population of about 15 million inhabitants, and we have 10,000 volunteers that are duly trained in our national association. And it is important to mention that the presence of the Ecuadorian Red Cross is in the 24 provinces or districts in the country, likewise in 200 municipalities. This means that the strength of the presence of the Red Cross is spread throughout the country. It's fundamental to express that within these 114 years of the Red Cross, since 1949, we see more transfusion services in the capital and other big cities like Guayaquil. It's also important to say that 20 years ago, we were 24 Red Crosses or 24 blood banks without a name, but each one had its own administration in each one of the provinces. In the last 20 years, we have been working on the goal of consolidating the centralization process. As a references, 22 years ago, the Ecuadorian Red Cross has had products that have served both private companies and the Ministry of Health. We also have to mention that in 2010, the National Society decides to execute a national health policy that was about centralization that had been happening progressively, and that next slide, please. That has allowed us to continue consolidating this centralization process. I also have to say that all of the work that was done by the Red Cross related to blood services and health services has always been duly coordinated with the Ministry of Health as governing entity. In this way, we have an extraordinary harmony with the Ministry of Health. It is fundamental also to indicate, based on previous questions, that in our country, the Ministry of Health is the one that
En base al estudio de costes, es el Ministerio de Salud
the
quien
Ministry of
fija los
Health
precios de los diferentes hemocomponentes.
applies the prices to the different hemocomponents, the special prices for the ministry, and therefore
Igualmente hay un precio diferenciado para el Ministerio de Salud y tan
there's
solo
a,
un pequeño porcentaje para
and
los
a small
establecimientos
percentage
de salud.
of the cost
Todos
goes
estos
to the
precios fijados
private health
precisamente por el
facilities.
Ministerio de Salud, que lo único que nos
And the
permite
only thing that
es tener una
we have as Red Cross is to have sustainability for the process, starting with the collection, processing, and distribution. Given that we have in the Red Cross a principle of unity, this allows us to talking about health service to provide all hemocomponents at a national level with the same conditions or characteristics, the same safety in the 24 provinces of the country. Next slide, please.
Les había manifestado que
I
desde
had
hace 20 años
expressed that 20 years ago we had been working, but in 2010
como Sociedad Nacional a través de una política
we are
nacional de sangre,
consolidated as national association through a policy, and we consolidate the centralization process with all of the benefits that have been already expressed by previous speakers, beginning by optimizing economic and human resources, also to have a larger scale around the country that allows us to
una persona
provide
puede donar
hemocomponents in the best conditions. A person can donate in any part of the country and can receive those benefits in any part of the country. This morning, a phrase caught my attention. The doctor in the morning was saying, the patient should not be waiting for the blood should be waiting for the patient. And the Red Cross, in our bank, we've been able to achieve those conditions. We have the blood waiting for the patient with the specificities, platelets, and so on, and other components, depending on their time of viability and life cycle. And we are able to have a good software that allows us to have learn the needs and
Les comento, por
work.
ejemplo,
And I can tell you that tomorrow, when we will be celebrating in our country, even though we are
para que indudablemente sea un tipo perecible, no
we
haya
are
un sobrestock y no se pierdan
we are trying to not lose
componentes que
the
de ahí
blood
se pueden.
because of the different components that can be get. And I go to the next slide.
Conforme la normativa del
According to the
Ministerio de Salud,
regulations from the Ministry of Health,
dentro de este proceso
within
de
this process of centralization of blood products,
que tenemos como muchos
we
de los
have to
países
say that we have, as many other countries, a big national hemo center that is located in the city of Quito, where they centralize the certification of all the products that are collected in the 24 provinces. This is through the use of technologies that are similar to the ones that you have explained. This big national center, in a geopolitical study, a study of viability,
está abastecido por
is
5
supplied
centros
by 5 zonal centers for fractioning. And according to the And according to the blood bank, going to the next slide.
Entonces tenemos pues el
So we
gran
have
hemocentro, los
the
5
big
centros
hemo
con mayor
center,
estacionamiento, bancos de
5
sangre,
zonal
que cumplen
centers or
todas las
blood banks
normativas del
that
ministerio
comply with all
y
the
están
regulations,
estratégicamente distribuidos a nivel de país, de tal forma
distributed around
que
the
la
country
entrega
in
siempre
such
será
a way
oportuna
that the
en cualquiera
delivery
de las
is always
ciudades del
timely
país.
in any city
Igualmente,
in the
pues
country.
tenemos
Likewise, we
15,
have
14, perdón,
15,
clínicas
14, sorry,
provinciales que a la vez que son captadoras,
provincial
son también distribuidoras. En estas
sites
no existe el
that also collect.
el procesamiento de la sangre
They
y
do not
tenemos
process, and we
exclusivamente
have
8
exclusively 8
provincias que
provinces that
únicamente se
just
convierten en centros de
become
recolecta precisamente por
collection
la
sectors,
complejidad de las
they
condiciones
given
de
the
estas
complexity of
poblaciones.
the
Por favor, la
conditions.
siguiente página. Entonces, conforme les había
So the way
manifestado,
in which we've been able to see this process that we have here in reference to what is and it has been successful due to the coordination of the Ministry of Health and being our highest user in 49% of the country in reference to the responsibility here for the percentage in order for you to be able to know more about these blood banks. The majority of them ended up being our final access in reference to these and in our hemo center. We have always had this done.
la siguiente lámina.
The next one.
Este proceso ha sido fundamental y se ha
This
ido
process has been fundamental, and we have been reinforcing this in a progressive manner. This had allows us to be able to increase the number of volunteer donors. Here, 99.5% of our donors, with around 20,000 in total, are volunteer donors, and of these, 44 or 45% are repetitive volunteer donors. This has allowed us to be able to cover the demand of blood donors, and also in reference to being able to see this in a suitable manner. Some of them are looking in reference to being able to set this part, and an increase in these last 10 days that has been progressive throughout this time. And here to be able to have this, the 76.8% of the processing of 76.8%, which of blood that is seen by the Red Cross in reference to what is established towards this whole end. Next one, please.
la siguiente.
Next one, please.
Entonces, estos son los grandes.
Okay, and here are the cases of success that we have of the Blue Cross in a progressive manner, what we have been able to achieve together with the support of the International Blood Health Network and also other activities that are set. One of our main challenges that we have here in reference to what we are seeing in reference to this part is the fact of being able to have the optimization of some of the greatest components of blood that we have. Unfortunately, the opening in our country uses approximately 34% in this end. The rest of the percentages, it's unfortunate to say so, but basically they have an answer not only in reference to being able to see this, and we are able to consider this part in reference to what we are able to answer as one of these parts set, and even this part through our ministries of health to be able to provide the best resources and the components that are able to be set. We can now pass on to Dr. Anibal Alcaria. Before this, we would like to ask for us to be able to share a video in reference to us you being able to get more information, okay?
Bienvenidos a la Cruz Roja Ecuatoriana y a nuestro Hemocentro Nacional.
Welcome to Red Cross in Ecuador. We are in our donor room. The first stage for us to be able to obtain safe and quality blood for Ecuador. In the Hemo Center of the Red Cross of Ecuador, we have a specialized center in the preparation of blood components. We are the fundamental link of the different services of this Red Cross in Ecuador. We process around 253 elements of blood in the year 2023. We centralize serological screening, hematological testing, and molecular testing in order to be able to establish these components that are distributed in this and are able to meet all of the parameters of quality established on this and to these parts. In the year 2023, we processed 76.8% of blood at a level of country from which 99% were volunteer donors and 52% were repetitive donors. Here in this center of Ecuador, it has a pre-analytical system for the blood bank. The samples come here from the different provinces of the bank. They are centrifugated in there and then they are entered in the pre-analytical level where it is qualified for each one of the laboratories for the future processing. This helps us to be able to identify the samples in an initial stage using the flow of work in laboratories, increasing the quantity of samples in a reduced end. In the area of serology, we are able to develop the 5 infectious marks known as the most hazardous for a transfusion. And among them, we have HIV, hepatitis B, hepatitis C, syphilis, and Chagas. This is done throughout technology, high-end technology such as the electroluminescence to be able to see through daily control that the blood that is seen is useful for the user. And this is established as an obligatory and in reference to all of the testing in the blood bank at a level of a country. Before we release any kind of result, we are first going to have results in reference to internal and also external end. And in this way, we are able to establish that the components that we are able to release are going to be safe to be able to be transfused into another person. Here, we're the functioning of the National Chemo Center. Here, what we do is that we receive the blood of the triage area and we separate these into different components in reference to the plasma packets, and this is reference to a strict control of quality. We have different components of high level for our patients. We have the laboratory where we determine what is the blood group of that blood, and we are able to trace the antibodies, and we have the laboratories of molecular biology where we are able to have PCR to be able to guarantee that these samples don't have HIV or hepatitis B or C. And therefore, we have the area of dispatch where we are all ready to deliver the blood to each one of the blood units in the Republic of Ecuador. We depend on blood donations, and that is why the Red Cross, throughout 7 decades, we've been working in a constant manner with the community in order to create awareness regarding the need of their volunteer donation of together we are able to work on a 365-day-a-year basis to be able to obtain safe and secure blood to be able to cover the demands of public and private clinics of Ecuador. Very good. With this video, what we've been able to obtain here and to be able to present here are all of the infrastructures with which we have here within this and in reference to the presentation to be able to continue. And we are to be able to think about all of the benefits here in reference to what is seen and to be able to maintain volunteer donors and to be able to have the control, follow-up, and the accompaniment of all of our culture and our blood network. We, from the National Center, we are able to carry out this follow-up to all of the needs of collection in reference to the number of donors that are seen here in all of these ends for the collection centers and also in the collection and distribution centers. Here we also have this network of services and where we are able to see, like it was mentioned previously, it's about having this training with the key staff to all of our teams to be able to see how we are able to get the whole methodologies that we have, and also to be able to establish everything here in reference to the requirements that we need in the country. And so something that's very important, which is the implementation of the quality systems a unit and the management. And this basically has from the year 2010. And right now it's begun here in reference to being able to establish this part and the functioning of the network of a services set in Ecuador. Next one, please. We have 2 minutes left. Thank you very much. Like we said in the morning, all of this in reference to the centralization process here, we need to continue growing. Throughout the year 2023 and 2024, we've been able to have the number of donors that we had previous to the pandemic in the year 2010. Something that is important to establish is that we have something important in reference to being able to have a weekly update where we have all of this part. And we are going to have a weekly report in reference to being able to see what is the consolidation of what we have and what we need to ask in reference to all of our promoters and all of the presidents and has allowed us to be able to have a suitable factor in reference to an efficient use of this blood unit. Next one, please. And here, everything that we've been able to see to all of this pre-analytical design, and we have a laboratory where we are able to verify all of the parameters in reference to this part. We're able to measure the weight, the temperature, and also here we're able to see, to be able to carry out an analysis. Okay, passing on to one of the advantages that we have is to be able to have a systemized and with all of the laboratories that allow us to be able to take the statistic in reference to everything that is happening here throughout the 360 days. And what would happen within this part is that we actually are able to go around to any kind of a test to be able to see the different blood units. Next one, please. And as you can see here, by having all this centralized, we also have the assurance of quality in reference to quality systems. We have the ISO 9001 in reference to the first, second opinion, and now we've been able to create a whole regulation. And what is most important is that within all of these ends, we are able to have this at a national level to be able to have a system of the monitoring that allows us to be able to regulate and control this indoor temperature. You only have 30 seconds to be able to finish the presentation. Sorry about that. No worries. And just to be able to see everything that has been done here, to be able for us to process around 76 parts in 76% of the blood in the country, and to be able to have everything processed in 250,000 blood units, to be able to have NAT laboratories in reference to immunohematology, and also as of the year 2014 and towards the next part that we have here, it's that we are able to see the immunohematology laboratory in reference to this part, and well, as I was told, in reference to all of this that is done. Next one, please. And here, just to be able to see that right now we are working in scientific publications regarding reductions of NAT. And the whole part that has to do with this in reference to the next slide, please. And well, to be able to work here together.
nos permitía seguir el rastreo
This
de
is
los
what we are able to
anticuerpos
see in reference to the sampling of this part in reference of COVID, in reference to being able to have these centralized, that we have the acts of services and we can have this different investigation and research. And like we were commented in the morning, we made this content and we reaffirm our commitment with life, given that it is at everyone's service in reference to the whole community and the country and the whole region. Thank you very much for that.
Doctor Gaviria y doctor Soria, muchas
Dr.
gracias por la
Gaviria,
presentación.
Dr. Soria, thank you very much for the presentation.
Vamos a hacer un breve
We're going to have just a very, very brief recess. I understand that you are already taking a flight.
Vamos a ir a un receso
So we are
de
going to
10
go to a
minutos
10-minute, only 10-minute recess, please.
a los panelistas
We
más
will truly
conectados.
thank the panelists to maintain themselves connected. It is currently 3:49.
3:50 a las
3:50 at 4 o'clock.
hora
We need to
10
begin
minutos
again in 10 minutes exactly, please. Peruvian time. We will begin with the following presentation and to the attendees as well. 10 minutes and we begin again. Thank you very much.
Buenas tardes, estamos de vuelta.
Good afternoon. We are now ready to come back.
Hola, buenas tardes, estamos nuevamente de vuelta.
Good afternoon. We are here again, and we are here with the following and reference to the experience of the Caribbean
A cargo de la doctora Dunasi y Elena
in
Moreno.
reference to the Dr. Iracy Moreno. And here this is a service of the National Service of Transfusion of blood of the Ministry of Health of Trinity and Tobago.
Hola, muy buenas tardes a todos. Mi nombre es
Good
Donaisa Elena
afternoon to
Moreno.
everyone. My name is Janice Elena Moreno. If you have any question, I would like to thank the committee of PAHO and Peru for this opportunity.
Compartir con ustedes acerca de la
In reference to
experiencia.
being able to see, basically I'm going to share the experience of working here as a hematologist and here in reference to the transfusion center of here in Trinidad and Tobago, which is an island in the Caribbean, and we are going to share the presentation.
So, voy a hablarles en inglés porque bueno,
I will speak in English because while I am representing a country that is English speaking, and well, if anyone says you prefer to me speak in Spanish, I can also do that, but I present it in English and I will go ahead and speak in English, okay?
I'm going to present to you the experience in blood donation and VNRBD, which is voluntary non-remunerated blood donation, and how the blood system is organizing in the island of Trinidad and Tobago. And giving to you some history, and I would like to share with you one of the pictures that we took in the last event in last year for World Blood Donor Day as well. In 2023, you can see some of the events that we have across the border in the entire country, and in some of the different blood collection centers that I go in and explaining to you how the blood system is organizing in this country. On this slide, you will see this one, it was the recently donation of the one vehicle that we use it for organizing our blood mobile units in a country that we got it exactly related with the event of World Blood Donor Day last year from the country of the Republic of China, with the people donating to this country to try to help us to improve the voluntary non-remunerated blood donation. Trinidad and Tobago is a small island, which is on the Caribbean, located on the Caribbean Sea, is closer to South America. As you can see here with the representation with the arrow on the bottom of the slides, you could see this, and it's a group of two islands, one bigger than the other one, with limit principally with Venezuela and others Caribbean islands. The characteristic that you can see is a small group of islands, like one on top and the other one, which is the biggest one, which is the major, considered which is Trinidad and Tobago, which capital is Port Spain, with a geographical area which is 7,762 square kilometers, with a population in around 1.5 million of inhabitants, with the principal ethnicity considered between the East Indian, African, and Mexican population. Geographically, Trinidad and Tobago is divided in four principal regions, which is North, South, East, and West. And also, I would like to share with you that the life expectancy from the population of the country of Trinidad and Tobago is in men 72-year-old and 79 women, respectively. Now, I go in and share with you how we organize in our operational system here on a country. Basically, we are divided in, as I say at the beginning, we divide the, Let me know if you can see, because I don't know what I did, that I can't see the presentation.
Yes, we can see the presentation perfectly.
But I don't know what I did that I can't see actually the slides. Okay, I got it back. Sorry about that. So, basically the structure of our blood system in Trinidad and Tobago, this is the most updated version of our structure in the country. And just show it that we have a national level. And
We are showing the same slide.
yeah, but I don't know what happened with the computer. Hold on.
¿Quieren que la pasemos nosotros?
Bueno, sí podría ser. Lo
Would
que
you
es
like
que
us
no
to
sé
pass
qué
the
es lo que
slides? Well,
pasa.
that could be. I just don't know what's happening.
Maybe press escape.
Escape.
Yes.
If I press
And start
escape,
again.
¿me pueden decir cómo podría de nuevo regresar?
Can you tell me how I can go back?
Solo tiene que apretar el botón de
You only need to
presentación.
press the presentation button. It is in the lower right corner.
Modo presentación.
Presentation mode.
Modo presentación.
Y desde interpretación también nos solicitan un favor, doctora.
And
que
also
hable un poco más
interpretation.
despacio para darles
If you
tiempo
can
a
speak
ellos
slower so that
de
you can give
procesar
some
la
time for them to be
información.
able to process the information.
Okay. Déjame cerrar.
Okay, let me
Primero.
close the screen.
Madre mía.
Sorry, I apologize for this.
No sé qué es lo que pasa, que no
I don't know what is
puedo.
happening, that I'm not able.
Podríamos presentar
Can
nosotros.
can we present?
Okay, creo que ya
Okay,
lo tengo.
I think that it's ready. I think I've solved
Ya
it.
si me
Okay,
lo ven pasando.
now if you see that it's not, are you able to see that it's changing from one slide to another? Yeah.
Okay, no voy a tocar nada más
Okay,
que
I'm not
lo
going to
que
touch
ya
anything
está.
than only the first buttons.
So,
Very good. So,
we are divided at the national level, we have it, a National Blood Transfusional Service, which is in charge of the data collection and the centralized testing and processing lab center. Also, we are divided in different regional health authorities, 5. On this case, the island is divided in Northwest Regional Health Authority, North Central Regional Health Authority, East, South, and Tobago as a separate regional health authority, which is a separate island. Also, as part of these 5 regional health authority, we have 7 blood collection center, which is the center where the people normally come and donate the blood, which is one located in Port Spain, which is the capital hospital. Also, in North Central area, we have 2 different blood collection centers. One, which is in Arima Hospital, and the other one in Eric William Medical Science Compound. Both of them are the 2 collection centers in North Central Regional Health Authority. At the east, we have Sangre Grande General Hospital Blood Collection Center. Also, we have South Regional Health Authority in San Fernando General Hospital and Point 40, like 2 blood collection centers identified on the south area of the country. And in a separate island, which is Tobago, we have a Tobago designated blood collection center in the major hospital, which is Tobago General Hospital. That is in terms of blood collection. In terms of blood banking laboratory, we have one separated by each regional health authority as well. One located in one of the biggest hospital located in one of the different areas in the country. One in Port Spain General Hospital, other in Eric William, which is in charge of processing the blood for the both big hospital, as you can see at the end of the user, which is in Eric William Medical Science Compound, and also in Arima General Hospital. We have, and make the mentioning at the beginning of this slides, is a National Blood Transfusional Service lab. Also, in the East region, we have the lab located in Sangre Grande General Hospital. At the South Regional Health Authority, we have San Fernando General Hospital lab and also Tobago. And as part of the users, we have a public, private institution who are used and request blood from all the labs in the country. Of course, all of that is separate and independent of the area where the major big hospitals are located in the country. Like as I mentioned before, in Port Spain, Eric William, Arima, San Fernando, Sangre Grande, Point 14, and Tobago, plus the private institution, but they are just the users. As you can see on the bottom on these two reference blocks that I just put in at the end of the slides, all the collection centers and all the laboratories institutions who are in charge of processing the blood and separating different components are located in the public service. The private sector, they are just request and use the blood from the public sector in Trinidad and Tobago. And also in terms of how they are reporting and do the request and recording of all the information related with blood, we have a National Blood Transfusional Committee, which is in charge of the oversee and activities related with the blood management in the country. And we normally met every 3 months, and the Hospital Transfusional Committee, which is in charge of management of all the activities in the hospital, and they are met every month. And also, beside all of the collection centers that we have located in every principal hospital in every region here in the country, we have 2 blood mobile units, which is the blood that they are collecting is 100% VNRBD or voluntary non-remunerative blood donation. Actually, they are on the possession of the North Central Regional Health Authority, which is in Eric William Medical Science Compound, and the other one in Port Spain, which is Northwest Regional Health Authority. These slides show the name of the major blood collection centers, and because they are also most of the users of the blood and blood components that we are producing in the country. As I mentioned before, the name of theirs is Arima General Hospital, Port Spain General Hospital, Eric William Medical Science Complex, Point 40, and San Fernando, which is located on South Scarborough General Hospital, which is Tobago, which is the separate island, which is part of the country as well, and Sangre Grande. I would like just to explain to you briefly how our lab system is organized. We are in the presence of the hybrid system here in Trinidad. We are not a centralized service of blood and testing. And how we organize in the lab system, we have a National Blood Transfusional Service lab when we are in charge of the centralized TTI testing, that we are test and identify that all the blood that we are receiving is clear to use. Also, we are in charge to provide the quality control and identification from all the RHs. However, we are not on the position to centralize the processing system of the blood. Unfortunately, that is something that I found when I came here at the beginning and starting to work here in 2018. And this is how the system is organizing here on Trinidad and Tobago. Basically, what it means that all the RHs, as I explained before, which is disseminated around the entire country, they are in charge of processing the blood that they are collected and they are sending. They are just sending to us the samples of the blood for being tested, and make sure that after we are testing the blood is first get high level of quality, and also the blood is clear from all the tests that we are doing in. How we are going to test the blood samples coming from all the RHs in the National Blood Transfusional Service. We are a centralized lab test that we are in charge of testing the whole blood which is collecting across the board in Trinidad and Tobago in each RHA. We are using the technology of ELISA serology test by 4th generation, and we are testing the blood for 6 different markers, which is an HIV, hepatitis B and C, HCV 1 and 2, syphilis, and Chagas disease. This is another slide who will show the capacity of processing that we have here in the country. And basically, all the blood banks in the country have the capacity of processing blood, but we are doing it manually. We don't have actually in the country the capacity or the possibility to do components by the first technology. And I just want to show you that we have actually 4 labs. We have the full capacity of processing, and the other 4, we have just partial capacity of blood processing. When I mean full capacity, is that we have these 4 labs have the capacity to spread out the blood in most of all the components that we have it. However, the other one that you can see on the right, which is 0.40, Sangre Grande, Tobago, and Arima, they are just have the capacity to separate the blood in red blood cells and plasma. Taking in consideration all of this, and after I came and take the position of the medical director, I tried to create a vision and mission for the National Blood Transfusional Service. Our vision is to provide an efficiency and comprehensive blood transfusional service in Trinidad and Tobago, make sure that the need of the population is sustainable and they will get a safe supply of blood. And our mission, which is one of the challenges that I will go and mention to you in the future, is get through finally and complete the complete transition for 100% voluntary, non-remunerated blood donation. Why I target that as our principal mission here? I will go on explaining to you because currently here in the country, the type of blood donation that we have is not 100% voluntary. I'm going to explain it to you in the next slide's comment. But before, I would like just to share with you the experience that I have it here. Try to get it through with get finally achieve this mission and vision that I have for the National Blood Transfusional Service. We had to create a strategic plan with objectives. We had to get this specific characteristic. One, it has to be specific, as I say. It had to be measurable. This objective also had to be achievable, relevant, and time-bound. And to finally get a successful of the objective, of completely the objective of the plan that we are created. What is the goals that we have it here and try to achieve the vision and the mission, and specifically mentioning as one of the first one, try to create a strong national blood program to make sure that the blood need of the population, it will be on the future and with an efficiency and a safe blood supply for the people, whatever they are and whomever will need the blood, we will be able to provide them to them a safe and a good quality of the blood and blood component that they will receive when they need it. A sustainable and adequate supply of blood and blood component for the population in Trinidad and Tobago, obtaining through a 100% BNRBD. Also, the safe of the blood and blood components on the population here on the island, according to the international gold standards and best practice in blood banking. And one of the biggest challenges that we have is try to implement a strong system to try to improve the actual hemovigilance program and system that we already have, which is not able at this point in time to track the unit of blood since the donor come in and donate blood until the end of the blood change of transfusion. As I say before, one of the biggest challenges that we have to try to comply and achieve this mission that we have as a National Blood Transfusional Service is that actually in the country, it have two different type of blood donation beside the VNRBD blood system, which is one, the replacement blood donation, which is actually represent the 75 of the blood donation that we are receiving in the blood collection center, which is people who are donating blood for any relative or friend who will need it, and they ask for the proof of donation, which is calling the replaced blood donation. And the other one, which is one of the oldest system that is actually and operating on the country, which is generate and collected the 20% of the blood donation that we have it here on the country, is a kind of credit system. When the blood donors come in and into the blood donation center, they donate the blood, but they don't ask or claim for the proof of donation at the time. They will just come in whatever they will need it, which is not make no sense. And that is something that I try with my team, try to change and sensitize them. But the highest or the biggest and strong challenge that we have here is the resistance that we got from the population for the transition in VNRBD system. This is some of the strategy that we try to implement to achieve this transition to voluntary non-remunerated blood donation system, which is making and try to introduce some changes in the health system, especially on the public service that where we are operating under the Ministry of Health Authority, and which is try to renovate the blood donation centers to make sure that the blood donors get a good experience and comfortable environment when they come and give blood. Also try to increase the amount of communication message that we're sharing with the population, try to give into them more information that they will need to know that nothing will be wrong on the transition, try to explain it to them the advantage and the safety and for the transition to the voluntary non-remunerated blood system. And we also create an online registration system, try to make easy for the donors to come and give blood. And also we have actually a database for people who are willing to come and give blood. That database rates about 4,000 registered donors. And we try to encourage them to come and give, but this is just as part of the strategy that we try to implement in. I will probably share with you that information in the future. Also, something else that we are doing is to retrain and update the training that the nurses we have it here on the blood collection center about the criteria of inclusion, on the eligibility of the blood donors. Also, we try to get in cooperation with external units in terms of religious, social, and companies, private and public, who are willing to come and be part of the VNRBD system. And this is how we are getting the amount of voluntary blood donation that we get in the last time. After this briefly context that I shared with you, how we organize it here in the country, I would like to share some of the data that we have in terms of blood donation here in Trinidad for the last year, in 2023. This one is the number that we have it for blood connection, separate, as you can see, in different color each RHA. And we have a total of 18,122 blood units collected in the entire 2023. On this one, you can see that the population, the principal age that we have it on our blood donors is between 25 and 44 years old. And we have donors between 18 and 60, 65. But as you can see, the majority of them come in the group of age between 25, 44 years old. The other data which is important to get the remark is that the amount of blood donors that we have here, the majority, the donors that we get in-house is males. It's important, and I want to bring into the attention that we have a lot of number of female who wanted to come and give blood, but unfortunately, they are deferred because of the level of hemoglobin that they have is very low. I mean that they are not qualified to give blood when they want to come. This is the numbers and the comparison between the amount of blood that we are collecting in 2023 versus the VNRBD. You will see that the numbers is very low. But the good thing because I want to be positive and thinking after I saw all of this presentation that all of you guys have it, I really feel in hope and expecting that we can share information like that in the future. The VNRBD system, it was zero between 2022. We getting through to start the process for World Blood Donor Day in 2022. And we're jumping from the 2022 to 2023 from 0% of VNRBD to 8.53%, which is not really much, but I mean, it's step by step, we're moving forward. And actually, I would like to share with you that just on the time of the data that we got until May 2024, the percentage of VNRBD in comparison from the total of the world blood donor donation is at 10.32% of the blood donation. This is our percentage of deferral, which is something that I try to work as well. Just to check in, we are in the process to review the guidelines and the criteria and also study the population and identify why the percentage of deferral is so high. But if you can see the percentage of deferral of blood donor, we have it is 23%. In terms of production, which is, as I explained before, we don't have the full capacity of processing in all the labs that we have in the country. However, with the 18,122 units, we was on the capacity to produce 30,182 components. And across the board, all the components that we are producing, and
Doctora,
I
le
said,
quedan 2 minutos.
Uy, sorry. The total of blood component that we have in 2023, as you can see, the majority capacity that we have is to produce FFP, red cells, and blood platelets. And this is the distribution of blood component production and for all the RHS. The uses of blood, as we say, the demand always is highest than the amount of blood that we are capable to collect it. Actually, we are on the 28.8% of fulfillment. That is across the entire country have the same distribution. And in terms of discarded, this is the chart who show why we are discarded the blood. And the most important thing that I want to share with you is the three principal discarded etiology, because we are discarded the blood. In first point is the expires, in second time TTI, which is the blood infected. We are on the percentage of discarded for TTI in 2.1, and we have a 97.9 blood safety percentage for use. This is a picture of part of my team at the National Blood Transfusional Service. Thank you so much for your time, and sorry for the inconvenience during the presentation.
Muchas gracias, doctora, y siempre saludos para usted.
Thank you very much, doctor, and hello to you. Thank you very much, and thank you for the opportunity. And thank you. We continue to the next presentation that will be given by Dr. Bernardo Camacho, Director of the Science and Health Sciences and Biotechnology Institute, who is going to talk to us about hemocenters and support to access to blood in the regions. Thank you very much, Dr. Fuentes, and I'd like to say hello to the organizers, to PAHO, and all the participants in this important celebration of the World Blood Donation Day. Are you going to share the presentation, or should I?
Gracias. En modo presentación. Bueno, muchas gracias.
Thank you very much. First of all, I would like to thank you for the honor of being in this great celebration.
Y segundo,
And secondly, Dr. Mauricio asked me to talk about a topic that we consider important in our countries, and that is how we provide access to blood and blood components in situations that can be considered vulnerable, where we have compatriots that require, for any reason, a blood supply. Next.
Ok, bueno, muy rápidamente, me
Very
gasto un par de
quickly,
minutos.
I will
Nuestro
spend a few
instituto
minutes saying
se
that our
transformó
institute
después de haber sido un
became,
centro por
after
muchos
being a
años,
hemo
y
center for
se
many years,
transformó por el
we
desarrollo que
became,
fuimos teniendo
because of
en
the
un
development
instituto
that we did,
distrital de
we
ciencia,
became
tecnología e innovación en
the
salud, que tiene
District
un
Center of
componente de
Science,
sangre,
Technology,
banco
and
de sangre,
Biohealth,
banco de
and we have
tejidos,
a
banco
blood
de
bank,
cordón
tissue
umbilical,
bank,
una unidad de
umbilical
terapias
cord bank,
avanzadas, y
a
también
advanced
tiene
therapy
un,
unit,
un
and
registro nacional de donantes de células
a
progenitoras.
national
Nuestro centro
registry of stem cell donors.
es un centro de
Our
investigación
center
reconocido
is
por el
a
Ciencias y tiene
a
también, digamos,
recognized
un poco
research
del sistema
center,
colombiano,
and
una
this is in the
categorización de
Colombian
nuestro
system. We
grupo de
have a
investigación que se
categorization of
llama
our
GINT,
research
Grupo de
group that is
Investigación en
called
Medicina
GINTI,
Translacional
and that
y
is
Terapia Articular
institutional
Celular
medicine,
en la
tissue and cell
categoría
medicine
A1.
in
Siguiente.
category A1.
Nosotros, nuestra corporación es una
Our
corporación mixta con
corporation is
participación
a
pública
corporation that has
privada. El
public,
componente
private
privado son
participation. The private
universidades
component
muy
are the
relevantes y
universities that
prestigiosas
are
de nuestro
very
país,
prestigious and
pero es una
relevant in our
institución sin
country.
ánimo de
It's
lucro
also
y
a
tiene como
non-profit
propósito toda
organization,
investigación
and the
en el
purpose
campo de la
is
medicina
research
translacional,
in
transfusional, provisión de sangre,
transfusion,
tejidos y células.
medicine,
Y
and
ya
provision of
cumplimos en esta
blood
nueva
and
etapa
tissue
en
cell
nuestra
and
actividad
cells. And
7 años de
we
actividad.
have
Siguiente.
7 years of activity.
Lo otro, nuestra misión, como
Our mission,
está en nuestros estatutos,
as
somos
it
un
is
instituto de
declared in our
ciencia que
statutes, we're
hacemos
a science
investigación,
institute,
también
meaning we do
desarrollos
research,
tecnológicos e
we do
innovación, pero con
technological
un gran
development and
énfasis en
innovation,
investigación biomédica,
emphasizing
especialmente en los
biomedical
campos que ya he
research,
mencionado, de
especially
la
in the fields
transfusión
that were
sanguínea, de los
mentioned, blood
tejidos humanos,
transfusions,
de las
human
células para
tissue,
trasplante. Siguiente.
and
Y por
transplant
supuesto,
cells.
como
And
visión,
of course,
tenemos
the vision is
convertirnos en un instituto que
becoming
satisfaga como centro de
an
referencia
institute that can
necesidades de nuestro
become
país,
a
pero
reference
también
center
hacer
to
una
satisfy the needs of our
contribución
countries
en
and to
contexto
contribute
de América
to
Latina que creo
the
que es
Latin
muy
American
importante para
context that I think is
crear polos
important
de
to
desarrollo para
create
avanzar en este importante campo
poles of
que nos
development to
ocupa.
advance
Siguiente.
in this important field
Lo
that
otro que
we
es
work on.
importante
The other
es el
important
valor
thing
público,
is
pues es
the
impactar
public
en última
value.
instancia. Todos
We want to,
trabajamos y
in
sobre
the
todo en
end,
este
we
campo tan
all
importante,
work
la transfusión
in
sanguínea,
this
en
important field
impactar
of
la
blood
salud
transfusion. We want
poblacional
to
desde el punto de vista del que podamos
positively
hacer
impact
desde
the
la
population's
ciencia, la
health
investigación, por
through
supuesto la
science,
tecnología y la
research,
innovación. Siguiente.
technology, and innovation. Next.
Ya lo mencioné, nuestras unidades
As I
misionales, la
said,
sangre, los
our
tejidos, el cordón umbilical,
missions are
el registro de donantes,
blood,
la
tissues,
inmunohematología
umbilical
avanzada,
cords,
las terapias
advanced
avanzadas, la microbiología, siguiente, son
immunohematology,
como
and
unidades
others,
misionales del
microbiology.
instituto.
These are
Y
the
en el caso del
units of the
banco de
institute.
sangre, entraré en
And for the
materia
blood
de
bank,
cómo nos se conforma nuestra organización.
I will
Siguiente.
talk about our organization next.
Ok. Tenemos
So,
un anterior a esta, la anterior.
the previous
Tenemos
one,
un banco de
please.
sangre. Antes de
We have,
introducir
well,
al tema,
before I
¿cómo
go into the
hacer
topic,
para llevar
how do we
sangre, componentes sanguíneos a
bring
tejidos,
blood or
a
blood
regiones que
components
por
to
ciertas circunstancias no
regions
pueden
that for any
simplemente
reason
funcionar de nuestro
cannot
banco de sangre?
have
Tiene
it?
una
Our blood bank
certificación de
has
calidad
a
internacional, la
international
certificación
quality
CAT. Es un
certification.
banco
It's
de
the CAT
sangre
certification.
de
It is
más
a
de 18
blood bank
años
that
realiza de manera
has for
sistemática
18
pruebas moleculares a
years
toda la
been
sangre, como
doing
ya ve en
molecular
las
tests to
presentaciones de
all
hoy
our
que se
blood.
hacen muchos de los
And
centros importantes de América
as I see
Latina.
many of the centers in Latin
Abastecemos
America
toda
do,
nuestra red
we
pública
supply
y
our
cerca de
public
50
network and about 50
otras
or 60
instituciones
other
en nuestro país. Siguiente.
institutions in our country. Next.
Bueno, aquí está un poco
Well,
todo
here we
el
have
tema del ciclo, simplemente
the
para mencionar
cycle.
algunos datos.
Just to
Nuestro
mention some
equipo
data, our
de
team
sangre, de todo el banco de sangre, hay
in the blood
52
bank
personas
has
profesionales
52
de apoyo
professionals
logístico
and
en
logistics support
hemodonación, 10
in
profesionales de
hemodonation,
apoyo técnico de
10
procesamiento, 5
processing
en
professionals,
inmunoserología,
5
5
in
en
immunoserology,
inmunohematología,
6 in
están a control de
immunohematology,
calidad,
2
2
are
al
dedicated to
aseguramiento de
quality
la
control,
calidad
and 2
y
quality
una y un
assurance,
profesional de la
and
medicina en el campo de
1
la hemovigilancia. Somos
hemosurveillance
muy
professional.
rigurosos
We are
en todo
very
el tema de la
rigorous
calidad y dedicamos
in the
personal
in
profesional para
quality.
ello. Siguiente.
Next.
Bien, entonces entrando en materia,
So,
lo que
if we
nosotros
go into the
hemos
subject
identificado en
matter,
nuestro país,
what we
creo que
identify in our
ocurre
country,
en
and I'm
otros de los
sure
países de América Latina,
other
es
countries in Latin
ciertamente
America have similar
que las
situations, we
distintas
have
naciones
territories that,
no
for different
tienen cómo
reasons,
colectar,
have no
procesar
way
y
to
poner
collect,
sangre a disposición
process,
de la población.
and
Y
make
esas,
blood
esos
available to
territorios
the population.
requieren de
And
un
those
aspecto
territories
fundamental que deben
require
cumplir los centros, además de la
something
oportunidad,
fundamental that the centers have to have,
suficiencia,
aside from
calidad,
the opportunity,
seguridad,
sufficiency,
y
quality, and
es el
safety,
principio de
and that is
solidaridad. Los
a
bancos de sangre,
principle
sobre
of
todo los bancos de
solidarity.
sangre
Blood banks,
públicos,
especially
tenemos el
public blood
deber
banks,
de ser
have the
bancos
duty
solidarios con
to
aquellos
be
territorios que
solidary,
por las
to express
circunstancias que menciono en esta
solidarity with
diapositiva tienen dificultad,
territories that,
territorios muy
because of
distantes de
different
las áreas con alta densidad,
circumstances,
de
will
áreas
have
con alta
will
densidad
express
poblacional,
vulnerabilities, maybe
difícil
high
acceso,
population
incluso por
density,
vías terrestres o
difficult to
aéreas,
access,
atención hospitalaria de baja o mediana complejidad, pero se
low
atienden
complexity
partos,
hospital
hay
care
violencia,
where they do
hay
births,
trauma,
or because
hay
of
necesidades
violence and
surgidas y
trauma,
no tienen la
need for
sangre
surgery,
por razones
surgery, but they
también
don't
incluso
have the blood.
epidemiológicas,
Even because
porque
of
pueden ser
epidemiology,
territorios
because these
endémicos
could
para
be
agentes
endemic
infecciosos
territory
o
for some
porque
infectious
incluso
agents,
pueden
or
haber
because
donantes de alto
there
riesgo
could
y
be
eso hace que
high
no
risk
haya
donors, and
penetración de
that means
donantes
that
y no
there's
se
a
puede hacer un
scarcity
programa
and
adecuado,
we cannot
seguro,
have an
confiable
adequate,
de
safe,
colectar la
reliable
sangre.
program.
No justificación costo-utilidad para operar un banco de sangre, de llevar las
Or there is no
tecnologías
justification
apropiadas,
to
o pueden ser
have
territorios
a
como es muy
blood bank, or these
frecuente
can
en
be
nuestro país y
territories,
de
as
otros
usually
territorios
happens
de
in our
América
countries,
Latina,
and I think other
áreas de
countries in Latin
conflicto y
America.
violencia social,
There's a lot of
que
social
áreas
conflict
o
and
hospitales de alta
violence,
mortalidad materna infantil y
high
quizás algún
uh,
otros factores
maternal mortality,
determinantes
and some
sociales de
other
alguna
social determining
enfermedad como
factors,
aspectos
such
nutricionales,
as
educativos,
nutrition
etc.
and
Son condiciones
education.
muy especiales
So these
siguientes
are very
que
specific
hacen que
conditions.
ameritan
Next,
que pueda haber
that,
una manera
next,
siguiente, sí, una
next,
manera
yes,
siguiente, una manera
a
de
way
poderlos
to
apoyar.
support
Entonces,
them.
tenemos, por
So
ejemplo,
we
en
have
esta
as an
diapositiva
example in
solamente
this
una
slide,
gráfica, zonas
we
importantes de
see
alta
significant
vulnerabilidad. Por
areas that
ejemplo,
are
la costa
highly
pacífica
vulnerable. For
colombiana,
example,
la
the
región
Colombian
del
Pacific
Chocó,
coast, we have the region of
centros
Chocó,
donde hay demandas
and we
importantes de
have
sangre,
areas where
porque
there's
hay
significant
hospitales
demand of blood
públicos
because
que
there's a
atienden
public
la
hospital that
maternidad, que atienden la
uh,
violencia, que atienden
cares
las
for birth,
necesidades físicas de la
violence,
población.
other surgical needs
Pero,
that the
por
population
ejemplo,
may
en este
have.
territorio
But in this
de
territory,
Colombia,
in
hace
Colombia,
20 años, un poco más quizás,
a little
no
more than
hay
20, for more than
disponibilidad
20 years, there hasn't
colectar la
been
sangre.
the possibility
Entonces,
to
lo que hacemos
collect the blood.
nosotros es
So what we
visitar el
do
territorio,
is visit the
tomar datos
territory,
y
take the
mirar que
data,
tenemos
and
las
see that
capacidades de poder
we
ofertar este
have the
servicio.
ability
Siguiente,
to offer the service. Next,
siguiente.
next.
Bueno, entonces identificar
Okay,
necesidad,
so we
porque
identify the
incluso a veces
needs,
necesidad de
and
traer a
sometimes
nuestro
there's a need
instituto
to bring
personal para entrenarlos
personnel
en
from our
distintas
institute to train
técnicas
them
para
in
que el
different
proceso
techniques
pretafuncional sea el adecuado. Siguiente,
so that the
se hacen
processing
los
is adequate.
procedimientos para ello.
We
En
also
el
do the
cuarto
procedures for
punto,
this. And in
hacemos
the fourth point,
entonces,
we
evaluamos si existe, como lo estamos
assess whether
haciendo,
there is,
un
as
estudio
we're
ahora
doing,
en el territorio. Si
a
hay una
study in the
población
territory.
importante
If there
y
is a
determinar
significant
si por
population
razones
and we determine
epidemiológicas o
if
agentes
for
infecciosos endémicos
epidemiological conditions
pudiésemos
or
hacer un
endemic
estudio que
infectious
determine
agents,
que
we
sí
can
es
have a
posible
study to determine
obtener
whether
donantes
it
y
is
es
possible
posible,
to
como lo
obtain
vamos viendo,
donors
evaluar la
and
posibilidad de
assess
instaurar
the
allí un banco
possibility
de
to
sangre. Lo estamos
installing
haciendo ahora
a
en este
blood bank
territorio.
there. And this is
Siguiente.
what we're doing right now in that territory.
Bueno, entonces, al final de
So
todo esto, acordamos
at the end
unos
of all of this,
convenios, una
we
alianza con el
agree, we have
centro
some
hospitalario,
agreements, we have an
una
alliance with the
provisión
hospital,
de
we
nuestra
have
institución
provision of
siguiente,
our
a través
institution
de
next
acuerdos muy formales, por
through
supuesto, en los
formal
cuales
agreements, of
nosotros
course,
ofrecemos
where we
incluso
offer
unas tarifas especiales, las
special
mínimas
fees,
posibles, y nosotros
minimum
hacemos el
possible,
envío
and we
de los
do the
componentes
we
que se
send the
requieran.
components that are
Generalmente, como lo
required.
acarrea hoy
Generally,
en las
as I will
distintas
show
regiones del
now,
país,
in
casi
the different
todos
regions
estos
of the
envíos
country, all
se
of
hacen
these
por vía
deliveries
aérea,
are done
entonces tenemos
by
organizadas
air.
las
So we
compañías,
have
las horas de salida de vuelos.
companies,
Ahora vamos a enviar
we
algunas
organize the
fotografías
slides, and we will see some pictures now of how you safely transport the material. Next, and in this way, guarantee
territorios. En este
the
caso,
delivery of blood to the territory. In this case, specifically, this is not in Choco, this is the Atlantic coast, this is the Guajira and Maicao, and this is an important town that does not have a blood bank, and they have a special house, so they've asked us to design it, and we've designed, and maybe we will be starting a new blood bank for this population, and we're supporting them with the architecture, design, equipment, personnel training, promoting donation strategies. We all do this as assistance for this bank that could be called a brother bank, so that after this process, the bank can start and can provide and can always use the support of our reference center.
nosotros hicimos unos diseños adecuados.
We did the adequate design. This is very particular territory with a specific ethnicity, so we want to adapt to the cultural aspects of the region. Next. Also, next. That's a proposed infrastructure, and that's all in process. We have established mechanisms so that twice a week they can do the submissions through telephone, WhatsApp, messaging systems, and it's very fast. They ask, and next we do the deliveries, and we have organized everything with the airlines. We know how to dispatch to those vulnerable areas. And we do have formality. We have the logistics behind that to get from our center to the airport, the deliveries, the adequate packaging, the safety and refrigeration conditions. 4-degree refrigeration, or for platelets, freezing temperature. But something that I consider important is that when we assume this responsibility, we do it because we are able to provide always in a safe way the blood supply to the population. Fortunately, the blood collection that we have in our institute allows us not just to go to 50 hospital centers, but also to create reserves, special reserves for those populations, and to not leave it as something forgotten. Next. We can also do deliveries. As I've seen in other presentations, we also have mechanisms where we find that the blood reserves are excellent if it goes 15 days without collecting blood. And here we have different dates for provision. And when we change the light or the color, we have a strategy to increase so that we don't reduce our reserves, so that we can satisfy not just these populations, but satisfy the needs of the centers that operate in our city and other cities that are close to the capital. Next. All of this is in an IT system. We have, these are some snapshots of the cold storage rooms where we have reserves of red blood cells. Sometimes we have 2,000, 1,500 reserved. And of course, this is a big amount that we have that is frozen in our special storage units. And of course, red globes that are obtained individually or through groups. Next. You have 5 minutes left. Yes, I do have a timer. So I am considering. So we have the next one, the transportation. We get pictures of how it gets there, the information that everything arrived well. These are pictures in Choco, where we sent a delivery. Next. And this, I'd like to go back to the map.
Eso. Aquí están los, ese
There.
es Colombia.
This is Colombia. There. This is Guajira, the components that are sent Antioquia, Chocó, Putumayo, and Caquetá. Our country is a country that has more than 1 million square kilometers, and these are big regions, and in some cases, you have access by land, but sometimes it can take 24 hours or more. All the distribution of blood components is done by air and is organized and planned so that we can take blood to those territories. Next. As I mentioned, this is possible because we have some principles of technical and scientific excellence. We have public ethics. We have criteria of equality, solidarity, and always sufficient reserves to be able to address the needs. Next. Very well. Just to mention that we have a certification and all of this is possible, and here you have the points for the different areas, and to finish, we have the collection teams. This is important. This is the promotion area. We have a significant team collecting and contacting companies to organize drives, and we usually do this with 2 months of anticipation or more. Next, we have a promotion team. This is the strategy where we do collection, private companies, public spaces, education centers, churches, very similar to other interventions. The reactivity is 1.6. We are close to 30% of voluntary donation. I think I only have a couple left. And here, pictures of how we do this in the collection area. Next. Next. And in the collection team, in the previous one, we see the teams formed. We have a leader. We go out every day. We have 8 or 10 collection teams, and there is a hemo surveillance doctor that coordinates all of this. But we go to many sites to be able to obtain these the blood that our citizens need. Then we have a communications area. Previous one, please. We have a communications with a leader in institutional relations, a webmaster, a multimedia designer, community manager. All of the communications components are important so that we can be able to collect the blood that we need. Next. Logistics. We have drivers, teams, mobile donation units, etc., etc. Next. Processing area, as I mentioned. You've already seen pictures of the processing area. Next. The adequate storage. And I have a couple more. Next. Immunohematology. Special hematology. Next. This is a reference lab, molecular immunohematology. Next. Immunoserology. Next. And all the services that a blood bank would offer. Many institutions, 52 clinics and hospitals. Next. And here we have some numbers that simply to have as a reference in our bank. Next. Next. And I think this is the last slide. This was the first delivery to Chocó, and thank you very much.
Gracias a ti, Bernardo. Siempre recordándote como un buen amigo y que siempre hemos andado por todo el mundo contigo. Y los mejores deseos y saludos, Bernardo.
Gracias. Gracias a
Gracias.
ustedes. Si alguna pregunta quedaré disponible.
Bien, muchas gracias. Y ahora queremos aprovechar la oportunidad para saludar a un gran amigo, el doctor Nelson Zuno. El doctor Nelson Zuno es doctor en
We have
filosofía.
Dr. Nelson Fuso, who's a doctor in philosophy. He is a general director of the Red Cross in Japan and professor of the University of Keio, Japan, who is going to speak to us regarding what is centralization, consolidation of tests, and processing of the Red Cross in Japan. Go right ahead, Dr. Nelson.
Oh, thank you very much, Dr. Mauricio. It's my great pleasure to be here. I'm Nelson Tsuno from the Japanese Red Cross Blood Services in Japan, and it's my great pleasure. And today I will share with you our experience with the implementation of a wide area management system, which includes consolidation and testing and processing at the Japanese Red Cross Blood Services in Japan. Can I share my slides?
Yes, please. And if you need some
Okay,
help, we are available.
Okay, I will share. Okay, hope you're seeing my slides.
Yes, you need to put in presentation mode.
Okay.
Perfect. Thank you.
Okay. So this is an update of Japan and the Japanese Red Cross Blood Service. As you already know, Japan is a very small country with a population of about 122 million people. Our blood donation system is 100% voluntary and non-remunerated, with around 5 million donations per year. So we receive around 5 million donations. And we supply approximately 5 million bags of blood annually to about 10,000 hospitals in all Japan. And the majority of our blood donors are male, about 70% male and 30% female. This slide is just to compare the land area of Japan with Peru and the US. You can see that Japan is very small. Our land area is about 1/3 that of Peru, but our population is approximately 3.6 times that of Peru. When we compare the population pyramids of both countries, you can see that Peru has a traditional pyramid shape, while Japan, the Japanese population structure is becoming almost an inverse pyramid. So with that said, I will discuss the implementation of the wide area management system, which includes the consolidation of testing and processing in Japan. This system was fully implemented in 2012, that was 12 years ago, with the aim of improving inefficient business operations and addressing the non-unified and independent accounting systems of our blood establishments. Additionally, it sought to comply with the Pharmaceutical Affairs Law and strengthen the national governance of the GRC headquarters. It is important to note that safety was not the primary objective of this process. So although full implementation occurred in 2012, as you can see in this slide, there was a preparation period that started as early as in 1990. This was followed by a phase of a partial consolidation, leading up to the complete implementation of the wide area management system. So the main reasons for considering the implementation of this consolidation were, first, to secure improved safety and ensure a stable supply of blood products, and to establish a smooth and sustainable nationwide management system under the umbrella of the GRC headquarters. So to ensure a stable supply of safe blood products across the country, Japan was divided into 7 regions that we call blocks, and these regions are highlighted in different colors on the map. Each block has one block blood center, which serves as the consolidated center for testing and processing. Japan consists of 47 prefectures, and each prefecture has a local blood center that is responsible for blood collection and distribution of blood products in its region. Additionally, we have 172 branches, including 120 donation rooms throughout the country. So these pictures are from one of our blood donation rooms that we call Yokohama Leaf. You can see it follows the concept of a book cafe, providing donors with a relaxing environment while they donate blood. In Japan, it is typical for blood transfusions to be performed in any medical facility, including small clinics. As a result, we supply blood products to approximately 10,000 medical facilities nationwide. And to support this, we have 102 supply facilities across the country. So after the implementation of the wide area management system, our organization structure comprises of headquarters at the apex, 7 block blood centers that serves as centralized facilities for testing and processing, and 47 local blood centers, each located in one prefecture. This restructuring took place in 2012, as I mentioned, and in 2023, we completed the business integration of the block blood centers and local blood centers. So before consolidation, as you can see on the left-hand side, all blood centers were responsible for collecting, testing, processing, and supplying blood products within their respective prefectures. However, following consolidation, as you can see in the right-hand side, local blood centers now focus solely on blood collection and supplying blood products to hospitals. The Consolidated Center, also known as block blood centers, handles testing, manufacturing, and oversees supply-demand management at the regional level. The implementation of the wide area management system enabled us to achieve efficient business management, ensuring a stable supply and effective utilization of blood products. These are the primary reasons why the implementation of the wide area management system and the consolidation of testing and processing were deemed necessary. First, we had external factors encompassing socioeconomic shifts such as population aging and declining birth rates, alongside regulatory changes. Notably, a new blood law was enacted in 2003, and revisions of the Good Manufacturing Practices, or GMP, and Good Quality Practice, or GQP, ministerial ordinances in 2005. We also had internal factors of the GRC, including the imperative to maintain robust business operations, ensure a stable supply of blood products in each prefecture, and address low business efficiency and uphold the quality of our blood products. So this demonstrates the rapid aging of the Japanese population, with approximately 30% of our population at this time aged over 65 years old, as illustrated by the light blue bars and the blue line. Moreover, we are witnessing a decline in birth rates, which will impact our donor recruitment efforts. This is a legal framework governing the blood program in Japan. It comprises of 2 laws. On the left side, the Pharmaceutical and Medical Devices Law establishes safety measures for blood products. And on the right side, the Blood Law outlines the principles of blood supply and utilization. The Blood Law defines the roles of various stakeholders, including blood collection organizations, blood product manufacturers and distributors, and particularly medical professionals who are end users of blood products. The Blood Law, enacted in 2003, serves as a legislation aimed at ensuring a stable supply of safe blood products. It delineates key principles, including the promotion of non-remunerated domestic blood donations to secure a stable supply of blood products, the encouragement of appropriate utilization of these products, and the mandate to maintain fairness and transparency in managing the blood program. Through the implementation of the wide area management system, our goals were to enhance business efficiency, ensure a stable supply of blood products, build a robust business foundation, and strengthen our safety measures. Ultimately, our aim was to establish a sustainable and publicly trusted blood service organization. Okay, so moving forward, I will illustrate how our organization and activities have evolved following the implementation of the wide area management system. Initially, with the consolidation of testing and processing facilities, you will notice a reduction in the number of sites dedicated to testing and processing, decreasing from 47 to 8. Conversely, the number of net testing sites has increased from 4 to 8. As in this slide, you can observe the equipment utilized in our labs and the evolution of net sample pools over the years. We have introduced automated processes for the processing of our blood products. Here you can see a robot used for automated labeling of blood products, as well as equipment for the automated weighing of these products. Through these advancements over the years, we have significantly improved our business efficiency. We have implemented a nationwide unified IT system that enables our headquarters to oversee inventory management across the entire country. This system plays a crucial role in ensuring a stable supply of blood products nationwide. Every day, a supply and demand management is conducted at a regional level, and additionally, adjustments beyond regions can be made to maintain stable inventory levels and prevent wastage of blood products. Displayed here are the wastage ratios of our blood products and the blood services. Prior to the full implementation of the wide area management system, we experienced wastage ratios as high as 3 to 4% for red blood cells and 5 to 6% for platelet concentrates. However, following full implementation, we observed a significant decrease in wastage ratios, as you can see here. We have established a protocol for managing operations during natural disasters, which are frequent occurrences in Japan, such as earthquakes and typhoons. So under the supervision of our headquarters, other blood centers and neighboring local blood centers offer assistance to affected centers. This assistance includes supplying blood products and providing support with human resources as required. With the implementation of the wide area management system, we have achieved a robust business model. If you examine our financials, you will notice increases in expenditures shortly after implementation, largely due to the construction of new facilities and recruitment efforts, resulting in a temporary decrease in our balance. However, 4 years post-implementation, our balance turned positive, and we have since maintained this trend. We are confident in the sustainability of our robust business model. This graph illustrates our revenue in 2021, totaling $1,185 million. It's evident that nearly 90% of our revenue is generated from the supply of blood products, with an additional 8.5% attributed to the supply of plasma for fractionation. This graph depicts our expenditures in 2021, amounting a total of $1,104 million. The largest portion of our expenditures is allocated to blood collection, followed by blood donation promotion, management and operation of our blood centers, blood supply and medical information activities, and blood testing and processing. We have also enhanced the safety of our blood products, as demonstrated in this slide. The number of transfusion-transmitted infectious diseases cases notably decreased, particularly following the implementation of individual net in 2014. So what were the challenges we faced during the implementation of the wide area management system? Firstly, we had to maintain the cold chain during long-distance transportation while reducing costs. To address this, we carefully selected suitable transportation containers, validated them, and chose the most suitable transportation vendors. Secondly, it was essential to ensure we had the right number of staff allocated to both block and local blood centers while maintaining their motivation. To achieve this, we established quality assurance sections at each site to support technical personnel and provided ongoing training and support. And lastly, understanding the needs of medical institutions was crucial. To meet this, we strengthened the role of medical representatives tasked with gathering and providing information from hospitals. We are committed to continuous improvement, and these are the challenges we foresee for the very near future. First, enhancing the accuracy of our blood products, processing and supply estimation. And to achieve this, we are leveraging AI, ICT, and IoT technologies. Improving the blood donation environment is important. So for especially, we are trying to implement measures to reduce adverse events during donation. Accelerating new business development is important. So particularly, we are promoting hematopoietic stem cell transplantation through the activities of our cord blood banks. And maintaining and enhancing the safety and quality of our blood products is also essential. So we are preparing for the implementation of bacterial screening for our platelet concentrates and considering the use of platelet additive solution and pathogen inactivation technologies in the future. Also ensuring appropriate staff allocation, including providing flexible work arrangements tailored to individual lifestyles and placing staff in suitable roles. It will be important. And collaborating with blood services worldwide, particularly in sharing our knowledge and experience. So with this, I conclude my presentation. Thank you very much for the presentation and for the invitation to talk here. Thank you very much.
Thank you very much, Nelson.
Thank you.
Muchas gracias a todos los ponentes.
Thank you very much to all of the presenters. We are now going to ask you to please turn on your camera, and we just have some general questions to finish. I'm going to have one session per person of each of the presenters so that maybe you can respond. We would like to thank you once again for the presentations, for the patience, and also in Japan, I think it's 4 or 5 a.m. I truly thank you for being here with us, and for those colleagues that already left, it's 9:30 in France. So it's just to be able to tell the dimensioning on being able to organize this seminar and to be able to have the support of all of these people. Very good. Well, without a doubt, the positive ends of centralization are quite extensive in reference to the implementation of technology, in terms of the scaling, in terms of the management of costs and others. However, at first, centralization faces different challenges. It would be interesting for you to be able to tell us what are these, or how are we able to manage these challenges, for example, in reference to terms of regulation in countries that are not prepared for this, or how has that all been done? This is in reference to the staff that maybe when there are some processes centralized, such as screening, processing, that has certain difficulties, and also challenges to be able to establish this network and to be able to see situations in reference to things that are centralized for all of these processes, or there are cuts around the production. I would like to begin then. I see here Dr. Nelson Sumo. I will start going backwards with the presenters. Dr. Nelson Sumo, if you would like to make some comment in reference to these challenges at the beginning of centralization. Go ahead.
Oh, sorry. I'm not sure if I understood the question correctly. So,
Sí, estábamos
Yes,
hablando de
of
cómo
course.
se
We're actually
manejaron
talking about
los
how
retos.
the challenges were managed.
The question is how you Spanish o inglés. Vamos a traducir. ¿Tenemos traducción en inglés o no?
no, you can repeat in
Perfecto.
in
Entonces,
Spanish.
¿cómo manejaron los retos
How do we manage the challenges,
legales,
legal challenges,
administrativos,
administrative
de manejo de
challenges
personal
for
al
the
comienzo del
management
proceso?
of staff at the beginning of the centralization process?
Oh, yes. Thank you. We had the reason for why we decided to move for centralization was, as I mentioned, we had the new law that we call blood law in Japan that was approved in 2003, and at this law, the functions of the blood providers and the doctors were clearly defined. So we needed to comply with the law that especially for the blood services, they requested us to provide a stable supply of safe blood products with a domestic demand. So to supply the domestic demand, but to comply with the voluntary non-remunerated donation, and so collect blood domestically through voluntary non-remunerated donation. We had also we had the needs in the blood center because we had 47 blood centers that were conducting all the activities from blood donation, blood collection to blood supply. So we had to centralize testing and processing for our centers, for our laboratories and our processing centers to comply with the GMP and the GQP. So we had all these issues that moved us that led us to move to centralization and of processing and testing. I'm not sure if I asked the question correctly.
Muchas gracias, doctor Nelson. Sí,
Thank you very much,
efectivamente,
Dr. Nelson. Yes, definitely.
parten de una
This
ley
starts from a
que los
law
obliga y los
that
impulsa a
obligates and incites you to be able to
la
develop
centralización. Doctor
decentralization. Very
Camacho,
good. Dr.
muchas gracias, doctor
Camacho,
Nelson.
thank you very much, Dr.
Cuéntanos
Nelson. Dr.
cómo
Camacho,
primero las
how,
ventajas,
well,
volvemos un
the
poco a ese tema,
advantages, I go
retos
back
en
and forth on
torno
this, we
a
know them, but what are the
los aspectos
challenges in reference to
legales,
the legal aspects,
administrativos,
administrative
la reducción de los
aspects
costos
for
de
the recovery
personal
of
físico
costs
y
and
en
of
algunos casos
staff
se da por
if at certain moments it is about mobilization? How are we able to face this? Well, we also developed within our center a process of centralization for the 7 institutions out of the network of Bogota. And at that time, we would be able to connect about 16,000 units. Today, we are almost the triple of this number. The advantages of centralization in reference to economy and security quality are undeniable. However, there are something that is quite complex, which is the fact that regulations and law in our country has not been updated for many years now. And at this time, our country is in a complex change of the health system, and it's called the National Health Reform. However, we have been able to work, and also the centers, in reference to the expenses that we have to be able to provide quality services in reference to molecular testing, radiation of the use of blood products, and also the components to the regions. I think that we've been able to update everything, but I return. We are very much pending on seeing the final results of the readjustments in reference to the process and attention of health in our country. And maybe this is also going to imply some adjustments, financially speaking. What is important is that either way, these components are definitely important and essential in the sanitary systems of any country in the world. And there will always be a prioritization for this to be preserved and maintained in these systems in the countries. And there, of course, maybe we can also include to be able to justify it here how we are able to maintain the quality, the safety, the opportunity, and reference for us being able to consider this important. Every country would have their own dynamics according to the health model, the policies for health, the mechanisms for being able to finance the assistance in health. And there is not a general manner of doing this, but each one of us in our countries are able to identify these needs, and we are going to see an interaction in reference to the level of the ministry of the entities to always be able to see that this is not lost in reference to the development and progress of how we've seen in today's presentations. We are seeing that we are seeing many of these in Latin America, and I think it's very much good in this presentation for the celebration of this International Blood Donor Day. Thank you very much for that. Dr. Wanahisi from Trinidad and Tobago, how do you see on your end decentralization and according to the model of Trinidad and Tobago, how are you see these challenges and how are you able to see that these are going to be faced in reference to reinforcing the centralization of some processes, in reference to what risks and challenges are considered for Trinidad and Tobago as to being relevant? Very good. Well, good afternoon again to all of you. And first, just try sharing the experiences as part of what I was trying to explain throughout the presentation. The blood system here in Trinidad and Tobago is not centralized. The only system that is centralized at a level of the National Blood Bank is the testing system, which means that there is the analysis done of all of the blood samples of all of the blood that is collected in the country, and we are the people that are in charge of saying if the blood is free of any of the 5 markers that we have, and we can definitely see in reference to the list of this blood in the regions, but the blood is not sent to us directly. The blood still in the region, and in reference to being able to see a decentralization of all of the processing, which definitely has an influence in the reference to the levels of the components of the quality of the components in reference to the blood unit, specifically speaking, here in this country to be able to see this technology, considering that everything is done annually speaking here in reference to the components that are losing possibility of being able to create plaquettes, for example. But here in this end, it's about explaining to the people that are here the advantage and disadvantages. About 2 years ago, before COVID, we were able to have a meeting where we were able to explain the advantages and disadvantages of the centralization and decentralization system. However, even with that, this year that just passed by, in the year 2023, we were able to give the capacity to one of the largest hospitals that didn't have the capacity of processing blood. They continue to send us the blood here to the national blood system. We gave them the permit to be able to do this because they had the equipment to do it and everything. This is the greatest challenge that I have, to be able to convince the authorities that the best way of optimizing the process of production and about identifying the blood to be clear for use. But basically that's the main challenge that I have in reference to being able to centralize everything we have to do with production, supply, and thank you very much. How I am trying to work on these ends, well, in the next 3 or 4 months, we should be able to be moving the National Blood Bank to a localization that is more centralized in the country, and we're going to have a laboratory with more production conditions, with more constructive conditions. It's a building that is quite new, where we are going to have better conditions, and therefore we are going to continue trying for them to be able to send blood to the national system, but it is not the priority that the nation has currently. And thank you very much for that. Thank you very much.
Thank you very much, Doctor. And we want to remind you that PAHO and its documents motivate toward the centralization of the sampling or testing process, and that there is an organized system that allows you to control fractioning processes, not necessarily concentrating the blood in one place, but controlling the inventory and the processing. Dr. Gaviria.
Bueno, frente a los retos, nosotros como Roja Ecuatoriana tenemos bastantes retos. El primero
We have
es
many
seguir
challenges. The first one is to consolidate and grow
la cultura de donación,
the voluntary donation culture within our territory. The second one is to strengthen the relationship that we have with the Ministry of Public Health, and especially to work together on the cost of the blood so that we can continue distributing in our network and to continue growing our coverage at a national level. Last year we were in 23 provinces and we want to reach the whole territory and be able to provide safe blood and to collect in the national territory to foster this donation culture. We want to continue working with the ministry on technical regulations in the part of permits for exporting plasma to get hemoderivatives such as, different coagulation factors, and have all the matrices that allow us to apply the controls that the ministry requires and so that they can provide the authorizations, given that we as the Red Cross has a significant surplus of plasma and we want to obtain all the hemoderivatives. And second, continue consolidating the centralization that where we are in charge of all the staff in the territory. And as Red Cross, we moved a lot so that these people could continue working in the National Center, and the people that were in the network had their capabilities strengthened. These are our main current challenges in this centralization process. Thank you very much, Dr. Gaviria. Dr. Carolina? Yes, here I am. So regarding the challenges, well, 20 years ago, when all of this started, the main challenge was convincing the staff that was used to working with one model to change that model. That was something that we achieved first through training for the whole staff, and then the legal backing. Everything that we did was backed by ministerial resolutions, and the blood law helped us. And even today is our legal support so that all these sectors in the country can work on the centralization model. We have started with a hyper centralized model. Then we had to modify it given what I mentioned in the presentation, accessibility routes, the development of health sector in different parts of the country. The points that weren't able to get all the blood products need for fractioning closer to some points. And this is how we're working on this model. And now our main challenge is renewing our blood bank equipment that is becoming obsolete. Thank you very much, Dr. Carolina. We will go to the next question, and I will start with you, given that I have you here. You represent the National Blood Program, but the question is general. In an emergency situation, how do you calculate you will have a response, be it for because of a natural or man-made disaster, or a situation such as the pandemic that is obviously a situation that has a lot of impact? How do you see the participation of the centralized model. What are the important aspects? In the pandemic, we have a reduction, and we saw that the countries that were better organized had a better response. Please, if you could share that your opinion with us. Yes, we do not have, fortunately, natural disasters during the pandemic. What we did was organize into the different production centers, and this is when they went outside of the hospital environment to collect blood, for example, in places like municipalities or schools, so that donors would not fear the hospitals. The blood was then taken from one point of the country to the other according to the needs or surplus. And I don't know if you'll remember, in 2001, we did have a significant catastrophe, and this was a fire in a supermarket where about 400 people died. And well, in that time, the citizens did donate a lot of blood. And all of the centers in the capital, because that was happening in the capital, started working 24 hours a day, 7 days a week, so that they could collect the blood in determined points. And of course, in the fractioning centers, they received the blood to be fractioned, and this was sent to the hospitals where it was needed.
Muchísimas gracias, doctora
Thank you
Carolina.
very much, Carolina.
Vuelvo con el doctor Gaviria.
I'll go back to Dr. Gaviria.
¿Cómo apoya al Estado ecuatoriano la Cruz Roja en la respuesta a la emergencia?
How does the Red Cross support the Ecuadorian state in a situation of an emergency? Well, we do it in several ways. First, we are part of the group 9/11, and this is when you activate the security tables in the Ministry of Health and in the government. We become part of that organization. As you know, Ecuador is a small country, but we have mega diversity, and we have already faced many challenges in the last year. We have had violence, we have had the jail crisis, we had an earthquake in the border with Peru between Machala and Cuenca, we had floods in 3 provinces, we had Chimborazo, and we have also had social protests. For each one of these events, there's an operational plan where we're trying to plan how we're going to respond to the event. It's a little more complicated for us when it's social protests, when the country became paralyzed because the roads are closed down and there's a lot of difficulty with the logistics, but we were already doing work with the armed forces, the police, and the firefighters, and donation is planned so that we can cover by air, and the police or the firefighters and the armed forces help us with that. And the Red Cross is an institution that helps and is prepared to support in emergencies, not just as the national association. We also work with the Federation, the International Committee of the Red Cross. So when we have problems, what we do is we rent say to create an emergency and response center, and we can get more collection points that are extramural, and we can respond, for example, to the violence that the country was experiencing. We also have other strategic strategies and allies, such as the Embassy of Japan, that allows us to set up a collection point. So for each event, anytime that something happened, we create a document and a response protocol that is implemented.
emergencia.
And this is how we respond to the different emergency events. Thank you very much, Dr. Gaviria.
Doctora Moreno.
Dr. Moreno,
¿Cómo prevén la atención a una
how
situación
do you
Trinidad y Tobago?
estimate you will respond to an emergency situation in Trinidad and Tobago? In Trinidad, here, fortunately, we haven't had many disasters such as those or emergency situations, but we have had situations where there's been local floods. And about 2 or 3 years ago, there was an earthquake. And in that case, given that blood has localized components in each region, the hospitals are able to supply themselves at that time, and the national blood system, in coordination with the Ministry of Health and the rapid response institutions such as the Red Cross, the firefighters, and the police, they move, and we try to, depending on the needs and the location of the disaster, we try to identify where we can provide the most support, and we organize transportation systems, and we send the units and the necessary components for emergency situations. And this is how the rapid response is organized in emergency situations, because we do not have a big organization, given that we don't have high numbers of donations. So this is how we have tried to act. And fortunately, as I said, we don't have too many disaster events. And this is how the response system is organized for this type of event. Thank you very much, Dr. Moreno. Dr. Bernardo Camacho? Our country is subject to disasters. We've had earthquakes, dramatic earthquakes that have destroyed some big cities in our country. And I would like to reflect on something. When we have these catastrophes, we have an excess in blood donors. We have to organize them. They are trying to, the population expresses its sense of solidarity. They ask themselves, what can I do? This is something that happened 24 years ago in an earthquake that we called El Cafetero. And we had this experience of having people standing in line for 8 hours to wait for a turn to donate. So what we have to prepare is the capacity to collect and the necessary ingredients and reagents, and of course a plan. And we have this in our institute, and we are prepared to have 10 to 14 days to collect and send blood to a territory that has a disaster situation. And given that we have more than one blood bank in the country, it's important to have coordination amongst the banks that has the best response capacity because of logistics and mobile units, personnel, etc., etc. So I would say that in general terms, in situations that has happened, and Colombia also has a violent situation with violence, we are provided responses that I would consider acceptable, centralizing in the blood banks in our country, and some have more reserves than others. And I would say that coordination that is done by the National Health Institute is fundamental to have an organized national response so that we do not have more donations than we need to waste the blood. So I would say that can be organized progressively depending on the characteristics of the country and the capacities that the centers have to collect, and a good centralization in terms of national coordination. And in Colombia, this is in the hands of the National Health Institute that coordinates with the blood banks. And in Bogota, we have district coordinations, and we have plans for disaster situations, emergencies, etc.
Muchísimas gracias, doctor Camacho.
Thank you very much, Doctor.
Doctor Nelson.
Dr. Nelson, you mentioned something about Japan. Obviously, Japan is a country that suffers earthquakes. So can you tell us about how you manage those emergency situations, such as an earthquake? How do you support the state from your organization?
As I mentioned, Japan is a country of natural disasters, so we have earthquakes very frequently. And so for this, we have a protocol for the management of operations during these periods. Our national our national headquarters, they coordinate everything. Recently we had a disaster in Ishikawa Prefecture. So when the local blood center has to stop their operations, we have to cover, especially we need to provide support by providing blood to their center, because if the centralized center for testing and processing stops, they cannot produce blood in that region. So other regions, they provide support. So other regions, other block centers that are consolidated centers, they provide the blood products to these stopped centers. And the blood centers that distribute blood products, they have to continue their operations. So, and in case there are issues, we provide human resources. So people from neighboring blood centers, they move to these blood centers to help them in supplying the blood products. So this is a very efficient system. So and this could only be achieved because of the consolidation of testing and processing, and because of the wide area management system, because we are only one blood service operator in the whole country. So our headquarters can supervise and they can check everything in the whole country. And this was very efficient also during the COVID pandemic, because we had very difficulties in collecting blood, especially in metropolitan cities like Tokyo. So Tokyo, we had a very the number of donations decreased very importantly. So other regions, they covered these deficiencies. So blood products collected in other prefectures, other regions, they were supplied to Tokyo to cover our demand. Yes.
Muchísimas gracias, doctor Nelson.
Thank you very much, Dr. Nelson, for your answer, and we'd like to thank all the speakers. This was the last question, and the experience during COVID showed that the countries that are not just centralized, but organized, that have a general national coordination, a program that lets them know what the inventory is and can coordinate an answer, had a faster recovery. So we'd like to thank all the panelists for dedicating this day and this afternoon, for participating in the seminar. In the name of the Pan American Health Organization, we'd like to thank everyone. We'd like to thank all the attendees, everyone from the ministries. We'd also like to thank all the speakers for the support in providing their information. And something else that is important, what we're celebrating today is the day of the voluntary donor, but that voluntary donor has to have the necessary conditions to be able to donate. And I think that you have provided support via information. And from the Andean Regional Health Organization, we'd like to thank you. Hi, good afternoon. Thank you very much. Congratulations to the speakers for their efforts and the quality of their presentations. And I think this is a challenge for the Andean entity. The 6 countries have a lot of goals and a lot of challenges, but I think that we have to work together. Thank you, Pajo. Thank you, Ministry of Health. And I'd like to thank all the ministries that are participating. And we'd like to thank all of you. Thank you very much. We thank the speakers. Dr. Nelson, we hope you have a happy rest of the day. You're just beginning your day in Japan. To the rest of the speakers in the Caribbean, Dr. Moreno, Paraguay, Dr. Carolina Molas, Colombia, Dr. Camacho, Dr. Gaviria in Ecuador. Thank you very much to all of you. Dr. Teixeira in Brazil already left, and our French friends already left also because it's midnight over there. So thank you very much for helping with the seminar. We hope that we can stay in touch, and we would like to thank all the attendees. We'd like to thank the translation personnel, logistics personnel, and everyone else, and Pajo, Ana, Freddy, Marcela Garcia, Ana Menjivar in Washington, and our colleague Freddy here in Peru. We'd like to thank all of you. We hope to see you again and have a happy rest of the afternoon.
Gracias.
Gracias.